First, I want to say welcome to Ideals. I've been told that maybe I'm a little, my microphone is a little quiet today, so if you can't hear, please do say so in the chat, and we'll see what we can do. I'm just going to lean in, and hopefully that will help, but we'll see. Let's see. The, sort of, I wanted to start off with something that I don't think we've really done very much of yet, and that's to sort of talk a little bit about the Institute for Information Literacy at Purdue. So, of course, this is the IDEAL Symposium, which is the Information and Democracy, Education Access, Libraries, and Society Symposium, and it's hosted by the Institute for Information Literacy at Purdue. And I thought I'd just sort of give a little background on the Institute, but then also talk a little bit about this year and how we came up with the theme that we did. So let me kick that off. But I wanted to take a moment actually and sort of back up and, recognize that it is the 50th anniversary of information literacy, right? So, as Paul Zurkowski in 1974, coined the phrase information literacy as, that you often see at the beginning of articles when introducing the idea of information literacy. But, he was writing about that in a government report that he was preparing. It was talking about the need to, prepare the workforce for working in, an increasingly information-rich environment. And so he coined that phrase, and it was, sometime later that librarians, really took that concept and, turned it into, educational offerings that, led to what we're doing today. And actually, Paul Zurkowski was the keynote at the European Information Literacy Conference some years ago, a few years ago. He passed away recently, but, he said something like, he was talking about sort of coining the idea, and then he said, but at the time, I had no idea that, the library community would take this idea and run with it so far, right? And so, so I think he was a bit delighted with all the work that came after his initial, sort of thinking about what information literacy might be. And then, I think, and there's so many, but I just wanted to sort of highlight, librarians who really championed this idea of information literacy, like Patricia Breivik, right, who was a librarian and wrote a book about how we might approach teaching students to use information in higher education, but also founded with others the National Forum on Information Literacy. So, that was, I believe, in the 80s and early 90s. And I think, the work of her and many, many, many other librarians was sort of fundamental in, turning this idea of what should happen into, strategies for what would happen, what could happen, in higher education and in all education, right? And of course, that led to the creation of the standards, and that we, many of us have different feelings about the standards that were rescinded in 2015, 16. But I still think that was a notable and important, kind of mark in the history of information literacy as, moving it from, sort of an idea that different people worked with to, something that was, more structurally cohesive, right? That we as a field were talking about how to do this. And of course, that led to, many years later, the framework that many of us use now. In my own work, I'm working with a group with my colleague Karen Kaufman, talking about how we should recognize information literacy as a discipline and kind of the implications that would have for our work in the field as educators and researchers. So I think information literacy's had this amazing journey, right? And I love the idea that the Institute for Information Literacy is sort of plopped down in the center of a really interesting and rich conversation that's going on. And so let me tell you a little bit about the Institute. We started it a couple of years ago. And I mean, the idea, it won't surprise anyone, I think, but I was, looking at kind of what was going on in the United States and in the news and things, and thinking about, of course, I tend to think about the world through this lens of information and information literacy, and kind of looking around at all the things going on that were around misinformation and disinformation, and all the various information challenges that seem to be coming up, that I think in my experience anyway in the past were less a focus, and then suddenly they were a national focus of our society, and things that everyone was talking about. And I thought, well, this might sound a little silly, but I thought, well, what can I do, right? How can I, sort of help address these challenges that we're facing as a society? I am a professor at a, research university, but my work has always sort of tended to focus on what happens in the classroom, right? So how are students learning to use information? How are people teaching students to use information? And so I started thinking thinking about, what would that look like? If we could take it outside of the classroom, what would it look like if we, if the work that the research that librarians are doing, and many others, right, if we were coming up with models that were kind of enabled people to help address these information challenges out in the field, right? So information literacy models. So that was sort of the kernel of an idea that led to many conversations with my colleagues, and then eventually the founding of the Institute. And the Institute's purpose is to support research that really explores the role of information literacy in addressing information challenges, like misinformation, or things I think when I think about AI, I think that it's an amazing opportunity, but we of course know that it also poses some challenges around the use of information. And so I think those are the sorts of kind of things that the Institute is interested in exploring, but also then hopefully coming up with solutions. And I think, a lot of people in the world, a lot of researchers in different fields are studying information challenges, but what I think makes the Institute, unique, or what it's trying to do, is really to tie that back then to, solutions or information literacy, models and frameworks that we might apply or use to address those challenges in our society. So you see on the little wheel here, and I hope everyone can hear me, these are some of the projects that the Institute has been doing. And so at the top, so the first thing we did was we offered seed grants to researchers or research teams who were kind of starting new projects that would explore this very idea of, the role of information literacy in addressing some kind of information challenge. And I'll tell you a little bit more about that in a minute. We developed an annual award that you'll hear about today, our award winner for the year. And I'll talk a little bit more about that. And we developed a couple of programs. Partners for Algorithmic Literacy was a program that we piloted this year, and we're planning to hold again at Purdue. And it's an interesting project where, we partnered students with faculty to think about what they could do around AI in their classrooms. And I'll tell you a little bit more about that in a minute too. We've held some art exhibitions. So the first one was last year, it was in person at Purdue. And then this year we have some artists who are sharing virtual artwork with us through our website. And then you'll hear about this. I'll talk a little bit about it. And then also you'll have the students presenting later in the day about an undergraduate research lab that we created. Again, where we have students research these sorts of problems, right? So, thinking about, what are information literacy models that or informing information literacy models, maybe is a better way to say it, that address, information challenges. And so exploring those challenges in a way that kind of informs what we might do in response. And then, of course, the other thing that we do is we're doing right now. So hosting the IDEALS Symposium. It's the second symposium for us, and we plan to have it annually. And let me just pop on. So I'm going to talk about a couple of the projects, and then I'll swing back and talk a little bit about today and what we're trying to do with this particular symposium. Okay, so this is the team, and you might see some of them on your screen. So Rachel Fundator is the Associate Director of the Institute. Samantha Legrand, who couldn't be here today, but she has been instrumental in, she led the team that sort of gave out the publication award, and she's really an instrumental part of our team at all times, and in putting together the symposium. Aly Edmondson and Secret Permenter, so and B over B, and so Secret and B are graduate students who work with the Institute, and B in particular has done an amazing job this year of organizing us and putting together the Institute, and so I'm really appreciative of her work. And then we also have an undergraduate student, Ben Weiss, who works with the Institute as well. And then we have, this is our second year, so we're just starting, but we have two fellows. So one is Michael Flierl from the Ohio State University, and he'll be facilitating one of the sessions today. And Matt Hanna, who is one of our seed grant recipients the first year. And Matt's work sort of is very spot on for the Institute. Like he kind of led an interdisciplinary team to begin to form a new model that he thought would be more responsive to the kinds of information challenges that we see, particularly around sort of conspiratorial thinking and things like that. So that's the team, that's the group, and I feel very amazed every day that I get to work with these people. They're just doing phenomenal work. So the seed grants, so we gave them out in 2022, and then we're going to give out another round of them this year. And as you can see here, and it might be, I'm wondering if what we'll see as we keep on giving out the seed grants is that there are sort of themes that rise up that are important to people. And so a lot of the applications sort of focus around that. But you'll see here that if you look at the titles, that three of these projects really focus on, in one way or another, on conspiracies, right? As I just said, so the group from Purdue was led by Matt Hanna, and but was focused on sort of like what would be an information literacy model that would disrupt, for lack of a better term, QAnon approaches to doing research, sort of things like that. And I think the other two projects are much more focused on libraries and how libraries can address sort of different aspects of conspiratorial thinking, et cetera. And then we did have a fantastic project from Pakistan. It was actually a collaboration between a researcher in Pakistan and the researcher in Canada that looked at, I guess, sort of information ethics and the handling of information in academia. So particularly in health sciences. So really great and fantastic work. They've kind of come to the end of their grant cycle, 2 years, and they've all produced some amazing things, and have started publishing on it. So we'll all, and some of it's out there already, but we'll all be kind of looking to see what those folks are producing on their next research projects. So students as partners, I talked about this, and this was it was like a learning community that we put together. Oh, I'm sorry, I'm talking about the wrong one. This is actually our year-long undergraduate research program. And I love this picture. These are 3 of the students in the program giving a poster, I think like a couple of weeks ago at our undergraduate research conference on campus. But really it was amazing. So you're going to hear more about it, and particularly about their findings. So the students are going to present in the afternoon. So Rachel Fundator took the lead on developing this program, and it's a year long. It's sort of the students enroll in 2 courses, one each semester, and they really just go through a research project by investigating the topic in the first semester and then gathering data analyzing it. And then, of course, now we're at the point in the year where they're sharing out in various forms, including what you'll hear today. And it's really been amazing to work with them. And I think sort of the idea that I wanted to sort of drive home is that, in sort of supporting research, investigating information literacy models, we started with researchers, but then we thought, okay, we want to kind of create a sort of pipeline of people thinking about these ideas and having tools in their toolkit to address them. And so that led to the idea of, an undergraduate research program. So kind of backing up and thinking, how do we get, another generation sort of interested in these kind of problems and understanding them in a different way. And it's just been really phenomenal. And as I said, this afternoon, this afternoon you'll be hearing about their findings. This is the project that I started off talking about. So Partners for Algorithmic Literacy is another program that we did. It was a pilot last in the fall, and we're going to do it again next fall. And this project was, I think what was most interesting about it was this was led by Samantha LeGrand, our colleague, and she brought to it a students as partners model. So really it was about pairing students with instructors, and the instructors were thinking through how they could address AI in their classrooms. And sometimes that meant, like a very rudimentary thing, like I don't want my students using AI tools to complete their assignments, what do I do? And then other times, there were instructors who were using a lot of AI tools, and they just wanted to think through the ways in which they would sort of use them with the students. But basically, the idea was that as the instructors sort of thought about what they could do differently and how they might approach that work, then they worked with a student and got a student perspective on what that meant. Well, some of the interesting things I found about it were the faculty by and large were fairly open to the idea of AI in the classroom, not entirely, but for the most part. And some of the students were very resistant to the idea of the use of AI in education. So it kind of made for this interesting pairing that I don't think we expected, but it did make for a very rich conversation. And then the outcome was assignments that the instructors would implement in their courses. And of course, we emphasized the students as partners model. So the idea was, you go into your classroom and do something with your students to help think about how this can all work, right? So one example is, if you're worried about how your students might use AI in completing their assignments, one approach might be to, have make it an exercise where everybody explores that issue and then comes to class and talks about it, and you co-create the instructor and the students a policy around how you're going to deal with AI in your class. So that was actually one of the ways someone handled it. And it's really interesting. I think it's a model that we should all be thinking about. Like, how do we bring students into the conversation of their own education? Okay, so now I'm going to talk for just a couple of minutes about the symposium. And this year the theme is information and identity. And it's just thinking about how did I come up with that theme? And so I should say that yesterday my wife said to me, yeah, the real question, the big elephant in the room is why wasn't the symposium about AI? And I just sort of stared at her like, but I mean, I think obviously AI is one of the big challenges and opportunities facing us. And I suspect that the Institute is going to do some work around it this year. And I think that possibly next year, that would be our theme. But this year, the theme was sort of motivated by, and again, maybe it's that moment in time, but I was sort of looking around at, the news and the things that I saw happening in the US and other places too, and thinking about this idea of sort of how information is very often sort of weaponized against particular groups, and by that I mean like sort of either used in a disinformation way to maybe control what happens, influence what happens, and also in the the sort of redaction of information, the sort of not willingness to share information that would be beneficial to certain groups. And I was thinking about that and sort of struck by it and thought, the Institute, of course, as I just said, the goal is really to sort of, come up with models that help people overcome the challenges and help them accomplish, the things that they're trying to accomplish in the world. And so in thinking about that, it sort of came out as the Institute has an opportunity then to, explore information and information literacy, in relationship to, to identities, right? So sort of examining, the challenge of weaponized information, but also then thinking about, how can we use information to be, for lack of a better term, successful, right? To sort of accomplish the things that we're trying to accomplish in the world. Okay, so the agenda. So in a few minutes, we'll hear from Dr. Megan Threads. I'm very excited about that talk, and I will introduce her shortly. And then following the keynote, we'll hear from 3 researchers, and again, sort of focusing on identity. So Ellie Abdi will talk about her research with refugees. Oops, I'm sorry. We're going to hear from Chelsea about, sort of barriers, of Black women, in relationship to information access and use. And then we'll hear from Jessie Loyer about, Indigenous sort of information in relationship to, Indigenous interventions. So I'm very excited for that programming, right? And then we'll take a lunch break, which we'll probably need a brief one, but at that point. And then when we come back, we will kind of share some more things about the Institute. So we'll hear again from those undergraduate research students about the work this year. We do have 2 artists who were showcasing some of their work on the Institute website, and they're going to talk to us a little bit about their work. Then we'll have our award ceremony, which is, of course, we've already given out the award to Elena Musi and her group. She was the lead author on the paper, and she will give a talk about that work, and then that will kind of finish that off with the day off in an exciting way with hearing from our invited speaker, Dr. Michael Ann DeVito. So I think it's an amazing lineup, and I think that I think everyone will. I'm so looking forward to it. I think that I'll learn a lot, and I think all of us will, as we sort of engage with all these different ways of thinking about information and identity. Jumping along. So just a quick housekeeping things. I guess if we were in person, I'd be saying, the bathrooms are out the hall, down the hall to the left. But since we're virtual, I'll just say a couple of things. So we are recording the sessions. So we just wanted everyone to know that. We will put up excerpts from the sessions on the webpage later. We would appreciate it if you would keep your microphones muted unless you're going to speak. Of course, and we were thinking, because we have a fair number of people who will be attending throughout the day, that it would be best if people put questions in the chat. But if you really want to ask your question in person, please raise your hand and we'll call on you and you can do that. And as you put your questions in the chat, whoever's moderating the session will read out the question, and then the presenter can answer it. And then here is a QR code to the full schedule of today's sessions, and you can also just find that on our website if you Google Institute for Information Literacy at Purdue. Okay, with that, I'm going to stop talking and stop sharing my slides. I did want to say thank you, and I hope that you enjoy today. I wanted to say welcome, Dr. Threads. It's exciting to have you here today.
And apologies in advance if you hear any barking. My dog is very curious to know why I'm at home right now. So if you hear him, that's what's going on. So yeah, but I'm hoping that he chills out.
No worries at all.
Okay.
Okay, well, we are at time. So how about if I go ahead and introduce you briefly, and we'll turn it over to you. So, well, For those of you who weren't here for the sort of introductory session when I talked a little bit about the Institute, I'm Clarence Maybee, and I am the Associate Dean for Learning at Purdue Libraries, and of course, maybe more salient for today as I'm the Director of the Institute for Information Literacy at Purdue. And today I have really the amazing honor of introducing our keynote speaker, Dr. Megan Fritz. So Dr. Threats is an assistant professor in the School of Information at the University of Michigan. And she's also an affiliate at the Center for Racial Justice at the University of Michigan's Gerald R. Ford School of Public Policy. And I think we should applaud. She's also a recent recipient of the Early Career Research Development Grant from ILMS, or the Institute for Museum and Library Services. So that's awesome. Let's see. The Dr. Threats research examines health information practices, multi-level determinants of health, and information inequities among historically marginalized communities. And as she's going to talk about in her presentation today, her research program advances the use of intersectionality praxis, so theory into practice, and methods for doing that, along with community-based participatory practices. And so she brings these two approaches together collaboratively to develop and implement informatics interventions and to inform consumer health information and technologies. So it's really just amazing work. And we're really lucky to have her here to sort of share it with us. Her work addresses the effects of intersecting discrimination, including but not limited to racism and sexual orientation and gender identity discrimination. So with that, please join me in welcoming Dr. Threats.
Thank you so much for the warm introduction. And I want to just start off by saying I'm really just delighted to join you all this year as a keynote speaker for Ideals here at the Institute for Information Policy at Purdue. You probably already talked about this earlier in the symposium, but the theme for this year's symposium is information and identity. And this morning, I'll be speaking with you all about how systems, structures, and institutions specifically shape how communities that have historically been marginalized access and interact with information and services within the health domain. The title of my talk, as you can see, is Information for Health Justice, and I'll be talking a bit more about how I have incorporated intersectionality theory into studies of health information practices. I'll speak with you about why I see health justice as a goal to my research and why it is important for information professionals and researchers, and how we also can utilize intersectionality as an approach to achieving health justice, which for me includes dismantling policies and practices within institutions that perpetuate not only health inequities, but also information inequities, and how we can empower communities to use information in ways that support their health and well-being. So let's jump right into it. So what exactly is health justice? Quite often when people hear me say health justice, they're like, well, what's the difference from what's the difference between health justice and health equity? So I'm going to talk to you about what health justice is. So Elang and Blackstock define health justice as a paradigm and collection of actions that interrogate systems, structures, and as well as social, political, economic, and cultural institutions, as well as networks of relationships that, although have become normalized, create and perpetuate inequities, empowering access to resources that matter for health, including the ability to engage what are deemed as healthy behaviors. And it's different from health equity in that it extends beyond removing obstacles and beyond giving everyone fair opportunity to be healthy, to thinking more specifically about liberation, thinking about health justice as seeking liberation, seeking restitution, as well as the advancements for communities who have been hit hardest by legacies of marginalization. So this is setting, this includes, helping to set folks free from oppression or imprisonment, and restitution refers to the restoration of something that has been lost. So as you're thinking about these definitions of liberation and restitution and how we can advance communities with the goal of, achieving health justice, kind of think about what that might look like within your historical institutions, whether that be a university or a library or an archive. Think about the collections, how those collections came to be. Think about the communities that you serve, and think about why are certain communities served or not served, and just kind of keep that in the back of your mind. So when we're talking about health justice, and specifically within the context of information science, I want to kind of call attention to one of the similar researchers who has done work in this area. But before I jump into speaking to you a bit more about Dr. Beth St. Jean, I want to talk to you about health information behavior research. So there has been substantial research exploring health information behavior and practices, as well as connections between the role of information, and specifically when you quite often in the field of information and library science, when you see studies of health information behavior and the role of information in achieving health equity or health justice, quite often people focus on things like health literacy, right? How much knowledge is someone, or health knowledge, how much knowledge that someone has, how prepared are they to properly make assessments about what is true or what is not true as it pertains to different types of information, and specifically the connection between health literacy and self-efficacy. So how prepared do they feel like they are to use the information that they find, or the information that they obtain, to make decisions that improve their health behaviors, particularly health behaviors. There has been far less attention paid to the concept of health justice within the field of information science, save for Dr. Beth St. Jean, who is an associate professor at the University of Michigan. She's a graduate of the University of Michigan. She did her PhD at the University of Michigan, but she's now an associate professor at the University of Maryland College of Information Studies. So she's one of the few scholars within our field who has explicitly discussed the role of information and the importance of information in the goal of achieving health justice. In one of her articles, she recently stated, to have a sufficient and equitable capability to be healthy, one needs fair and equitable access to a wide array of resources and opportunities. Information is very clearly one of the central resources to which one needs both physical and intellectual access in order to have a sufficient and equitable capability to be healthy. And so this is very promising and exciting to see. This article was written as part of a special issue that kind of talked about the role of information in health justice. And while it's promising that there are more scholars who are taking a justice-oriented approach to studying information practices specifically, traditionally, most studies have failed to adequately encompass the factors that shape information practices of communities, and in turn, their engagement or lack thereof within institutions and structures. And so I just kind of want to talk a bit more about some of the conventional theoretical approaches that we see when it comes to studying health and information behavior. So I've found that conventional theoretical approaches to health and information behavior have been inadequate. So some of the most prolific or the most recognizable that you might see if you're familiar with like public health or health behavior might be the health belief model or the social cognitive theory. Within the field of informational library science, you might hear quite often information poverty, and most recently, an improvement upon that has really kind of put us in new directions to kind of holistically think about communities has been information marginalization. So that has been in recent years, in my opinion, the most holistic theoretical approach to thinking more efficiently about how information practices are shaped by systems. And so something that, one of the reasons why I've kind of found that historically, some of these conventional theoretical approaches to studying health and information behavior, I recognize that quite often these conventional approaches, one, prioritize individual level behaviors or factors, and especially focusing on, when you're in the field of public health, they quite often focus on biomedical or biopsychosocial factors. So focusing on the individual and not really focusing on the factors external to the individual that shape why they make individual choices. Two, quite often they center on deficit-focused behaviors and practices. Three, quite often they use a single axis lens. So it's either sexual orientation or disability, or race and ethnicity, or your immigration status, right? And then finally, they don't often address structural inequality or issues of justice, or they center quite often when you're looking at information practices research, the study group that is being focused on is quite often the most privileged groups within within a population, or the most privileged groups within marginalized populations, quite often because of their easy proximity to their easier close proximity to the person who's conducting the research. So why should you care about all of this? And how can we help achieve health justice as researchers and as information professionals? So so what I'm talking to you about today is my solution, I believe, is intersectionality. I believe that intersectionality is the approach that we can use as practitioners and as researchers to better get an understanding of how we can be information for health justice. So what exactly is intersectionality? And quite often as I'm reading literature, it's clear that there has been a bit of a misunderstanding about what intersectionality is. So here I've presented my definitions of how I understand intersectionality, which I define as a theoretical framework and critical praxis guiding analysis of power and oppression. Intersectionality refers to the idea that intersecting systems of oppression based on mutually constructed and interdependent social identities such as race, gender, class, disability status, and sexual orientation shape human experiences. Intersectionality advocates moving beyond single-axis analytical approaches to holistically accounting for multiple interlocking axes of power and inequality that operate simultaneously to disadvantage or advantage various populations. And I wanted to make that distinction clear because quite often when you're looking at studies of intersectionality, it focuses primarily on communities that have been historically marginalized, but I argue that intersectionality can also be used to understand various populations and the different levels of power and oppression that you might experience as an individual who has multiple, identities that make you vulnerable for mistreatment, or identities that might privilege you within some of these systems. So thinking about that is something that I want to have you keep in the back of your mind. When thinking about intersectionality, I want you to be mindful that we want to transition from this, as I mentioned earlier, single axis thinking to a more complex understanding of the intersectional inequities that individuals in communities face. And you don't want to use an additive approach, but instead you're looking at it through a matrix. So here I have Dr. Patricia Hill Collins, who is a distinguished university professor at the University of Maryland, and in one of her seminal books titled Black Feminist Thought, Knowledge, Consciousness, and the Politics of Empowerment, states that additive models of oppression are firmly rooted in the either or dichotomous thinking of Eurocentric, sorry, give me a moment, of Eurocentric masculinistic thought. Replacing additive models of oppression with interlocking ones creates possibilities for new paradigms. The significance of seeing race, class, and gender as interlocking systems of oppression is that such an approach fosters paradigmatic shift of thinking inclusively about other oppressions such as age, sexual orientation, religion, and ethnicity. And I'll add that this not only applies to, as I said earlier, how systems of oppression impact individuals, but also how varying levels of power and privilege sometimes benefit certain communities as well. So when we focus on an additive or a single axis lens, we miss the complexity of a lived experience. So if you have, for example, a study that focuses on outcomes for Black individuals or for women, you miss Black women in the middle. Or when you do studies of health information practices that might focus on LGBTQ communities as a whole, if you don't also focus on race, you miss some of the nuances that might differ for individuals within those communities. So here I'm making the argument that intersectionality as a framework, as a paradigm, as a theoretical like approach helps us to better understand the complexities and lived experiences of community. So something I really want you to keep in the back of your mind, if you take nothing else from this talk today, when you're trying to figure out, well, what makes intersectionality so unique and what exactly is it? I really want to drive home the focus on systems and not identities. It's not necessarily about the identities of individuals, but specifically the systems that make people vulnerable for mistreatment, or that the systems that are set up that have made these social positions or identities prominent. So the problem isn't race or ethnicity, it's racism. The problem isn't your ability status, it's ableism. The problem is not your gender identity, it's transphobia or it's colonialism. So you're focusing more so on you know, when you do focus specifically on identities, Dr. Greta Bauer, who's a prolific quantitative intersectionality research, she states that you run the risk of continuing to reinforce the intractability of inequity, albeit in a more detailed or nuanced way. So when you focus on identity, you kind of miss the nuances of the systems at play that make people vulnerable for various reasons. And when you focus on the systems, that gives you a more holistic understanding of what is actually going on. So you heard me at the beginning of the talk kind of describe intersectionality as a practice, but also as a critical theoretical framework or approach to doing research. So when I'm thinking of intersectionality as a critical framework, I want to talk about its historical roots in the writings and scholarly production of Black women, and specifically people like Harriet Ann Jacobs, who in her work titled Incidents in the Life of a Slave Girl stated that slavery is terrible for men, but it is far more terrible for women, right? And so I also want to think about people like Anna Julia Hayward and Barbara Smith and the other founding members of the Combahee River Collective, people like Audre Lorde, and later Black gay men such as Exit Hemphill, who in his work Brother to Brother stated, we must be willing to embrace and explore the duality of community that we exist in as both Black and gay men. So here you kind of see you know, scholars who are starting to kind of talk about this, these intersectional lived experiences and the duality of having these multiple stigmatized identities that are shaped by these intersecting systems of oppression. And of course, one of the people who is most noted for intersectionality and coining the term specifically is a legal scholar, attorney, professor of law at UCLA, Dr. Kimberly Crenshaw, whose work you know, specifically highlighted the disparate outcomes of Black women in the legal system. So these are kind of things I just want you to, these are the people that I want to call to mind when you're thinking about the history of intersectionality, not as something that just started in 1989 or 1991, because when we focus only on what has been produced in scholarship, we miss, sometimes we miss kind of like the history and the long road that it takes to get to this point of calling intersectionality a theoretical framework, and that can eventually become a theory. So when I'm thinking about critical theories that include not only intersectionality, but also critical theories, quite often I think that critical theories aim to transform systems that facilitate oppression, but they also reveal, interrogate, and challenge the status quo. And they're theories that don't just seek to improve the system without first questioning and challenging the system. So that's something that is central to intersectionality and as a critical theoretical framework. So some of the core tenets of intersectionality that I want to highlight include 1, inequality, 2, power, 3, relationality, 4, social context, 5, complexity, and then 6, social justice. And I believe that this is being recorded, but if you want to take a moment to take a screenshot, these are the core tenets of intersectionality that I want to talk to you briefly about, and why, you know, kind of exploring these tenets in your work as concepts to kind of think of as practitioners and as researchers are really important. So first, when I'm thinking of social inequality, I'm specifically thinking about discrimination, marginalization, and stigma, right? So that's what I'm talking about when I'm talking about social inequality. When we're thinking about power and privilege, we're focusing on how power and privilege are differentially situated at different intersections, and they specifically examine interlocking power relations. So in this case, when you're thinking of things like classism and racism and how those interlocking power relations shape the lived experiences of communities. 3, when I'm thinking of relationality, intersectionality, that is emphasizing you know, the notion that social positions such as race and gender cannot be separated, right? You cannot separate those things out. You have to think about them wholly, and how those things are related to each other. So as you saw earlier, I specifically talked about how intersectionality should not only be applied to looking at systems and how they disadvantage people, but also how they can advantage people. And then also looking at the different intersections of social positions. So this could be, you may have someone who is a wealthy queer person, right? How might that impact their lived outcomes? How might them being queer, identifying as queer, how they still might face certain disadvantages, but how wealth can sometimes also be something that you want to take into account. So those are things when I'm thinking of relationality, thinking about how you can't extract those things from individuals, but you have to look at them holistically. And then 4, social context. So the when and where intersections matter most. You want to pay attention to those things. And then finally, in defining the last 2 core tenets of intersectionality, complexity. So how categories operate at different domains of power, whether that be structural or cultural. And then this is also referring to methodological complexities and how they, how they operate at various domains of power. So thinking about that. And then finally, social justice. A core tenet of intersectionality is exposing and challenging inequities and seeking that restitution that I talked about at the beginning, seeking that liberation and finding better ways to advance communities. And I'll talk a bit more about how I see how the role of how we can incorporate health justice into information science approaches to achieve that. So when applying intersectionality, 2 really incredible legal scholars and researchers we have here, Kimberly Crenshaw, JD, and Dr. Simone Choi, who's also a JD. They wrote a really excellent piece that I'll have cited at the end that kind of talks about what it means and how we could go about applying intersectionality. But Cho, Crenshaw, and McCall state, what makes an analysis intersectional? Whatever terms it deploys, whatever its iteration, whatever its field of discipline, is its adoption of an intersectional way of thinking about the problem of sameness and difference and its relation to power. So just kind of marinate on that. It's thinking about sameness and difference, but the key word here is power, right? I'm thinking about that. How does power play into everything that we do, right? Another thing that I want to call your attention to when you're thinking about intersectionality, I bring you back to Dr. Patricia Hill Collins, who states intersectionality is not simply just a field of study to be mastered or an analytical strategy for understanding, but rather intersectionality as a critical practice sheds light on the doing of social justice work. So we're doing social justice work when we decide to focus on systems instead of just individuals, or we focus on how systems impact the lived experiences on the lived experiences of communities and individuals. So how have I applied intersectionality in health information practices, and how do I see this as a benefit to, how do I see intersectionality benefiting how we can improve how we study the health information practices of various communities? So I believe it can reveal how information practices, but specifically health information practices, are shaped by interlocking systems of oppression and influenced by differentiating social positions of power, privilege, or influence. And I believe another benefit is how it can expose how information, health, and healthcare inequities are generated, amplified, or tempered by social inequity, social positions, processes, and power. So I want to transition into showing you how I've kind of addressed this in 3 different studies that focus specifically on the lived experiences of Black queer communities in the United States, and specifically addressing racism and sexual orientation discrimination and its impact and its compounding impact on their information processes and conjointly their access to and utilization of healthcare services. And so something I want to note before I jump into that is, in my work, I've found that in order to achieve this goal of health justice and to, with the goal of, thinking about liberation and thinking about restitution and advancing communities, in order to advance communities, communities have to be involved through every step of the way. And so something that has been critical to my work is integrating principles of community-based participatory research. And so here are the definition that I have from a friend of mine, Dr. Elizabeth Chen at the University of North Carolina, who's a professor there of health behavior and health education, states that CBPR, which is the acronym that I'll use from here on out, involves a cyclical and iterative process that includes building partnerships and community trust, community assessment, problem definition, development of research methodology, data collection and analysis, interpretation of data, determination of action and policy implications, dissemination of results, action, and plans for sustainability. So that means thinking of community as a unit of identity and centering the experiences and knowledge of communities. So what does this mean for us as practitioners, as researchers? This means that when you're doing community-based participatory research, you really want to make sure that even from conceptualization, that community members are involved from the outset. When you're thinking about problems or things that you've seen, ask community members about their experiences, have them involved through things like a youth advisory board or community advisory board, working very closely with your community partners, and really making sure that you're centering things that are important to the community. So some of the ways that I've done that in the studies that I'm going to talk about, one included developing a youth advisory board, and the youth advisory board was phenomenal. They helped with the development as well as the pilot testing of the survey instrument that I'll talk about, as well as the interview guide. I had community partners who were involved from the outset, which included healthcare service organizations as well as community-based organizations, because a lot of the work I wanted in order for the work to be impactful, I can't just publish that research in journals, right? Academic journals, because quite often people who are on the ground, they may not be reading those. They may not be reading those publications, right? So you have to make sure that you're disseminating those findings directly to the source, and you're getting the research directly back to them. So for me, that looked like doing community presentations, doing community reports, and then making sure that the community partners or some of the people who were discussed as providers and organizations that people utilize or didn't utilize, that they understood what the study was about and how it came to be, and so that they can take that and then implement that to better inform policies within their organizations. So I'll talk a bit more about how I applied intersectionality through 3 of the study aims. So the first study aim included examining the experiences of racism and sexual orientation discrimination among Black queer men living in the Southeastern United States, and their compounding impact on their health information practices and their utilization of HIV prevention and care. The second study aim was to investigate how Black queer men use technologies to engage in HIV prevention and care. And I'll talk about how a lot of that included trying to use technology to circumvent social and structural barriers. And then 3, since I am interested in change and in developing interventions, which we talked about at the beginning in the introduction, this included a study that focused on, how they identify some of their requirements for the development of an intervention that addresses racism and sexual orientation discrimination and its impact on their information practices and access to and utilization of HIV prevention and care. And I want to talk a bit more about the focus on HIV prevention and care. So quite often, an issue that a lot of people will have is quite often when you think about queer communities, especially Black queer communities, there's a stigma attached to immediately thinking of things such as sexual and reproductive health. And I think that is a very valid critique. And I think it's something that we're starting to explore a bit more, especially in public health and the information sciences. At the same time, in working with my youth advisory board and talking with participants and community members, it's still something that is a very real threat to the lives and well-being of Black queer men. And while it might be something that might be uncomfortable to address, it's still a very real threat to their health and well-being. So in one of my recent papers, I talked a bit more about some of these studies findings and how, research from the CDC shows that if current diagnosis rates do continue to persist, that one in 2, so 50% of Black queer men in lifetime will contract HIV if current diagnosis rates persist, and if we don't kind of focus on the impact of things like racism and sexual orientation discrimination and its impact on engagement and care and access to information and services. So focusing on these particular issues is shaped by the lived experiences of individuals and shaped by the reality that this is still a very huge threat to our communities. So when I'm thinking about community empowerment, as I mentioned, the youth advisory board. So this included not only individuals who were, just members of the community, but people who were also identified as community leaders. So that was 5 Black queer men between the ages of 26 to 32, who were people who were party promoters or individuals who were the head of community-based organizations or people who were influencers within the geographic region that had a lot of like influence within the community. In this study I conducted, for this first study aim, I'm going to specifically be talking about, although I did do a survey as well, I'm going to be specifically talking about the results from remote interviews that were conducted with 22 Black queer men who were between the ages of 22 to 33, with the mean age being 29. The data analysis included thematic analysis, and I used grounded theory methodologies such as line-by-line coding, as well as the constant comparative method, which is where you kind of cross-reference your coding across multiple documents, and then member checking, which is a very important a method that I like to use, which is where you kind of write up a page of notes, highlighting some of the main points from the interview, and then bringing it back to the participant to kind of say, hey, here were the main thoughts or the main things that I pulled out. Do you agree with what is being said here? And then if there's any disagreement, making sure that you re-interview to ensure that that people's experiences are accurately reflected. And so here I want to talk just about what we found in the study as it pertains to the experiences of racism and sexual orientation discrimination and its impact on access to information and services, as well as barriers to care and utilization. So something that was clear was that when trying to obtain information from healthcare providers, they often experience mistreatment. So provider communication impacted the way that they access information. Language that was deemed racist during office visits, language that was deemed stigmatizing. So that included things like chastising men for contracting sexually transmitted infections, making presumptions about their sexual behaviors because of their sexual activities or activities that they deem to be, that they stigmatize as unsafe, or assumptions that they made about them, or also it led to belittling and minimizing the lived experiences and health concerns of men. And I have a few quotes here on the page for some of my participants. So one person said, my doctor was really out of pocket when he told me I have gonorrhea. He gave me a speech about how irresponsible I was and said that you guys are the reason Black women are getting HIV. He wouldn't have said that to me if I was white. So this is kind of getting at the nuances of being both Black and queer, and also dealing with the stigma of HIV and how that impacts your interactions with healthcare providers and impacts the way that you get information or don't get information. Here, one of the main outcomes was inaccessible prevention and care venues. So some of the structural barriers here are explained. So limited care options in close geographic proximity to men. Another big issue was security and policing in healthcare venues, which made a lot of men uncomfortable. And also the cost of care was too expensive, or no health insurance. So there's no one place to get tested in my town, and that, you know, there's only one place, and that is a hospital. I don't want to get tested there. I shouldn't have to drive an hour and a half just to get the services I need. I need more options close by. So this is starting to focus not only on the interpersonal factors that impact access to information and services, but also some of the structural factors here. One of the other main outcomes from this was this, what I'm calling coded language, and this is coded in vivo. So one of the participants called it coded language, specifically in patient records and patient notes, which are a critical piece of information for people who are trying to manage their care. So that included things like healthcare provider notes and patient records perceived to be racist or discriminating, or having an incomplete health history, and honing in on details men didn't believe to be of particular relevance to their specific visit. So one participant, he said, what does me being from redacted neighborhood have to do with anything? Why do you feel the need to mention that I spent 5 years upstate? And in this quote, person is referring to being incarcerated. That has nothing to do with what I came in here for. You know what I mean? That's BS that's the BS that I be talking about. So the person here is just kind of talking a bit more about, specifically through the analysis, found that some of the details that were included in their patient record impacted future visits with other care providers who they believed made presumptions about who they were as a person because of details put in about the neighborhood that the person lived in, about them talking about their incarceration history without linking that incarceration history to healthcare experiences, but mostly just noting that this person might have a violent history because of XYZ conviction. And so, of course, as you can imagine, the impact that this had on some of their information practices and care engagement. One was to conceal their concealment of their sexual orientation or their sexual behaviors, essentially to mitigate what they described as, the compounding impacts of racism and sexual orientation discrimination, right? Two, a lot of people stopped care or stopped seeking information because they felt like it put them in harm's way to put themselves in situations that stressed them out or made them feel uncomfortable. And that included, for some people who were on treatment, that included stopping treatment altogether. Three, that looked like hesitancy. So hesitancy to engage in any sort of intervention with researchers. Some people were hesitant to even, be interviewed by me because of past negative experiences that they had in those healthcare organizations and discomfort that they felt in some of the institutions that they utilize. And then four, disengagement, which looked like long periods of time without utilizing healthcare or long periods of time without seeking additional information or not keeping up on the latest trends in healthcare because of those negative experiences. So before I jump back into the second study, I want to remind you the second study aim focused on investigating how Black queer men use technologies to engage in HIV prevention and care as a way to circumvent social and structural barriers. So focusing on that, this was a survey that was conducted with the 83 Black queer men living in the Southeastern United States between the ages of 19 to 34. There was a 36.8% response rate, some of the survey questions included the use of questions about the use of technologies to seek information and services, the use of technologies to utilize and manage health information and care, as well as HIV prevention and care, and the types of technologies they use. And in the interviews that were also conducted with this group, focused on how and why technologies were used by Black queer men to seek and obtain HIV information and services. So as I mentioned earlier, a lot of people use it to circumvent racism and sexual orientation discrimination, as well as HIV stigma, as a way to avoid face-to-face interactions or to avoid negative communication with healthcare providers due to potential backlash in offline settings. Quite often, people use technology to seek community-specific information online that could not be located offline. So especially in rural areas or in areas where there was a heavy stigma around being openly Black and gay or Black and queer, or if they might have had a community of support in their everyday life, they look for other individuals who were similar to them online as a way to get that information in a way that was safe. And then also they use their social networks to barter services in exchange for things like medication, and to circumvent some of these systems. So some of the structural barriers to things like cost, they use their online social networks to get access to things from behind a paywall, essentially, right? So these are just, ways that you kind of think of. These are the ways that they engage in information practices in response to systems of oppression. And then finally, calling you back to this third study game, which is focusing on solutions. So identifying user requirements for the development of informatics interventions to address racism and sexual orientation discrimination and its impact on Black queer men. So this included focus groups, which were 6 remote focus groups with 5 participants each for a total of 30 individuals who are between the ages of 19 to 34 with an average age of 25. So here I'll talk about the user design requirements for this intervention, which is really important when we're thinking about how we want to address or combat the impact of racism and sexual orientation on information practices, as well as engagement in healthcare. So some of the design considerations for what I'll talk about a bit later for health justice informatics interventions are: 1, addressing coded language, which I talked about in my findings. So that includes eliminating racist language in patient-provider interactions and patient records. So that indicates having interventions that aren't focused on the individuals, but having interventions that are focused on care providers. So taking the onus off of individuals and placing the onus on healthcare providers and people that they interact with within the healthcare setting to better train them on how to deal with people from communities that are not from the quote unquote majority, and being mindful of the language that you use, being mindful of the details that you put in the patient notes, and being mindful of how that impacts people's engagement or disengagement in care. And so one person said, once you know better, you do better. Some of them don't even realize what they're saying is messed up. So this is them saying interventions should be focused on the care providers and placing that onus on the institutions to train providers in ways that are better to improve the outcomes for these men. And then two, eliminating structural barriers for sustainability, so that some of the things that they wanted were identifying social service benefits and connecting men to case managers who can assist in the application process, and having it be location-based and having it be people who have had positive interactions with case managers and who have a track record of working with members from this community and doing right by them. So one person said, I know some of this stuff is out there, but it's hell to find and navigate. I feel like half the battle was figuring out the right thing to say to get help. So it's identifying essentially information managers and information facilitators to help better connect people to resources and information that is useful to them. And then some of the other key design considerations that I want to kind of have you thinking about as I begin to wrap up my talk today is thinking about the themes of inclusion, technology, finance, safety, and then sustainability. So including healthcare providers in interventions, having interventions that are focusing on them. Some of the other key themes included having organizational leadership within community-based organizations and health administration, having them involved in interventions and having those outcomes focused on improving things like policing in institutions, and being able to share their experiences directly with leadership and knowing that something is going to be done about some of the maybe grievances that they have. Technology was very popular amongst amongst people who participated in the study, and there was a high favoritism towards things like social media and you having things like incentives to get people more engaged in care and getting people more engaged into finding consumer health information. And there was a high favoritism for using devices that they already own, such as smartphones. There was also favoritism towards using things like chatbots to get just basic level information, and that was as a way to avoid some of those negative experiences that they've had in healthcare settings. Something else that was really important is having free and low cost access to information and access to medication and services that were central to addressing some of those structural barriers. When thinking about safety, it was important to ensure that when they were sharing their experiences with members of organizational leadership or with healthcare providers, ensuring that there will be no backlash for their candor or transparency was something that was really important. And then finally, putting in place measures at the administrative level to ensure that racism and sexual orientation discrimination doesn't persist. And so this is something that I'm still kind of thinking through is what does sustainability look like at the administrative level, especially when in healthcare organizations there can be high turnover of staff. How do we ensure that policies are created to ensure that health justice is slowly but surely being achieved by removing these barriers that are racism and sexual orientation discrimination? So my solution to that is an approach that I call health justice informatics. And as I've walked you through, thinking about intersectionality as a theoretical framework and a practice, as well as thinking about how we can better understand structural oppression, as well as some of the findings from my research. I've kind of walked you through how I've been doing that in my research. So the first being making the approach anti-racist and combating white supremacy. Because at the root, especially of things in the United States, colonialism and racism is core to its impact on all people, whether you're a member of the majority or someone of the global majority. It impacts your everyday life. So when you're thinking about things like intersectionality, it is inherently anti-racist. Second, thinking about justice. So all power to the people. That includes community empowerment here, which is the next step. empowering people to be involved at every stage of the research process and thinking about liberation, thinking about restitution. How can we dismantle these systems to make sure that people are empowered, and making sure that across the administrative level, people who are in positions of power, who are administrators or information professionals or healthcare providers, are making sure that they're centering the needs of community members and not reifying systems of oppression or reifying policies and practices that have a negative impact on communities. And then the other approach is learning more. So in order to address a problem, you have to first identify it. And something that's key to my work is identifying it and then also elucidating the magnitude. So at what magnitude does this happen? At what level does this happen interpersonally or structurally? So structurally, detecting and understanding things like racism and sexual orientation, discrimination, and then addressing it across multiple levels. So as I mentioned before, thinking about, at the individual level, right, focusing on the individual behaviors of individuals, but also getting a better understanding of these individual behaviors happen because of multiple levels of interlocking oppression. And then, like the participant said, placing that onus on the institution. The next part of that piece is figuring out the best informatics approach. So the best informatics approach might not always be technology, right? Especially if you're in, you're working with a community that may not, use a lot of technology. It could be information. It could be an information intervention. But thinking about that and asking your community members, what does that look like for them? And what format do they like to receive this information? And in what ways would it make them feel empowered to engage in these systems or to make these systems more safe, make these institutions or systems more safe. So that's determining the best informatics fit. And as I said here, once again, valuing the knowledge and skills of community members, and then implementation. So that includes evaluating the process and carefully considering the outcomes. So when you're implementing them, you want to make sure that community members are involved in this and that you're properly taking findings into account, and then developing solutions that can be implemented. And then ultimately the goal being that these are then turned into policies as well as practices and programs that have a lasting impact. So that could be something like having a community advisory board that works in conjunction with hospital leadership or healthcare leadership or library leadership to kind of give feedback when something new is introduced. So these are just kind of things that I want to want you to keep in mind about how I'm thinking about these and how we can all work to achieve health justice. So about some of my forthcoming research results, which you'll see in future publications, I've done research on a nationwide study specifically focusing on the information practices of Black queer women, specifically as it pertains to sexual and reproductive health. And then as Clarence mentioned earlier, I'm conducting research currently right now that's funded by IMLS that's focusing on how formerly incarcerated individuals navigate reentry information and services following their incarceration. So I'm going to end by showing you just a few references if you're interested. And I believe the slides will be available. But if you want to get in touch with me after this presentation, please feel free to email me at threats@umich.edu and www.meganthreats.com. Thank you so much.
Well, thank you so much, Dr. Threats. Let's give Dr. Threats a big hand. That was quite a fantastic amount of information to share with us today, and I love your approach. If people have questions, please put them in the chat, and then I will read them out.
Yes. So I see the first question. Thank you so much, Rachel. So the first question says, can you share more about how you interacted with your youth advisory board for the 3 studies? It sounds like you spoke with them a lot at the beginning as you were conceptualizing the research, but I wonder how you might encourage others wanting to do community-based practices research or community engaged research to interact with similar advisory boards or members of the community. So something that's really important to me is having members of a community advisory board engage in the process from the outset and compensating them well. So something that quite often happens is people are what you might call hesitant to engage in research with people universities, especially because they feel like there's a disparity in how they're compensated and the valuing of their time. So I think that was something that was really important, showing people that you value them with your pockets. So that was one really important way of keeping youth engaged. It's like, hey, you're being paid the same that a contractor would be paid for your time and your expertise. And then also seeing that the feedback that they gave was actually incorporated, right? So it wasn't just like, oh, thanks for your suggestion, I'll do what I want to do because I'm the expert. It's like, no, you're an expert in your community and you're informing my approach and how I do things. So I think that was really important, having quarterly meetings, which is something that I still do on any research project that I'm engaged in, whether it's a youth advisory board or community advisory board, sending periodic updates so people know what's going on, inviting people to, if I'm doing recruitment, or inviting people to any type of presentation that I'm doing. So for example, like sending out links to presentations that I'm doing so they know, like, hey, I'm talking about you today, or I'm talking about certain things, or, you know, you can find this here, or you can read about this here. I think that kind of helps helps build a relationship, and it helps with sustainability, that people know, like, hey, this wasn't just like a one-off thing, or that that you're not valued. Making sure that people know valued and showing them through compensation, as well as keeping them in the loop the same way that you would your other research collaborators. Other advice that I would have for community engaged researchers is really taking into account, like, why are you doing this, right? Like, what is the purpose of this research? Quite often, the purpose of research is to create, or as scholars, is to create new knowledge. But when you're doing community-based research, it's not just to create new knowledge, it's to create some sort of solution, right? It's to apply the findings that you're having to improve the lives or the well-being of individuals. So asking community members, how can this work be used to improve your life? In my case, it was bringing this back to administrators at healthcare organizations to say, hey, these are the issues that people have been having. What can we do to fix this? Or, hey, there's a resource that hasn't been created. They want better connection to social benefits, or case managers, or people who have knowledge of updates on biomedical treatments for HIV prevention and care. So those are like some of the ways that things can be applied. So those are things that that's one way that I would encourage people to do community engaged research. And then something else that's really important to me is, like, do you actually live in the community that you're working with, right? So it's like, if you're like, I'm 45 minutes away, or I'm an hour away, and that might be fine for some folks, but for me, it's like, if I'm doing community engaged research, you see me at the beauty salon, you see me at the same community center, you see me at the same libraries, you see me at the same grocery stores. And I'll speak if you speak to me, like, so it's not awkward, so I don't blow up your spot, but you see me around, so you know that I'm engaged in this community, and I'm a member of this community too. I'm not somebody who's just extracting, right? And it's also still being mindful, as I talked about intersectionality theory, I talked about being mindful of the multiple positions of power and oppression, right? So, I am a Black woman. At the same time, I'm still a professor at a university, right? I still have this power and this positionality of someone who is behind this institution that has historically not done people from our communities well, but I still have that power, right? So being mindful of that differentiating level of power, despite my positionality as someone who is a member of the global majority, that still doesn't erase that power that I have over that interaction. So being mindful of that too, and just making sure that communication is open. So that's how I would answer that question.
Yeah, great, thank you. So I had a question, something that actually your answer to that question reminded me of, which is, you talked a little bit about resistance and about some participants' resistance because, of course, of their prior experiences with discrimination. Do you have, it's kind of in the weeds question, but do you have like strategies that you enact that, to sort of bring participants to you, that voices we might not hear, right? Sort of to be able to hear them?
For sure. I think a lot of it is me going to them. So doing research on, like, what community-based organization is doing this, or what person is speaking about these issues already, because there's nothing new under the sun, right? So there's always someone who in some way has thought about things in a particular way, or who cares about these issues, or maybe they have been trying and they haven't had the funding, or they haven't had the platform, and it's saying, okay, let me find you and let's see how I can leverage what resources I have to bolster your cause, or to talk to you about, well, what were those past experiences like? How can I make sure that I'm not making the same mistakes that previous researchers have made? And a lot of it is community connection and just talking to people and being genuine. Quite often people can tell when you're being disingenuous, especially, you know, if you're coming from a university and like all of a sudden you're like, hey, bestie, and it's like, okay, I'm not going to ever hear from you again. Just being just like really being there and being around and being engaged. You know, something that I've recently started doing, which I think I really enjoy, that I haven't seen quite talked about, but it's like assisting with things that aren't related to your research that helps that individual. So for example, one of the members of my community advisory board for the IMLS project, there's someone who was formerly incarcerated for about 15 years. They've started their own production and media company. They started their own production media company, and they're doing this docuseries that they're producing about the reentry experiences of different folks across the state of Michigan. And they're doing like a videography project, but they're like, Meg, I don't know how to get more money and funding for this project. So I'm like, well, I'm a good grant writer. So that is like, it's kind of like the bartering services. It's right. Like we're serving on my community advisory board, and I'm paying you as a community advisory board member, but it's also, I'm going to help you write these grants, right? Like as a bartering thing is like, well, I know where to find pots of money to help fund your project that is related to something you're passionate about. So that's another way to build trust. It's like, well, she cares about this, even though none of this money is going to her or her research is not being talked about. It's just like lending skills that you have. So that's one way to like, you know, like we do in community, you're bartering your skills and services to help in some way. So that's another way that I think that I help with like some of that resistance. And it's like, okay, well, yeah, Meg was helping with this and this had no benefit to her at all. It's like, well, I trust this person. So when Meg comes around, it's like, hey, I'm about to do recruitment for this. Oh yeah, you know, we've been working on this XYZ and it had nothing to do with her. Now I'm going to spread this to my friends. And that has been something that's helpful. It's just really building trust and actually building community. Yeah.
Yeah, right. Thank you. There's a question in the chat from Jessie Loyer, who's one of our panelists in the upcoming session. What kinds of community outputs have communities requested? Have you noticed that the formats have changed over time? I'm thinking about how pamphlets were a big output for one of my projects, and now people have asked for something like an Instagram account to post short snippets.
For sure. Most of mine has been focused on the communities that I focus. So quite often I'm working with like people between the ages of like 18 to like 35. So it's like 18 to 35. So the output has primarily been technology, social media, infographics, cards, like quick links. So I haven't found it change too much, but more so because of what I'm thinking about age for the demographic. I do believe that I'll find something different for the most recent project that I'm working on. So for example, in the pilot testing of the survey for my project of working with formerly incarcerated folks, one of the biggest overhauls that I had to redo was people said like, Meg, like this reading level of this survey is way too high. And I think it's like, once again, thinking about that power and privilege, it's like, oh, I'm just writing it like, oh, everybody will be able to take this survey. And it's like, well, the previous participants you were working with were, you know, young people between 18 to 35 and various, where it's like, I wasn't taking into account people with different levels of literacy because of incarceration history or lack of libraries within the prisons, or, you know, people who were training in literacy. So I had to revamp and work with a specialist to get it down to get it to a 5th grade reading level. So things like that. So that meant that everybody will not have digital literacy. So I know that some of my survey is going to be paper-based. Right. So like, those are some of the ways, like, thank you for that question, Jessie. Those are some of the ways that I'm already noticing. I already know that there's going to be different. I'm anticipating, I'm not going to say I already know, I'm anticipating that there will be differences in the format that people request. So I'm already planning. One of the reasons why I'm doing this study is to inform the development of a statewide reentry planning guide, which is something I did in my previous role as a librarian. I was a public services and reference librarian at the AIDS Library of Philadelphia, where we created this comprehensive reentry and planning guide for Philadelphia, New Jersey, and New York City, because we had this newsletter called the Prison Health Newsletter that we would send out to different prisons across the United States, and people can write in for requests for consumer health information. So I was the reference librarian for that, and people were sending like tons of requests of myself, and then I would have my interns from I want to shout out the Drexel MLIS students, as well as public health students at Temple University and UPenn. We would be responding to all these requests for information. And what it turned into, quite often, people would over and over ask for help with reentry related information. And we obviously couldn't do it for every state in the US, but we're like, well, a lot of people come use the free libraries, but they would also come use Philadelphia Fights Library. And so I kind of kept that in mind when I moved to Michigan. And so I started doing research about like what type of reentry services. And a lot of people, they're like, we just get a pamphlet and, you know, it was a pamphlet of information and this is fine, but then we forgot about it. And the information wasn't up to date and we would call and it wasn't helpful. And so this is what led to the idea of like, well, let's ask people about their reentry information needs and practices. And then from what people tell us, then develop this statewide reentry guide. And I already know that some of it is gonna be in print format. It's gonna be at 5th grade reading level. I know that a lot of it will live online as well, but I'm anticipating that it needs to be in multiple formats so that it can get to people who are coming out, right? So not just people who are already out, but getting it to people. So I know, you know, there was recently a grant for like some of the prisons in Michigan to get technology, but you know, because of like limitations and firewalls, and they might not be able to get it through, you know, like the online website, right? So it makes sense to we're going to have print, you know, you're going to have print format. So those are things, I think that's an excellent question. And I think it also comes back to when I was thinking about informatics approach, not having that automatically mean technology, but thinking about what format the information is to best serve that community. But mostly because I've been working with young people, it's all been social media, technology, give me a QR code, let's make it quick, let's make it fast. But I know for this, you know, accounting for this particular community, there's going to be some variance. So yeah, another great question. And then I saw, thank you, someone shared that there's a TikToker who talks a lot about reentry. So I will, I would love to look at their stuff. And I'm wondering if they're connected to any of the people who are part of the advisory board for our study who are popular on social media. And I'm not going to blow up their spot right now, but hopefully later. Yeah.
Well, another question from B is, so she says, I'm wondering, as a relative layperson in this area of research, are there certain educational tools that you love and recommend for learning more? Any social media websites or favorite books, etc.?
Wow. So that's a great question. That's such a huge question too. So I'm a big fan of, like I said, I want everybody to learn more about what intersectionality is. So some of the people that I mentioned in my talk, like Kimberly Crenshaw, Dr. Cho, Dr. Patricia Hill Collins, another person that I've referenced are Exis Hemphill and people like Anna Haywood. Other scholars that I recommend are Greta Bauer, as well as Lisa Boleg. So these are a lot of people who are thinking about, you know, intersectionality as a theory. A lot of people have done the legwork of this, and a lot of people who have thought about, you know, using intersectionality as like a method. So those would just be some of the places that I would start. Another really great one, I'll shout out also, Dr. Lisa Boleg has this Intersectionality Training Institute for researchers and practitioners. And you could do a summer-long class or even like a 3-day institute or a 1-day institute. And I think it's a really useful, training program for folks who want to really start applying intersectionality in their work and their practices. As in terms of social media, I used to be really, really into Twitter or X, but then I was like, I don't like engaging, but I love TikTok. So there's a couple people whose names I can't think of off rip, but they just do really good stuff. If I think about it, I'll say it. But those are just some of the authors and scholars that kind of come to mind. And then something else I want to kind of point out, I know like the person mentioned the TikToker, sometimes like everything is not going to be in a published journal. And I think that's really important. If you want to get things into the hands of people immediately, quite often it's not going to be like, hey, go behind this paywall and read my article. This is not realistic. It's going to be, I'm going to give you a quick TikTok. I'm going to give you a quick TikTok. I'm going to give you a thread on Twitter, or we're going to be on Reddit in the subreddits, which is something I am notorious for. I'm not going to tell you my name on there because I don't, too much. But it's like subreddits are great for like immediate explanations. And sometimes it's like, you can tell if someone is being disingenuous versus like they really want to know, or if they're trolling. And it's like, if you have someone who really wants to know, then there are certain people who are like, I will educate you, and then you go from there. And at the end of the day, I think something that I love about intersectionality is that it centers the lived experiences of individuals. And so kind of like calling that back to people are experts. They might not have the language, right, or the polish that we have, but they still know what they're talking about, right? And a lot of times their approach is sometimes more effective because they're able to communicate it in a way that everyone can understand. And I think that's something that should always be a goal of ours, is communicating things in ways that everyone can understand and making it accessible. Yeah.
Great. Okay. So a new question came in. Let's see. So I'm curious, when you approached healthcare systems providers with what you found from your studies and your recommendations, what were their responses? I've been curious about that too.
Yeah. Some people aren't happy to hear some of the critiques, right? Like nobody wants to hear you're racist. Nobody wants to hear that. But it's like after you get over the initial shock of like, oh, I had no idea, people are open to understanding their communities, right? Because they knew that this study was being done. And I think that's the importance of it not being just like, I gotcha. It's, hey, I'm doing this work. I'm exploring the impact that this has and their perception and the experiences. And I want you to know what people are saying. So, of course, it's a hard thing to chew. But I think people are open to, especially given the time that some of this was being done. This is, 2020, I feel like was a big eye opener for a lot of people who maybe hadn't thought about these things before. And I think a lot of that has to do with, although in our communities, we've always known that these things have happened. I think thinking about some of the limitations that were placed during COVID-19, where you're at home and you're focused on media and you're seeing these things and it's like, wait, what's happening? So it's waking a lot of people up. So I think that despite the initial shock, there was still some, like, okay, I may have thought that this was happening or I didn't realize it, but this is happening, right? And then these are people's experiences. And so I think that what I found is that there was more receptive to like, okay, I don't like this thing, this is uncomfortable, but I don't want to be part of the problem. And something that helps with naming things and calling attention to it is that we now have the American Medical Association and the Centers for Disease Control specifically calling out things like racism being a threat to public health and saying the words, right? Like we've known these things, or specifically having offices that are focused on sexual orientation and gender identity discrimination, right? Despite certain policies that benefit certain communities, the people that are the most disadvantaged are still being harmed, right? So it's like, people have the right to get married if they're not heterosexual, but what does this benefit everyone else if you can still get murdered just for being queer, right? You can still be placed placed in harm's way or killed just because of your presentation. So it's like, and we still have a lot of work to do, and this is how people within these systems perpetuate it. So making people aware of it is great. I think the next step will be developing interventions, and there are other researchers who are doing work. Something I think that helps is also having medical doctors, having physicians, having nurses involved in research teams. So something that's worked for me is working specifically with nurses, because quite often people they work directly with physician's assistants, they work with nursings, they work with MPs, and that's who they're working with the most. So it helps to do some of this collaborative research, which is something that's been really beneficial for me, and other professions that people might deem as social service, or people that are in the help seeking profession. It's like, you're a complement to it, but sometimes you can be harm and placing people in harm's ways because of ways that you're thinking about things. So those are some of the ways that people responded to it. And then I guess in terms of transforming systems, I think there's been I think it's a worthy cause to think about just dismantling certain things, like certain things just shouldn't exist anymore, and asking community members about that and what that looks like for them, I think is important, right? And it's something that's been really important for me is, for example, like when I was a librarian, we just created the resource guide because we saw the immediate need, but there was no research behind it. There was no research into all of the different ways or all the different practices or needs that people have. We just did it. Whereas now as a researcher, I have the resources and the time to be able to ask community members, what are your needs? What are your practices like? And what do you think should be included in this resource guide?
What format should this be in? You know, when should we get this to you? What were your experiences like? Did you have a library where you were incarcerated, right? And like asking people, cross-referencing it versus like service providers, which is another thing to do. So I think that's something that I'm excited about. That's different from what I did in the past, transitioning from being a practitioner to a researcher, which is like one of the reasons why I did go back and decide to like, you know, further education was to get a better understanding of why are things the way that they are. We can't just create solutions because then it's not going to be sustainable if we don't have a proper understanding of what people actually want and what they're actually going through. Yeah.
Right. So, but Jessie asked an academia question that I'm sure you're familiar with. Yeah, so is there a culture of community-based participatory research at your institution, or was this something that you had to explain and make a case for? I guess the question is, how did you make that case, right?
For sure. So luckily, I'm at an institution, I'm at the University of Michigan School of Information, very strong track record of researchers who do community-based work. And I think I've found that because there's a strong track record of researchers who do community-based work, it's something it's something that's very highly valued. And they show that it's valued by including it in things like how you're evaluated. They show you they're valued by having certain money in grant funding mechanisms to support community engaged research. And then also recognizing that this takes time. So it's not as easy as just, I'm just going to do a survey and here it is. It's like, nope, I started this in July and data collection is starting at the end of this month. In July to August, September, October, November, December, January, February, March, April, I had to redo it because I have to redo the literacy levels. And now I have to redo it because pilot testing was like, this is too long. You need to change. And it's like, well, it's a very long, tenuous process. And and the output would be great. But before you get to the output, you have to really work with the community. So I feel like I'm in a place that understands that it's very time consuming, but that the output is well worth the wait. So I think those are things that should be stressed when you're doing community-based work. And I think I think something that helps is recognizing that when you're doing community-based work that's tied to communities that are historically marginalized, and there is this, because of this history of distrust, this rightfully so, it may take a little bit longer to recruit people or to build relationships. So if you're in a place or a space that you're trying to make that case, those are just some of the things to make people aware of. And there's plenty of scholarship that kind of denotes that as well. Yeah.
Yeah, thank you. So I think we have time for about one more question. And I was thinking, you've been talking to this a little bit throughout, but I guess I wonder if you have advice for a new researcher who might want to do this kind of research. What would you point them towards, or what advice would you give them?
Yeah, I would tell them to wow, that's a great question. I would tell them to read as much as they can. So look to see who has been doing work in your area. There may not be any gaps, right? Sometimes there's such a focus on research to like be novel or to be innovative. And it's like, for example, what someone mentioned, the innovation might not be anything other than like, you need to change this to a different reading level. And that can have a total impact on the amount of people you get to do the study or how many people engage in the process. It might not be this grandiose thing. I think that's something I would say. I think reaching out to people in your field is important. Just to say like, hey, what are you doing? What are you working on? I'm curious to know like what's up. And people are usually busy, so don't take it personal. And I apologize if there's anybody on this call who's emailed me. You didn't get back to me. I promise I'm peeling through it. So, but also just email people again. Like people don't, usually it's like, it just gets buried in your email box. It's not like you're bothering. It's just like, I just didn't see it. So there's that. I think another thing would be to, I think there's something to be said about looking at alternative venues. So as someone mentioned, there's somebody on TikTok who's making talking about it. So it's like looking beyond just academic journals or conferences or the talk here, looking in the places where people actually are. Like, I think that matters too, but also citing those people. So something that's really important to me is like, even if somebody didn't, put it in a paper or a talk, they're on TikTok, reference at such and such user, here's a link to their video, still giving them credit for it so that people can do more research like the person in the chat did. I think that's a really great way to kind of to kind of get into things, and then just kind of follow your gut. When I say follow your gut, like I would have never thought that I was a librarian. I enjoyed being a librarian. I loved it. But now I'm a faculty member at a university, non-library faculty at a university. And that was all from the experiences that I had working as a librarian and saying, well, how do we do interventions in a way that's meaningful? And why aren't these things working? And why are diagnosis rates finally now stabilizing? But before that, they were still skyrocketing. And it was like, well, look, the approach that you're using is not working. You can't use conventional theoretical models and get different results, or you're not doing community-based work. So just kind of follow your gut and kind of going with the flow, and maybe changing your path if you feel like you want to do something different, try it out.
Okay.
Yeah.
Well, I want to second what Jessie Scott said in the chat. So this was an excellent talk, by the way, she says. So I really want to say how much I appreciate you talking to us, and I love how you not only share your findings, but you share your approach and your methods and things that, I mean, are particularly, for the Institute, we have an interest in, supporting research like this. And so I love how you've kind of given people, ideas about how they might approach such things, and, tools and things to think about and ways to go explore them further. So anyway, with that, I really want to just give a huge hand to Dr. Threats. Thank you so much. And
thank you so much.
Sorry?
Well, I was just saying, thank you so much. Yeah. And thank you to the Institute for inviting me, and this is great to be here, and just happy to see that this conference is happening, and that there's such a diverse audience in terms of the different professions, and I think this is great.
Okay, thank you. Okay, and thanks everyone for your great questions, and thanks to Dr. Threats for her amazing answers. So now let's see, we have a 15-minute break, and then we'll reconvene for our panel discussion.
Good morning. So I'm very excited to be moderating our research showcase panel today. I'm Michael Flierl. I'm an associate professor at the Ohio State University Libraries and a fellow for the Information Literacy Institute at Purdue. So as I said 5 minutes ago, we're short on time. We end at noon Eastern time in 60 minutes. So I'm going to get us started and introduce our speakers. We'll each give a 10 to 15-minute presentation. And then ideally we'll have some time for Q&A at the end, which we all hope you all participate. We want this to be collaborative and interesting. So without further ado, I'm going to introduce our three speakers in the order in which they will present. The first is Dr. Ellie Abdi. Dr. Ellie Abdi is a senior lecturer at Curtin University in Perth, Australia. She's an information literacy researcher and studies information experience design, IXD, as an IL development approach to design and develop information interventions to aid in more effective information use for daily life experiences. So in her talk, Enhancing Refugees' Information Experiences, Dr. Abdi will describe how information experience design can aid information professionals to support refugees' information literacy experiences. She will provide an overview of a study investigating refugees' IL experiences that shape knowledge for interventions that enhance refugees' informed and empowered citizenship. Second, I'm just gonna describe everyone. I wanna give everyone equal billing here. Our second speaker will be Dr. Chelsea Peterson-Salahuddin. Dr. Peterson-Salahuddin is an assistant professor and presidential fellow at the University of Michigan School of Information. Her research focuses on the way in which marginalized communities, particularly Black women, femme, and queer folks interact with mass and digital communication technologies. She studies the ways in which marginalized communities overcome or continue to experience systemic barriers to equity through their interactions with these technologies. In her talk, Towards Equitable Information, Understanding and Addressing Barriers to Black and Women of Color's Information Access and Use, Dr. Peterson-Salahuddin will discuss how she engages the concept of information equity when approaching her research on Black and women of color's information-seeking habits, how these communities navigate information for social, political, and personal empowerment, and the need to address the fault lines in information production as we work towards building an equitable information ecosystem. And last but not least, Dr. Jessie Loyer. Dr. Loyer is an academic librarian at Mount Royal University. Her research focuses on Indigenous perspectives on information literacy and the support for language revitalization efforts. Her research approach is establishing ongoing and reciprocal relationships with the communities she works with. She has authored a chapter in the 2021 book, The Collector and the Collected, Decolonizing Area Studies Librarianship, edited by Browndorf, Pappas, and Arrayas. In her talk entitled Collections Are Our Relatives, Indigenous Interventions, Dr. Loyer will explore how traditional collections often exclude Indigenous perspectives and privilege authority outside of Indigenous communities. She will draw upon her research, describe how information workers can play a role in shifting the focus of collections from objects to people, guided by an understanding of Cree relationality. Wow, what a lineup for you today. I'm so excited, and we will get to it. So Ellie, you have the floor for the first 10 to 15 minutes.
Thank you so much, Michael. So let me, excellent. Do you see me and the slides? Yes, excellent. Okay, so hi everyone, good morning, good afternoon, good evening. Greetings from Perth, Australia. Perth is a city in the western side of Australia, in the Western Australia state. So nice to see you, everyone. This is the talk about more informed settlement and how enhancing refugees' information experiences. So every day, families worldwide are forced from their homes in search of safety, risking everything to escape conflict, disaster, and poverty or hunger. By June 2023, around 110 million people were forced to leave their homes because of persecution, conflict, violence, and human rights violations. Many are stateless now, and which means they are missing basic rights like education and healthcare. Sadly, things aren't looking up for refugees, and the hope for a quick fix to their situation is fading fast. Back in the 1990s, around 1.5 million refugees were heading home each year. But in the past decade, it's only around less than 400,000 people, which really shows how the gap between displacement and solutions is getting wider. Refugees crisis is a big humanitarian issue affecting millions who need safety, well-being, and basic rights. Actually, there are legal and moral obligations that establish the legal framework for protecting the rights of refugees and providing them with assistance and support. While refugees are often seen as a burden on host countries' economies, for example, for using up resources, infrastructure, and social services, which potentially can lead to instability and conflict, they can actually fuel economic growth. When provided with work, with health, with education rights, they become productive members of society, bringing valuable skills and boosting local and global trade. And this benefits both refugees and host countries, creating a win-win situation. Resettled refugees can enrich host societies economically, socially, and culturally, while there are initial costs. Effectively resettled refugees can offer valuable contributions, aligning with humanitarian and moral responsibilities as well. Alongside many other factors, information plays a key role in settlement and integration of refugees. Our research indicates that those informed are enabled to successfully navigate the integration process better than others. Refugees are often resettled to countries with an unknown society, language, and culture that is totally different from their country of birth or origin. And this creates for them a range of barriers to successful resettlement and integration in terms of employment, health, education, and income. based on research, the information research, having access to timely, accurate, and tailored information helps refugees navigate their new country independently and make better decisions. It reduces their dependence on government support and facilitates their social inclusion, so ensure they don't remain vulnerable within their host communities. And we, in the information field, address the refugee crisis from this information lens. And in the next 3 slides, I'm going to show you very quickly the 3 major areas that we are addressing the refugee crisis from an information lens. The first area, which is actually what information scholars started with, is the research support information professionals offer to other scholars researching forced migration. So this preliminary covers introducing specialized research resources and reference tools and services for forced migration research and researchers. And you can see a few examples of published work in this area. The second area is information studies, is the work that focused on the role of information and education agents, specifically public libraries, and how the information services that they provided contributed to the social inclusion of refugees settling in their new homes. And the third area is the group of studies that look beyond the information services and resources and actually delve into the worlds of users of these services who are refugees and explore what their information worlds and what is information for them and how they use this information. And my research efforts to address the refugee crisis also fits in this third group, with this study on this slide being the major piece of work that I have done so far. This was my postdoc study. It was funded by the Australian Research Council, which is the main research funding body in Australia. It was a qualitative study that looked into the experience of information literacy amongst 2 groups of immigrants, refugees and skilled migrants, as well as settlement service providers, and how they thought refugees and skilled migrants experience information literacy, with information literacy being represented as using information to learn. So we looked, we took how people use the information to learn as their information literacy. And today I'm just going to talk about the results and outcome of the that part of a study that looked into refugees' information literacy experiences. The analysis of the interviewed data resulted in an overview on how refugees experienced using information to learn, and which, as I said, was taken as their information literacy. So the 5 themes on this slide are the different ways through which refugees use information to learn about their new setting. Okay, so our results showed that refugees compare and contrast their past and present, their the country they have come from and the country that they are resettling in to learn about the new life. It showed that they undertake formal education. They go to resettlement, to settlement service classes or library classes to learn about their new setting. They reach out for help, they ask around, and they seek information from others to learn about their new life. They get engaged with the new environment, they do things in the new environment to learn about it, and they share stories, and that's another way that they learn about the new environment. Further analysis also showed that these 5 themes can be divided into 2 broader categories. And for this, we needed to kind of reorder the presentation of the themes. Category 1, in which refugees' information use, is more of a facilitated experience. And category 2, in which their information use is more of an independent experience. So in category 1, refugees very explicitly talked about the role of mediators and agents in their information use. For example, caseworkers, interpreters, community leaders, family, friends, children, and how they help the refugees interact with information and get connected with the information landscape they are getting familiar with. The facilitation in theme 1, undertaking education, as you can see, is more structured and controlled, while in theme 2, it is more on demand and kind of uncontrolled type of facilitation. Then in category 2, we have themes of independent ways of using information. No facilitation, no intervention by agents is required when using information in these ways. Instead, refugees take on a more proactive and contributory role in their information use. So when comparing and contrasting, when sharing stories, when getting engaged, they appear to have more agency in how they use information to learn. They go beyond being a dependent recipient of information in these ways and rather take charge in their information use. So, for example, refugees in theme 3 show a very strong past-connected personal and internal way of using information. In theme 4, sharing stories, it has a social and sharing focus in their they have a sharing and social focus in their information use, whether through interaction with the host country or with those back at home. And in theme 5, getting engaged, they show the most independency in their information use. They very independently immerse themselves in the new environment of the host country to learn it. All right, so looking at these themes in this sequence suggests a trend towards increasing independency in information use. This progression indicates a shift from more facilitated experience towards greater independence. So let's now unpack this a little bit. Looking at the results, we can assume that an individual, a refugee, may engage with information in one or more of these ways. The more diverse this engagement with information, the richer and more complex and sophisticated their interaction with information becomes. The more varied ways they come to experience, the wider their awareness of these ways become. And a refresher here that was said that in this study, we took using information to learn as a representation of information literacy. So these 5 ways that we have uncovered are actually the ways of experiencing information literacy. And considering these ways as experiences of information literacy means that individuals who engage with a wider range of ways of experiencing information can be assumed more information literate. And because of the significance of information in the resettlement and integration process discussed earlier, being more information literate translates to a smoother journey in resettlement and integration for refugees. Also, experiencing more independent ways of using information, so the ones in the lower part of the diagram, may foster a sense of empowerment and independence. So those being able to engage with information in more independent ways may also experience a more independent resettlement and integration process. All right, now what can we do with this understanding? Our task ahead would be thinking about how can we support individuals in becoming aware of all these ways? How can we motivate individuals to engage with information in all these ways, specifically the more independent ways, the ones in the lower part of the diagram? How can we empower individuals to consciously choose the most suitable way to engage with information? So, for example, they know what would be the most suitable and relevant way of using information at any given time. Actually, what we have ahead is thinking about the development of information literacy among refugees. More practically, we can use the observed transition pattern towards greater independence in using information to inform the design or redesign of our resettlement and integration offerings. The offerings that strategically and smoothly expand individuals' experiences, focusing on information used to learn, offerings that support them to engage with information in more varied ways, so they can hopefully experience a shift from more dependent to more independent information use as well. So our task would be tailoring services and programs that can effectively attend and integrate all these identified ways, or a combination of them in their design. So for example, when designing a piece of resettlement learning experience for refugees through education, like attending classes or workshops, they can be taught about an aspect of the new environment, for example, the legal system, and then be supported by caseworkers to help them understand and interpret that information to see how it relates to their personal situation. Getting a lot of information so quickly in a class or in a workshop, they might need help making sense of it and applying it to their own unique situation. And also be guided to independently use it themselves. So a combination of these ways could go in the design of a resettlement learning experience.
Ellie, I'm sorry, I'm going to give you your 1-minute warning. Sorry to interject.
Sure. The last 2 slides. And I'm calling this approach information experience design, which is about building interventions to diversify and enrich using information to learn, all based on a theoretical understanding of these diverse ways. So the approach includes a research phase, the circle on the right, which explores how differently people in any context, and in our case, refugees in a resettlement and integration setting, use information to learn. And then an implementation phase where interventions are crafted to support engagement with as many identified ways as possible. Earlier today, we discussed how information impacts refugees' journey to settle and integrate effectively, related to this social exclusion among refugees in their new communities is seen as an information challenge. So an approach like information experience design, all about improving information use and empowerment, can help address the issue of social exclusion from an information perspective. By enhancing how information is handled, this approach can push for social progress, supporting refugees blend in and feel at home in their new communities. Thank you so much. And if we need to talk about this, you would like to ask a question or insight to share, let's get connected, and that's my email. Thank you so much.
And let's see here, I have Chelsea's up next. So if you can, Chelsea, you have the floor.
Okay, great. Let me just share my slides. Well, my name is Chelsea Peterson-Salahuddin. As already been said, I am a President's Postdoctoral Fellow and Assistant Professor at the University of Michigan School of Information. My talk today is entitled Towards Equitable Information, Understanding and Addressing Barriers to Black and Women of Color's Information Access and Use. So before we get started today, I do want to give a brief overview of what I'm going to be talking about. So I will start by discussing the concept of information equity as it has been used in information science literature, and how the concept of information inequity shapes much of the work I do, focusing on the information seeking habits of Black and women of color communities. Then I will give some examples of how I've explored this issue of information equity in my own research. And finally, I'm going to conclude by discussing a new perspective on information equity that has emerged from this research that I argue is important for library and information science scholars to consider when addressing barriers marginalized communities face to equitably using and engaging with information. So information inequity is often defined as the structural disparities in accessing, accepting, and using information and information resources between individuals, communities, and nations. And given the importance of information in helping people and communities find resources and advocate for themselves within society, identifying and addressing barriers to information equity, particularly for historically marginalized peoples, is paramount for creating a more equitable society more broadly. And information science scholars have typically approached the question of information equity in one or two perspectives. So the first is a horizontal perspective that positions information as an intangible public good, focusing on how access to information is based on an individual's capacity to access, understand, and benefit from it. And the second is a vertical perspective that views information as a finite tangible good that can be gained through social or economic advantages. And within this perspective, scholars commonly draw on information poverty theory, which posits that individuals from marginalized from mainstream society are stratified from mainstream information sources because of their different lived experiences, and thus inhabit what Chapman terms information poor environments, where they constantly have to assess the risk of revealing information about themselves and may engage in secrecy or deception about their lives when engaging in information seeking activities, which may make them mainly privy to information that circulates within their small worlds or immediate social environments. And so within my own work, I have often engaged this latter perspective as a framework to examine how occupying a socially marginalized identity can potentially create barriers to information equity. And so to illustrate how the concept of information equity has shown up in my own research, I am going to talk about my research first on the news information seeking habits of women of color. And some of the published findings from this project can be found in the journals Media and Communication and the International Journal of Communication through these QR links if you would like to read more. So access to news is paramount in helping people advocate for themselves. However, we know that access to relevant and helpful information is not always equitable across society. And in my particular context, which I study, which is the US, mainstream US news often report information that experiences and perspectives of white middle-class Americans. And this potential disjuncture could lead to instances of information poverty. At the same time, we know that recently women of color have played a key role in social and political organizing and determine the outcome of major national and local elections, indicating that they are actively engaged and informed about critical issues impacting their communities and are powered to talk about these things. And part of this discrepancy may be due to the individual level analysis of information poverty theory, or the fact that it puts the onus of information poverty on the individual as opposed to the systemic conditions that create these information barriers. And so to account for this in this study, I particularly engaged intersectionality as an analytical lens derived from Black feminist theory and critical legal theory, and also a term coined by critical legal studies scholar Kimberly Crenshaw that argues we must examine how multiple axes of power and oppression co-constitutively and dynamically shape people's lives, in this case, to uncover the systemic and institutional dimensions of why and how women of color engage in news information seeking. And I also drew on Gibson and Martin's more recent concept of information marginalization, which builds on and aims to address this individual level orientation of information poverty theory by positioning marginalized people's engagement with information systems as agentic responses to systemic oppression. And we also know that since Chapman's original study, there's been an expanse in non-stream and digital news information news sources, which may also provide a more potential resources of helpful news for women of color. So in this study, I asked 3 main research questions, but actually for the sake of time, I am mainly going to talk about the first 2 research questions, which were to what extent do women of color's news information seeking habits fit within information poverty framework and or reflect information marginalization, and how do women of color's social positionality inform their news information seeking habits? And I conducted 8 virtual focus groups, 4 to 8 participants each, which resulted in a total of 45 participants, 18 years or older, who self-identified as women of color, which in this context I defined as just racially non-white. And we talked about their news information seeking habits. These focus groups were conducted from July to November of 2020 via the video conferencing platform Zoom, using a password protected link, and were recorded with participants' consent and lasted an average about 93 minutes. Also, each participant did receive a $20 Visa gift card via email as remuneration after each focus group. So just to review some of the key findings, at least from these first 2 research questions. So R1 asked, to what extent do women of color's information seeking habits fit within an information poverty framework and or reflect information marginalization? And so 35 of the 45 participants in the study said that they actively engaged in news information seeking on a regular basis, which is actually pretty high compared to the average number in the US specifically. And 10 participants said that they were news avoidant. So overall, participants engaged in high levels of news information seeking and saw themselves as having kind of a robust news ecosystem through which they can draw from for available sources. However, in line with some of the propositions of information poverty theory, some participants did exhibit self-protective behaviors in the form of secrecy and deception based on perceptions of risk from engaging in information seeking. And in this case, a lot of these risks were specifically around their emotional well-being and mental health. So Chapman defines secrecy as a way to guard oneself against unwanted exposure of personal reality. But in this case, secrecy presented itself as selective information seeking or participants protecting themselves from information they deem would be either unhelpful or harmful to them emotionally. So P29, one of our participants, said that they were really specific in how they consumed news and specifically used sources like Reddit, where they could curate information about their native community and did not necessarily have to engage with information they felt was either unhelpful to them or irrelevant or particularly harmful. Likewise, in Chapman's framework, deception entails creating a false social reality to protect against unwanted exposure and information seeking. And for a lot of these participants, deception manifested itself as news avoidance or denying the need for news. And again, a lot of this was around to protect their mental health from specifically seeing things they felt were racist and sexist on news. So one participant said, since 2016, they've not wanted to watch TV because Trump had spoiled TV for them. And specifically, they referenced many of the racist and sexist and misogynistic things that he said. And because of that, they just shut that news outlet out completely. So R2 asks, how do women of color social positionality inform their news information seeking habits? And several participants said being a woman of color caused them to gravitate towards reporters of color or seek out reporters who they knew shared similar political and cultural orientations as them. So they were very critical and intentional in the way they went about their information seeking. Similarly, when engaging in news consumption, participants said that being a woman of color informed the lens through which they saw news. And specifically, many participants expressed the importance of a news outlet or sources of attentiveness to systems of power in their reporting in determining their willingness to trust them. So one example where this came up was reported around the COVID-19 pandemic, which we were very much in the depths of at the time. And many participants said that if in their coverage, news organizations did not acknowledge the systemic dimensions of who was getting sick, why they were getting sick, how people were reacting to this virus, it made them very distrustful of that source as a potentially helpful source of news information. And finally, being a woman of color spurred participants' high levels of information seeking. So as P25 said, and I think a lot of participants expressed this similar sentiment, all of these events, everything that's happening right now, it's happening to us, and especially Black and Indigenous women, it's going to impact us the hardest, right? So knowing that there is a risk for them in not having this information really spurred on them being extremely critical and intentional and thought-provoking in engaging in these high amounts of news information seeking. So some takeaways, again, just from these first two research questions. I argue that while some participants exhibited elements of an information-poor environment, often the perceived disconnect between information sources and participants' lived experiences produced a critical orientation towards information seeking and news consumption. And so following Gibson and Martin here, I argue that engaging in a structural analysis of information seeking can shift our understanding of information poverty from an individual deficit to an institutional one, right? Or thinking more broadly about how news institutions then keep these communities in a news information deficit where they are constantly having to seek out more and more because they cannot trust these sources to accurately depict and present information that they feel is specifically helpful to their lived experiences. And I think that there was still often, though, a disconnect participants talked about between their lived experiences and the default information that was often provided to them, specifically through mainstream US news sources. And so when thinking about how news as an institution produces information marginalization and in turn, information inequity, I think it's also important to think about not only how this critical orientation, I think while not necessarily an information barrier, does necessitate an additional labor on the part of these communities in engaging in information seeking. And therefore, while not a barrier per se, could be seen as a form of inequity in that this amount of labor is not necessarily required of a white middle-class American who are engaging with these news sources, right? And so building off of these findings in my more recent work, I have also been examining how Black women and femme folks use digital platforms to find information. Here, not specifically news information, but thinking about information broadly, where I'm defining digital platforms as social media platforms, so your Facebook, X, LinkedIn's, search engines, so Google and Bing, and then also direct messenger platforms, so WhatsApp or Signal. And specifically for this study, I was interested in diving deeper into how Black women and femme folks navigate these platforms to find information they need and feel is relevant to their lives, while also potentially contending with racist, sexist, and misogynoir experience that research has consistently shown happens to Black women when engaging in digital technology and on these platforms. And similar to the last study, I also used focus groups, but in this study first, we had all participants engaged in a 5-day online diary study where once a day they would log in and recall one instance that day where they used a digital platform to search for information. After completing that, all participants were invited to sit in a focus group, and we ended up having about 5 focus groups of about 5 to 8 participants each. And while we're only recently finished data collection for this study and are still very much in preliminary data analysis, I think there are 2 important points that continually got brought up in a lot of these focus groups that I think are important to share in the context of this conversation. First, many participants noted that when searching for information on digital platforms, it was often very clear to them that they were not the default audience for much of the information that was populated. So many people talked about having to amend searches to add terms like Black, Black woman, African American, and brown skin to get information that will properly reflect their experiences. And 2, as a result of this, many participants often turned to informational communities on platforms like TikTok or Facebook groups, where they felt more confident in what they were being told to them would match their desired needs, desired, and lived experiences. And so based on some of these ideas that I have talked about and that have come out of this research and also some of my previous research on news and journalistic information, in a recent article that I published in JAssist, I put forth a model of equitable information ecosystems. And within this model, I approached the question of how to address information inequity, in part by asking how the production of information itself can create inequity within the information, and through the case example of journalistic information production practices. And so when I'm talking about inequity in the information itself, I draw on Buckland's theory of information as thing, or thinking about how information can be defined in one sense as a tangible entity, including representations or informational objects that are actively processed, produced, and summarized based on earlier evidence or events such as books or texts, to argue that exploring information inequity from the perspective of how information objects are produced can help information science scholars more comprehensively address barriers to information equity. So if we return to this kind of horizontal diagonal graph I had earlier, right, if we put information as thing in the middle, right, as information science scholars and policymakers and practitioners are thinking about how to support information equity for historically marginalized communities, I argue it's also important to consider not only these horizontal or vertical dimensions, but also think about the production practices of the information that we are helping people to find, right? And thinking about what is in that information and is it actually relevant or applicable to their lives, right? So one example that I bring up, right, is now we see a lot of partnerships between news institutions, communities, and public libraries, right? So creating systems like this and thinking not just how do we help people access information, but how do we actually help them access information that is going to be useful to them, and understanding kind of the biases and implications in that information and how it's serving these communities is also an important part of this kind of triad to address when thinking about how to support communities, again, towards addressing barriers to information equity.
Chelsea, I'm sorry, you have 30 seconds. There we go. Perfect.
I'm going to stop there. That's the end. Thank you so much. Please let me know if you have any questions. Love to chat more after. Yeah.
Well, thank you so much for that, Chelsea. That was fantastic. We'll try to move along, so we'll have a little bit more time, as much time as possible for Q&A. Jessie, you have the floor.
Wonderful. All right, let me share my screen. And let's all just take a deep breath. My talk today is called Collections Are Our Relatives, Indigenous Interventions. And you'll notice that since the time of being asked to do this, I was invited by Dr. Clarence Maybee. I have shifted jobs. So I am now the Indigenous Engagement Librarian at the University of Alberta, which is in Edmonton, Alberta in Canada. So if you just follow those Rocky Mountains up, keep going, go north, north, north. Now, our time today is going to be spent on kind of three areas of my work. My work is focused on Indigenous information literacy, and so it'll kind of pop into kind of concepts that navigate around this sort of nebula. So the first is thinking about these gaps that exist in our collections, how Indigenous perspectives are frequently excluded, and then how we privilege certain kinds of authorities. The second is that relationality and repatriation prompt a resurgence of Indigenous knowledge systems, and we'll turn to some work by other Indigenous librarians. And then the last one is thinking about, well, what do we do with all this information, right? How does this kind of feed into community care, and what do we go forward with? So quick introduction. The reason why it's so important that I now work at the University of Alberta is that I'm back in my home territory. So I'm Cree Métis, I'm a member of Michelle First Nation. This is a picture of me as a little baby. I'm wrapped up in a waspisan or a moss bag, which is kind of a swaddle. And it's so important to think about this in the context of Indigenous information literacy because land is our most foundational relationship. So even as we go through this work, land is always informing the conversations that exist. It really enables us to exist in these spaces. It enables our work to happen. And so it's useful to kind of have that. And then behind that is the North Saskatchewan River, Kichiwanasipi, which is the river that is in Edmonton. And that is sort of my river that I grew up with. Now, this is a picture of the Auckland Museum librarian, and it's such a beautiful example of the kind of, wood-paneled library that we frequently see. And I wrote a chapter in the book, The Collector and the Collected, and I was looking at this concept that I had come up against again and again of this sort of singular joy of collecting that frequently came from white men. So for many of us, our collections come to us from one white guy's delight in something. He was really interested in throwing spears, for example, or he really wanted to know about folklore around the world. And so he amassed this beautiful collection and then often bequeathed it to a university or a library. And we inherit these collections, but they are bounded by this particular focus on joy. And this is not to say that these collections are inherently racist, that they were chosen in this way. Sometimes they are. But in many cases, it means that we are bounded by this individual's bias. And so we often see massive gaps in the kind of institutional collections that we inherit and that we care for now. And so we can often even think about the way that libraries, museums, archives are frequently named for these people. So we have people's last names adorning kind of the walls of our libraries. And these collections that we steward, we recognize that there are massive gaps in that. Now, from an Indigenous perspective, what this means is that we have to ask who's not in our collection. Now, even with a current kind of boom in Indigenous publishing that we can see, right, there are many Indigenous authors, fiction, nonfiction, academic work. We do see a boom in the area right now. This is a tiny drop in the bucket of the hundreds of years of non-Indigenous people speaking on behalf of Indigenous people about us, about our issues, about our concerns. So we literally have to rethink the way that this absence in our collection means that our collections are exclusionary in terms of authority, right? We can even see this in the way that many of these items that are within these kind of hallowed halls come to us from the perspective of theft. So a missionary and an anthropologist goes to a community, they speak to a number of Indigenous people, they write down their stories, and then that person holds the copyright of a published item. Now, that might be a story that can only be told at a particular time of the year. It might be a story that belongs within a particular ceremony. So we recognize that this sort of authority that we grant through the process of things like copyright is largely misplaced. So this is sort of the framework to think about, okay, what do we deal with when we deal with like our collections broadly? I want to draw on the work of Sandy Littletree, Miranda Belardi-Lewis, and Marisa Duarte, and their work in thinking about this fantastic article that came out in 2020 called Centering Relationality, a Conceptual Model to Advance Indigenous Knowledge Organization Practices. This is a fantastic way of conceiving of this work. And you'll notice that at the center, we have relationality, so this way that we are connected to each other. Peoplehood kind of is that next component. And Indigenous ways of knowing is that circle. So if we look at that one right up at the top here, we can see that these are verbs, things like asking questions, observing, listening. So the actions that we take to create knowledge. And then in this circle, we have the expressions of Indigenous systems of knowledge. So right over here, things like documents, books, songs, tools, that kind of thing. And then, of course, those exist within institutions like schools or libraries. And these can also include things like sacred societies, for example. Now, in libraries, we generally focus on these two, right? What's the institution? What's the thing that we are managing? But an Indigenous way of knowing this system often focuses primarily on those verbs. And in the process of focusing on these individual items, we frequently are kind of breaking apart this holistic system that we see. The other thing I will draw your attention to is this cradle that exists at the bottom of their work of respect, responsibility, and reciprocity that cradles this entire process of information transmission. So as we kind of keep this in mind, right, we know that we generally focus on this kind of thing, the documents, but we also want to privilege in an Indigenous way of knowing, like, for example, I'm a Cree speaker, and Cree is a very verb-heavy language, that these verbs are actually so essential and something that we need to be considering when we talk about information transmission. With this in mind, and I might have to go back and forth on this, we can think about the way that something like repatriation is repairing fracture. So here is a picture of me. I'm in the Field Museum in Chicago, and I'm looking at a sash here that I believe it to be finger woven. I'm a weaver as well, and so you can look at the way that the warp and the weft of the threads are drawn together to kind of understand how this was created. Now, visiting items like this in something like a museum is so essential for this idea of a holistic knowledge system, because for many of these items, they are out of context. We see them as kind of the item itself without seeing how it functions within the entire knowledge system. Now, relationality, like how we connect to these things and the repatriation of it, is really kind of what helps us prompt us to think about, you know, how do these things come together? Repatriation has broadly been seen through a legal lens for museums entirely. How do we return sacred items to people? Kind of in the broadest sense. In a quite specific sense. And I want us to think about repatriation in a broad sense. So that's sort of what my work is considering right now. How do we in libraries think about the concept of reuniting items with the verbs and with the entire knowledge system? Here's a great example. There's my baby. He's named in our language for water, Nipi. And you can see he's in actually the same moss bag that I was in that first picture that we looked at. So that same moss bag. And he's there, and he's being swung in a wewepsin, which is a swing. And so he was rocked to sleep in this wewepsin. There's a blanket swing on a rope. And now putting him to sleep is a specific action. If we think about those concentric circles of Littletree's conceptual model, that's an action, but a singular action might create multiple expressions. So the lullaby song, right? The swing itself, the physical items of the swing, the logistics. How long is this baby going to sleep? What's developmentally appropriate for this age? Even something like, how does this baby stay safe in this space, right? So they don't suffocate, so that they're comfortable and safe. Now, in cultural memory institutions, we tend to separate those expressions, right? A recorded library might end up in an archive. The developmental guidance, childhood development, if that's published, ends up in a library. And the components of this swing in a museum. So you might see the, the blanket and the rope and the spacer, which in this case happens to be a rolling pin. But you might see those three components shown in a museum, but without a baby, without kind of these other areas that feed into it. So it's sort of a kind of a clinical process of seeing this process of knowledge transfer be dissected and separated by outsiders into these assigned cultural memory institutions. And they're largely rendered devoid of meaning in this process, right? So a blanket on its own is not really a functional component for Cree parents that are trying to put their babies to sleep. So when we collect in this particular narrow view of that singular joy, it sort of forces us to replicate these processes of epistemicide when we relate to Indigenous knowledge by removing these items from their entire context. Now, this is some work that I did with Sandy Littletree and Nikki Andrews. It came out last year, and it's in the Journal of Information Literacy. We put together a journal article called Information as a Relation, Defining Indigenous Information Literacy. Now, I've worked in this area for many years, and we tend to throw this concept around, and we wanted something that was sort of a concrete definition that we could move forward with. So our definition in talking with other Indigenous librarians through the course of our information gathering and our theorizing around this is that Indigenous information literacy is the ability to use information to create or gain knowledge while practicing the Indigenous concepts of relationality, reciprocity, and respect. So you can recall that cradle within that conceptual model. Indigenous librarians who provide IL instruction come from diverse backgrounds and typically consider information in the context of their roles and responsibilities in upholding relationships, including relationships to their ancestors, tribal nations, and lands. So largely, we also see this to be a process that is not an individual's process, but that it is shared, that there's a communal approach to it as well. That lands component is really essential because it really feeds into that relationality. What is the ceremonial cycle? What is the language? That kind of feeds into how we make meaning from knowledge. Now, this process of understanding how information is created, using this process of relationality helps us to also use kind of something like repatriation to actively make whole again these knowledge systems, right? These knowledge systems have been deliberately attacked. And so we see this as a process of also being very deliberate in the process of creating information and in thinking about information. So that's the work that just came out most recently that I think ties most I think beautifully into kind of this work, and it, I think closely ties to our discussions today. The last thing I want us to think about in our broad, big theories and our big ideas of my work is that what does this look like in terms of community care, right? That relationality is this intervention into a selfish impulse of collecting. If we can have a relationship with not only the items in our collection, but the people and the wider communities that they're attached to, this enables us to provide better information literacy instruction. The mask that you see on the screen was created by Graham Parody. It's called Quillpocalypse now, and so it was put out as part of an art project during early days of COVID. You'll notice he's using both modern materials like the mesh, but also traditional materials like quills, so porcupine quills, and hide and sinew to create this mask to think about a dystopian approach or a post-apocalyptic approach. Now, what I want us to think about is, inspired by this kind of image and the work that I've been kind of focusing on, what does it look like to see a future of libraries and information that is dedicated to repair, that is dedicated to, for example, harm reduction? So we can rethink our roles as to collections as that of stewards of temporary homes as we work to enable that reconnection within these knowledge systems. It really is a harm reduction approach in the thinking about ourselves as not as selfish collectors, but as some people who are trying to enable kind of the resurgence of Indigenous knowledge systems. So I've included my information here. Again, it's changed slightly since I sent in my bio, but I'm over at the University of Alberta, and these are sort of the big theoretical questions that I've been thinking about in my work recently. So thank you so much for your time today, everyone. Accursed.
Well, please join me in thanking all three of the panelists today for three incredible, well-timed, disciplined, thank you for that, and just honestly, genuinely thought-provoking presentations. Just thank you, Ellie, Jessie, Chelsea, I really appreciate it. There looks like there's a question or two in chat, but I'm gonna use my privilege here to ask the first question. So if you have questions, please feel free to put them in the chat. So I was struck by all three of you by the pragmatism, I think might be one way to put it, of how you view information literacy and how you think it can make a change in the world. So, and in varied contexts, Indigenous information literacy, information poverty, information experience of refugees. So I'd be curious, maybe Jessie, you could take the lead. For you, like, what is the power of information and information literacy to make a change and to change the world for the better?
Yeah, I think coming at this, you know, I had a picture of my baby in there. I'm just coming off of a maternity leave. And I think, you know, having a little baby that I'm like, oh my gosh, I want you to have access to all this knowledge that has been deliberately kept from you, has been deliberately destroyed. And that's hard work, right? And so I want other people that are in the same position, parents who are parents of little Native babies, to have access to this information that sometimes sits within our archives, right? So I think about, you know, lullabies that my grandmother sang that people just simply don't say anymore, but somebody might have recorded that. And so it's, I think for me, it's that idea that our collections are so rich in knowledge that is kept so far apart from the communities of origin, right? And so that process of reconnection, I think, is really powerful. And I think it actually is, it helps us too, because I think it helps us understand why we've held on to some of these items for so long. So yeah, I think that's the sort of pragmat. For me, it's like, let these Native babies live their best lives.
Chelsea, do you have any comments on this?
Yeah, I think, you know, in the context I'm often thinking about, which is, you know, racially and gender marginalized communities in the US, I think about how important information is for community empowerment, right? And social and political empowerment. And I'm also thinking about the long history of keeping information from these populations, the long history of kind of, I think I call it racial disinformation, like drawing from Du Bois, right? Specifically creating information in such a way that is not only not helpful to these communities, but specifically adds to their oppression, right? And so I think when I'm thinking about the importance of creating systems that are kind of addressing these historical kind of barriers to not only accessing information, but really being able to fully use information for our community empowerment, I think it's just so critical and so key. And I think the point of trying to make something practical and concrete out of this is the importance of not just thinking about things in a theoretical sense, but you know, these are real people with real lives, and the stakes are high, right? The stakes are our community, our lives, our survival, right? So we can think about it in the abstract, and we can talk about all of the kind of harmful ways that information has been used against these communities, but we also need to think practically then about how we can shift that and use this information to support these communities in their own empowerment. So I think that's what I would add to that.
Well said. Ellie, do you have a comment?
Yeah, so the question is why information literacy and how information literacy is important to different communities, including refugees communities. We may not all have this experience of being a refugee, but we have all traveled to new places, right? We have, you know, done mini migration from this state to that state, maybe from this suburb to that suburb. And you can easily remember how that new space, and as Anna-Maria Lloyd says, you know, the new information landscape was so unfamiliar to you, the culture, add to that the language, right? How people communicate, what is this culture, what is the infrastructure of this, you know, new society, right? So all, you know, bits of this navigation, you need information, right? As a migrant, add to that, you know, being forced to move, right? As a refugee, experiencing it as a refugee. So information is so important to this community, and being able to use that information effectively, being able to use that information to learn the new society, the new place, the new culture, what they do, how they do things, is quite critical, right? And this is information literacy for them. And my concern is not only, okay, what is information for them? What is information literacy for them? But the so what, right? Okay, we understand that this is the ways that they experience information literacy, but so what? What can we do with this understanding? Let's go one step forward and design our services, resources, whatever we are providing to them, informed by their information literacy, informed by how they use information. People use information culturally, you know, differently, right? So let's design, or let's attend to this aspect, that information and information use for them is something different, right? In designing services, resources, whatever, let's attend to that aspect.
Well, I'm sorry to say we're basically out of time, everyone. So, gosh, we could keep, Clarence, could we get an extra hour or two here? That would be fantastic, because I have a lot more questions. There's more questions in the chat, but I'm afraid he hasn't responding, so I guess it's a no. So, Jessie, Chelsea, Ellie, thank you so much for your thoughtful presentations. Thank you for your responses. And I know I got some more reading materials and some more research, because I think all three of your research agendas are so critically important, and to me personally inspirational for what IL can do for all of us and for our communities. So thank you for your time. Thank you for your presentations. And thanks everyone for joining us today. And I will click it back off to Clarence.
Hey, thank you so much. Well, thank all of you. I agree with Mike. It was wonderful to hear all of your presentations, and it's really quite fantastic. Kind of overwhelmed a little bit. And congratulations, Jessie, on the new addition to your family. It's wonderful. Next, we're going to hear about the Spiral Undergraduate Research Program, and that session is going to be moderated by Secret Permenter. And so I'm just going to turn it over to Secret to get us going.
Good afternoon, everybody. My name is Secret Permenter. I'm a history graduate student at Purdue University, and I am a graduate assistant who works for the Institute of Information Literacy at Purdue. It is my pleasure to welcome you back from lunch and to introduce our Spiral Undergraduate Research Program and their topic today, Algorithmic Technologies and Democratic Engagement, Perception, Participation, and Progress. Spiral, which stands for Students as Partners for Information Literacy, Research and Literacy, was created as part of the Institute's mission to support the creation of a pipeline of researchers and learners interested in developing effective information literacy strategies for countering the variety of information disorders affecting society. The Institute supports a variety of programs for countering the variety of information disorders affecting society. You've heard about a lot of them this morning from Dr. Maybee himself, but that includes the awards, the Best Publication Award, seed grants, and the Spiral Undergraduate Research Lab. Researchers such as Alison Head and Barbara Pfister advocate for students to play a more active role in learning about information systems broadly, as well as defining and enacting information literacy approaches for today's information environment. The Institute includes students in our programming, notably through Spiral, where students play a more active role in learning about and combating contemporary information challenges. I had the immense pleasure of being on the development team for Spiral. Our interdisciplinary team of a graduate student, me, a mechanical engineering undergraduate student, and 2 libraries faculty came together in November 2022 with the goal of creating an undergraduate research program that utilized students as partners approach. We began by looking at the library and information science literature, where we found that information literacy scholars are particularly interested in how to frame information literacy for broader social purposes, such as information literacy for democracy. We conducted focus groups and sent out a survey to learn what information challenges matter to Purdue undergraduate students and what they look for in undergraduate research experiences. We found that students pursue research experiences about things they care about or are curious about, and that they are aware of and concerned about information challenges, such as the spread of misinformation on social media. We use these findings to develop a year-long curriculum for our pilot year, which was this past year, with the plan of investigating perceptions of social media algorithms and information literacy for democracy. 6 incredible students have conducted undergraduate research this year, and they are here today to present their findings of their research to you all. I'll let them introduce themselves, starting with Grace.
Hi, everyone. My name is Grace. I'm a junior here at Purdue, studying psychological sciences and law and society, and I just want to thank you all for hearing more about our presentation.
Hello, everyone. My name is Noelia Alvarez. I'm studying artificial intelligence here at Purdue's philosophy department, and I'm excited to be a part of this symposium and show what we have done this whole year. Thank you.
Hi, my name is Quinn Lochran. I'm a junior studying English literature with minors in political science and law and society, and I too am very excited to discuss what we've been looking at this year.
Hi, everybody. My name is Nancy. I'm a senior studying political science and law and society.
Hi, I'm Maggie Collins. I'm a junior studying political science and Spanish, and I'm really excited to be here today with all of these wonderful researchers.
My name is Abigail Finney. I'm a senior studying computer science, and I will be talking about the next part of our research, our purpose. Young people especially are spending a greater portion of their time online. A recent Pew study found that about half of teens use the internet almost constantly. This time spent online is leading young people to be exposed to more misinformation than in the past. Pew research found that half of 18 to 29-year-olds trust information from social media platforms, which is similar to the rate at which they trust traditional news media. Information sources on social media are less verifiable than traditional news and lead to greater exposure to incorrect and biased information. Algorithms play a major role in the spread of information on social media, shaping the social environment and practices of online spaces. One possible solution to problems with our democracy caused by the proliferation of social media is greater information literacy. We wanted to define some key terms that we used in our research. We wanted democratic participation to be considered very broadly. So we're thinking of it as any activity that relates to elections or political discussion. Some of the significant examples we saw were things like sharing petitions or information about protests and just general discussions online. Most of the significant social media platforms we saw were Instagram, Facebook, Snapchat, and Twitter. And we are defining an algorithm as a process that determines information to display to a user, and these algorithms shape the social climate and customs online. And so for our research questions, we wanted to know what student perceptions are about media in relationship to democracy. And within that, we had sub-questions. We asked them about their perceptions of information and the role it plays in social media and democracy. And then we asked them what their experiences are participating democratically on social media. And we also asked them a little bit about what their experiences are of algorithms on social media in general. And so now I'll turn it over to Noelia to talk about our methods.
Thank you, Abby. I will be introducing us today with the methods. So in order to understand our research questions, our main goal when interviewing our participants was to hear about how they experience algorithms when engaging democratically online. Tana Butcher, she is the author of If Then, Algorithmic Power in Politics. She makes an interesting point about how as a society we tend to define algorithms as these technological entities, and we tend to leave out the human aspect of algorithms when we defined it. So here at Spiral, we decided to conduct in-depth semi-constructed interviews to capture a more diverse experience when exploring this phenomenon. And then here, during our interviews, we ensured that participants to express whatever comes to their mind. There was like no right or wrong answers, because there were some participants that are like, oh, is this okay? Is this okay? It's like, we just want to hear what they experience. So when recruiting undergraduate students here at Purdue, there were two criteria that we were looking for specifically, if they identified as being democratically engaged, and if they had knowledge of social media algorithms. So we here at Spiral, we created a Microsoft Excel sheet to explore different organizations here on campus that seem to have both of these criteria, and emailed them, and we posted flyers within a Quadratics survey QR code, where we could gather a diverse set of experience when conducting our interviews. And here's our overview of our methods we did. So during our data collection phase, we conducted 15 interviews with undergraduate Purdue students. And here, during our interview phase, we recorded the audio on Zoom, and those transcripts were cleaned. And then once those transcripts were cleaned, we entered the coding phase. Students here in the Spiral program familiarized themselves with the transcripts. There were about 4 or 5 sessions that lasted for an hour and 15 minutes when familiarizing ourselves with the transcripts. And then we created a code book using that code book to code those transcripts. And then after that, we entered our thematizing stage, where team members analyzed the coded transcripts, and we were looking through themes that we can see. We first reviewed and revised all of these themes and concluded that 3 themes related to our research questions. And I will head it off to Nancy here to introduce us to our first theme.
Thank you, Noelia. The first finding that we were able to identify from our transcripts is this overarching nature of conflict. Participants expressed a desire to use social media as a venue for productive discourse, but recognize conflict as a central feature of these digital interactions on these platforms. This conflict is the result of an overwhelming amount of information and engagement that's continuously occurring on social media, and can result in a feeling of disillusionment as these expectations for productive discourse are not met. Many participants' experiences and observations on social media are characterized by conflict, along with their responses to various social media environments. This kind of identifies conflict as both a catalyst and the result of social media interactions, which we see in both the effects and presentations of conflict. The effects of conflict on social media interactions can include this previously mentioned feeling of disillusionment, increased polarization, and a general distrust of both other people and information that we see on social media. And here we have interview number 9 talking about causing quite a division between political parties. And presentations of conflict on social media can include things like hate speech, arguments, negative effects on mental health, changing of social norms, and effects on interpersonal relationships.
So this is our second theme, and it's this idea that algorithms influence change. And we saw this happening really in 2 opposing ways. On the one hand, algorithms can really help catalyze and prompt certain civic actions that increase democratic participation. And our data expressed how this could be as fundamental as helping people form their political perspectives and gain access to more political information. But it could also take the form of more active instances of democratic participation. And this first quote here really exemplifies this idea with the prevalence of online petition signing, especially those that are, uniquely catered to a user's particular political preferences. In this case, the example that's given is certain environmental causes like the oil crisis and marine pollution. But we also saw other examples of this idea of increased democratic participation consisting in communications of local protests and rallies, as well as information shared about local student political organizations and groups and clubs. And then on the other hand of this idea of algorithms influence change is also this inclusion of interpersonal pressures that are created by our online peer groups, which tend to end up actually decreasing democratic participation. And we found that this decreased participation typically emerged as a consequence of self-censorship and increased hesitation due to the social pressures and backlash that users tend to experience after voicing themselves politically online. This second quote here really exemplifies this idea. A common trend from our data was that users on social media platforms became disincentivized from voicing their political perspectives and engaging democratically due to the backlash and interpersonal pressures that they experience. And in the future, they end up adopting a more refrained approach to democratic participation and share their political perspectives less and less on these online spaces. And so that's going to bring us to our third and final theme. So I'm going to turn it over to Maggie.
Thank you very much, Quinn. So the third theme that we noticed emerging among our interviewees was the theme of control. So students that we interviewed expressed a desire for algorithmic control or control over what they see on social media platforms. So this theme pertains to how students perceive, experience, and engage with algorithms and information on social media. We noticed that there were two sort of dynamic groups that emerged. So there were students that had more passive relationships to the algorithm and students who had more active relationships to the algorithm. That's not to say that these can't be coexisting. A big theme that we noticed was duality among all of the themes that emerged. Of course, there's a lot of crossover. So students with passive relationships to the algorithm generally felt disempowered when facing feelings of lack of control on social media. So in our second interview, the student said there's a privacy button, you can adjust it, but even if you play with it, it's not really going to do much. So the only solution is you go delete your account, delete the app, but it's the trade-off there. I don't think it's worth it. So that kind of shows a really good example of a student feeling disempowered and disillusioned by algorithms and their ability to control or engage with them meaningfully. Students with more active relationships, on the other hand, generally recognized the actions that they engaged with in order to regain control of their algorithms and what they see on social media platforms. So students may engage in what are referenced as small acts to regain control or power. So these are behaviors that students engage in order to, or online users engage in order to regain control and over what they see on social media platforms. So this can include swiping quickly past undesirable content. A lot of students mentioned closing out of apps when they see undesirable content, or intentionally avoiding certain content. So interview 5, the student states that if they know that if they like a video, they know they're going to be recommended more of it. So they pick and choose what videos they like in order to manipulate the algorithm to present them content that they're interested in. So overall, this theme pertains to how students experience information on social media and how they engage with algorithms. So now I'm going to hand it over to Grace.
Thank you so much. And as highlighted by Nancy, Quinn, and Maggie, the themes of Spiral allowed us to realize that the influence of algorithms in shaping online information consumption, especially in regards to democratic participation is truly undeniable. As we look at the bigger picture, we really ask ourselves, what does this all mean? Our research truly underscores the intricate dynamics at play between algorithms, democracy, and social media, really emphasizing the need for continued exploration in order to create more informed people that are using these online platforms. We hope that these findings can be used as inspiration for participants to challenge the algorithms that they interact with, which can eventually minimize the polarization and misinformation so commonly found online. We call to action more information literacy interventions and education, which can better ensure that students are equipped with the skills to effectively navigate and assess the vast amount of information found online and through social media. Through this investment in literacy education, we can empower individuals to become more responsible and diligent consumers of the information available online and within social media. As Flierl's finishing up this year, we created some future research opportunities and ideas, which include replicating this study within a particular control group, such as gender, sexuality, age, and anything like that that could possibly highlight these control groups and where information literacy education needs to be more prevalent. Continued on, what makes people feel empowered when using the algorithm, and what interventions that test the effectiveness of algorithmic literacy interventions. So basically understanding what interventions are going to be most powerful and positive within students and within the community. And we're just trying to understand what can really be most beneficial to everyone and to get the most out of our research. And then I would just like to thank all of our Spiral researchers and all of our mentors on behalf of everyone for their time and dedication towards this research project throughout the year. They have done an incredible job guiding us and being our mentors and truly helping us throughout this entire process. And I would just like to open the floor to any questions that anyone might have. I believe Secret is going to be moderating, so I'm going to pass it over to her.
All right, I'm going to hop in. All right, everyone, great job with this presentation. For those attending, please feel free to add your questions to the chat. But to get us started, I'd like to kind of go round robin with our researchers and ask you, what was maybe the most surprising or interesting finding that came out of this research where you were interviewing 15 Purdue undergraduates about this topic? Like, what surprised you, or what really resonated? Maybe we can start with, I'm just going to start with go reverse order. Grace, do you want to kick us off and then popcorn to the next person?
Yeah, definitely. So I definitely learned an incredible amount of information throughout this research process, and I'm super grateful for all of the interviews, just because I think something that really resonated with me was being able to reflect on these findings, such as control and these echo chambers and things like that, and realize that I often find myself feeling the same way and feeling unempowered in regards to the information that I see online and what I believe and what I don't. So I think this research has truly allowed me to just reflect on myself and allow myself to be better about continuing to stay educated on informational literacy. And I just am going to pass it over to Maggie. Thanks.
Thank you so much, Grace. I think what surprised me the most or resonated with me the most about our research project was I noticed in a lot of transcripts, a lot of students expressed a desire for better information systems and for easier access to information and for, easier political participation in the future. And I noticed, like, through the interviews while students were talking in response to these very open-ended questions that we would ask them, as they thought about it and thought about their relationships with information online, they kind of, it seemed like they sort of started to become a little bit empowered to think about it. And I really thought that, being able to be a part of that was really great. And it makes me hopeful that so many people are interested in learning and taking information into their own hands. So I will pass it over to Quinn.
Yeah, I was really fascinated by a lot of the parallels that we saw between all of the interview transcripts. And one of the consistent ideas that emerged that really fascinated me was just this idea of the pros and cons that a lot of our interviewees reflected, specifically about algorithms. You know, we'd ask them their perceptions and just how they feel about algorithms on the social media platforms that they use. And lots would acknowledge, you know, it knows me very well, and to this end, it serves its function because it's giving me the kind of content that it knows I want to see. But so often attached to this was just kind of this an additional negative influence, and that there was perhaps maybe exposure to different kinds of perspectives that they'd ideally like to be seeing. And I think this really illuminates why we're looking to information literacy as a solution, as opposed to seeking any sort of intrinsic change in the algorithms themselves. And then I'm just seeing Nancy next, if Nancy wants to chime in.
Yeah, actually going off of what Quinn said, I think that it was particularly interesting to see that no matter the political views that are expressed within these interviews from our interviewees, they all kind of had a similar theme of starting out generally positive or at least neutral towards their social media and their algorithms. But then as we asked more questions and we got more information from them, that's when they started to kind of reveal a little bit more of the negative effects that they see and a little bit more of this disillusionment that they have with social media. And so as we continued going, it was interesting to see that it doesn't necessarily apply just to one political party, not to one particular type of engagement. It's general across the board dissatisfaction. And over to Noelia.
Yeah, I personally loved interviewing people, getting to know their experiences during this time. I mean, Spiral has been beneficial in understanding algorithms more, in the sense, like, personally, I want to go into tech policy. I just came back from Washington, DC. It was everything was literally about algorithms, AI. But a lot of, it was crazy to see like people very interested in our research, especially with the whole, like, I think right now I'm learning about like Section 230, I believe, in terms of like these holding social media platforms liable. How do we navigate that now with algorithms into play? But I thought experiences, like just understanding other, like a diverse set of experiences, was beneficial in understanding like algorithms other than just like the technical form, as I've mentioned, like in the methods part. But yeah, that was my favorite part. Just also when the interviewers were like, I don't know if I should say this. Am I allowed to say this? Like, you could say whatever you want. That's like the point. Like, we want to hear the diverse experiences, like regardless of your background, because we want to see how this affects, everyone. All right, and then I had it off to Abby.
Thanks, Noelia. I think what was most interesting to me was the different ways in which the interviewees took control of their situations. So a lot of them didn't necessarily feel powerless towards the algorithm, and they would use different tactics to get what they wanted out of social media. So they would, intentionally obstruct different political discussions they didn't want to see, or they would intentionally interact with content they wanted to see more of. I thought it was really, I guess I assumed people would feel more powerless than they do. And so I'm interested to see, since they were kind of having to work against the system and against the algorithms, I'm interested to see maybe in the future how those could become more helpful to people so they don't have to work against them.
Thanks everyone for sharing your thoughts about that. Like one of the things that I'm hearing, and obviously we've been discussing, right, is this like dualism, kind of like what Abby was saying, but I'm hearing that in your answers too, that at the same time, you know, greater awareness of your experiences with algorithms can be simultaneously empowering, talking about sort of what Maggie and Abby were describing, but also this awareness can sort of make people just sort of reflect on these sort of negative effects and how that, you know, plays out in their online interactions, but also in their personal lives. So thank you all for that. We have a couple of questions in the chat, but just for the sake of time, I'm going to skip Clarence's question, and maybe that'll be one that we kind of end with. And I'm going to go with Nicholas's question. Did participants recognize the negativity and aggression from all sides of the political spectrum, or was there sort of, you know, feedback that was pointing to one side or another? And, you know, what were people's sort of thoughts about how the algorithm may have contributed to this? So I'm just going to kind of let whoever would like to answer this question pop in.
I don't think that we really saw a lot of like blame being shifted to one side or another within these transcripts, especially regarding conflict. I think that people just identified conflict as kind of a ever-present thing in social media. You will always have conflict between everybody. People talked about conflict between people that they know and like, and conflict between themselves and their family. I think that it was very rarely mentioned specific aggression or conflict from any particular political party or group.
Just to back up what Nancy just said there, I looking at this question, I agreed immediately that it wasn't necessarily specific, at least what we saw, what the idea of conflict wasn't necessarily specific to any one political perspective or side. But in our interviews, we did talk with people with a variety of political backings, and all kind of seemed to corroborate this idea of hatred and intolerance being driven on social media platforms. And to answer the idea about how the algorithm may have contributed to this, we kind of saw the idea that the algorithms tended to commodify this conflicted discourse and push it kind of as viral content. And it's hard to differentiate between discourse that includes hate speech and ones that should be pushed onto people's feeds because it's gaining so much foot traffic.
Thanks so much, Nancy and Quinn. We have another question, and I'm going to encourage other people to, we have a little bit of time, so please feel free to add your questions or raise your hand, hop on the mic. But B wants to know what your impressions are as researchers who are new, recently joined the information literacy world. What is it that you would recommend as the best way to get into this area for other undergraduates or people who are just considering engaging in research for the first time?
I can take on this question. Definitely first impressions were extremely eye-opening, which I was almost not expecting. It was incredible to see how much information is truly out there regarding informational literacy and how much I was just in the dark about things. And I know as we continue to learn about our research and, you know, really dive into these findings, I learned how much of a victim I am to the algorithm and how applicable these things can be to my day-to-day life, which was just extremely interesting because I think it's really easy to live a naive life and think that these things don't apply to you, and that because you're college educated and you're aware of these things that it's really not applicable. And I think that was really just extremely eye-opening and allowed a deep reflection on my part. And recommendations for getting into this area. I know that obviously Flierl is continuing on next year, and I would recommend that to any student interested in this kind of research. But just in regards to anyone wanting to know about informational literacy, there is incredible resources online and all over Purdue libraries and everything like that, that really delves into this kind of stuff. And I truly had no idea before joining Spiral, but going through these kind of academic research journals and things like that, there's so much information on this topic that really needs to be spread out so people are better aware of the subject. Thank you so much for your question again.
Thank you. We have one more question that just popped into the chat. Mark wants to know if our participants found one, I'm guessing social media platform was better than others for maintaining a sense of control over their experience. This is a great question. So I really would, I'm curious what people's thoughts are about this.
I can take this one. Thank you, Mark. I would say it seemed like platforms where it's more algorithm driven than who you follow seemed that the interviewees had more control over, or they felt. So they would specifically mention TikTok and how they would scroll past videos they didn't want to see, or they would intentionally interact with videos that they wanted to see more of. And that's a very algorithmically driven app as compared to things like Twitter or Snapchat, where you're interacting more with people you follow or people you're friends with. Those seem like they can kind of get more entrenched. And especially with Facebook, I think people kind of mentioned turning completely away from Facebook because it's just so polarized. A lot of it is debate, and it caused issues with their families and friends. And another interesting thing is that participants would mention choosing specific apps for specific purposes. So they would say, you know, they specifically use Instagram to get away from political discourse. And so they would not interact with content having to do with politics on Instagram, but they would use apps like Twitter to get more of their news and political discourse. Thank you.
Thanks, Abby. I'm curious if anyone else has anything that they want to add about this sense of control and what we were hearing from the interviews.
I definitely noticed that interviewees who had different needs or wants on social media preferred different social media platforms. Some users mentioned that they didn't really mind the passive aspect of certain social media platforms, whereas others really preferred different social media platforms for their needs. YouTube was brought up a lot. A lot of people brought up YouTube for better or for worse. I think a lot of people felt like that has an algorithm that they can maintain a better sense of control over. But really, I think it depends how the student identifies their needs or their sense of control, or what they want for their experience, if that makes sense.
Does. Thank you, Maggie. Okay, we have, I think, time for one last question before we then get into our artist showcase. So, Clarence, I'm going to come back to your question. And maybe we can start with Noelle on this. What made you interested in joining Spiral and doing this research?
Yeah, I was a transfer student, so the first thing I wanted to do was to get into research ASAP at Purdue. So I was looking around and I saw Spiral, and it stood out to me because it's everything that I want to research in terms of like algorithms and even democracy as well. I feel like, algorithms, you can't see them, but, they affect us very much on our everyday lives and our personal lives. Yeah, I wanted to learn more about that. I personally did not have a background like information literacy, or like I didn't even know initially Purdue had like a library sciences until I was like looking through it. And yeah, it's just, that's what I want to do. I think it intersects well in my even like personal life, like the research skills and what I'm looking at, especially with like AI. Currently like with AI generative tools that I've been doing outside of research. So yeah, that's mainly why I wanted to do it, because it's also applicable to like outside of Spiral as well.
Alrighty, I see that we are 4 minutes until our artist talk, so I'm going to wrap us up there. If everyone can please give a big round of applause for our speakers. Thank you so much for sharing about the research that you've done this semester. If you have any questions, please feel free to reach out directly to me, and I can, direct these questions where they belong if you have things that you'd like to ask later about this research. Okay, thank you all so much, and we're just going to take a pause. Nancy, you can stop sharing. Oh, thank you for sharing the references.
I'm Clarence Maybee, and I'm the Associate Dean for Learning at Purdue Libraries, and I'm also the Director of the Institute for Information Literacy at Purdue. And so I'm just going to take a minute and sort of kick off this session. Today, we're going to hear from two artists who have graciously shared virtual artwork for an Institute exhibition, and I'm going to put the link in the chat. So if you get a chance, please go take a look. And there's some information about the artist, and then there's links to some of their work. I just wanted to sort of, Aly will introduce them in a minute, but I wanted to sort of talk a little bit about, how the Institute, and particularly for the EALS Symposium, how we were interested in, really sharing all different forms of scholarship. And of course, art to me, is a very interesting form of scholarship. And one of the things that I find really interesting about it is I think that I should say that my wife is an artist, so I have had some thoughts over the years about sort of artwork and the nature of art and things like that. And I think that one thing that's interesting about it is that we can talk about the essentially very similar topics to topics we might be talking about through other scholarship like peer-reviewed articles and things. But I think that through art and through many other forms of scholarship, we can sort of say different things and sort of highlight different parts of the conversation. And that's what really interests me about it. And I've been talking to Aly a lot about that this year. And that's kind of last year we did an in-person pop-up gallery, but this year we thought we would prefer to do sort of show virtual work. And Aly has done all the work of putting it together. So, so with that, I'm just going to turn it over to her to introduce our two artists.
Great. Hi, everyone. I'm Aly Edmondson. I'm the instructional designer for the libraries, and then here within the Institute. And in addition to my role at Purdue, I'm also an artist, interdisciplinary artist and researcher, kind of working within photo, intermedia, and that kind of thing. But Clarence had asked me to kind of curate this virtual show, as he mentioned. And so as members of the team together, we kind of went through and decided a couple artists we wanted to invite, whose kind of use of their work kind of uses information and research in their practice. So each artist will have about like 10 to 12 minutes of presenting on their work. And then after each one, we'll have time to ask them questions individually. And then considering time, we'll have like a little joint Q&A panel at the end. We can ask them kind of the same questions and their approach to that. And then, of course, we direct you then after to our virtual exhibition with the link Clarence shared in the chat, and that'll be up for about a month until Friday, May 18th. So make sure you take some time and go check out that stuff as well. So we're going to start off with Bogosi Sekhukhuni, and here's a little bit about him. Lender and designer Bogosi Sekhukhuni offers considerations on cultures and histories of technology and science. Working across a range of media such as sculpture, video, set design, furniture design, and performance, they develop approaches that link through the mechanics of futurity. Sekhukhuni pursues a research engagement exploring material and theoretical histories of living organisms, environments, and physical phenomena. Since 2012, Sekhukhuni's work has been featured internationally in both solo and group exhibitions, including the Fondazione, excuse my pronunciation, Prada in Milan, the Foundation of Louis Vuitton Museum, the Sharjah Art Foundation, the New Exhibitions Museum in New York, the Museum of Contemporary Art in Chicago, the Auto Italia Southeast in London, as well as the African Biennale of Photography in Bamako, Mali. Sekhukhuni was awarded the Pre-Net Art Award from Rhizome in New York, and they are a founding member of the artist group NTU of South Africa, as well as a co-founder of the design firm Infant. So if we could give a little round of applause for Bogosi, and then he can take it away.
Thank you, Ellie. I'm going to read from a script for a few minutes, and then I think I'll share a project as well. It's really bad. Okay, let me start. In the beginning was the beginning. Can it not be said that a state of beginning does not exist in isolation? You can only begin when you have nothing that remains. For there to be nothing that remains, a maximum tension must be achieved. This requires everything. To observers of entropic cosmologies, beginnings are the restless offspring of. A beginning must always carry possibilities it cannot contain. They are formed and informed by a force akin to psychic agencies. A proto-quantum weight that is an emergent great metaphor. There is no depth high enough to describe the scratching. If utopias are real, they might only be real at a state of beginning. A few concepts are sustained by a kind of energy that is of this magnitude. They are rumbling constants before the beginning. Constants that appear, arrive, grip. Constants indifferent or even hostile to universal tendencies. Constants that don't belong. Constants that need not exist. Existing is a fickle thing. It is easy to create a God, but it is not easy to control one. Constants that enjoy a cosmic harmony of interlaced attributes, and so on. If the indigenous shaman of anthropology and other new religions have adept fluency across space-time, or if we can consider the epiphenomenal fates of fictional characters proposed by Michelle M. Wright, or if the subjugated puppet master and Benjamin's historical materialist pageantry debunks core myths directing hegemonic morality, constants that operate before a state of beginning have a relationship to all states of beginning that likely play out in parallel, infrastructural, instructional, and many other ways. one characteristic that makes such likeness through possible represents an unparalleled detachment from all observable phenomena that is unlike anything ever experienced in the known universe, including, unlike Boltzmann brains, tethers to universal information boundaries. Ideas are not responsible to space-time. What if there is no such thing as a universe because there cannot exist one thing that contains everything? An idea arrives, such as the collision of two pairs of solitary hydrogen atoms. Okay. So that is language for a scene and a full-length video that I am working on, which the end of the internet, the work that is being exhibited right now, is a chapter from. So this is yeah, it's something from another scene. And let me get into screen sharing. Okay. Yeah, I thought I'd just show some recent projects. I have this section on my website where I've been uploading, I guess I've been publishing sort of some texts related to an approach that I've been developing called geosociologics, which I think what it is a research methodological framework that interlaces a group of research interests across the environmental humanities, especially have been looking at temporality studies as it relates to geologic time, to histories and philosophies of science and technology, with a focus on particle physics, I guess aspects of particle physics, to evolutionary development biology, and heliobiology, which is a subset within heliophysics, sort of like solar physics. And yeah, and it's curious, it's so this research space, oh yes, thank you, Ellie. This research space meets with like my studio art historical training, I guess, and methods. And I think that the meeting place is where some interesting things happen for me. And I think, and collectively, I also want to say that I think as a geosocial techniques or logics, I think are moving toward I think it's about me moving towards developing a theory. And I guess that's sort of like an ongoing process. And so quickly, an example of a geosocial technique, Bringers of the Dawn, is a project that, so a monument for the 26th century. It marks the orbital path of the main nucleus of the Great September Comet, which appeared in I guess I'm dealing with this the cycle period of this comet that I'm dealing with is from its appearance in 1882, at which point it looks like it might have been the brightest comet like ever observed on record. These are brightness of comets are measured in magnitudes, what is with a negative number, and at its brightest it had a magnitude of -17. The moon, for comparison, has a magnitude of around -11. So this thing was really bright. And the project is kind of combining different sources of knowledge as it relates to the phenomenon of the comet. So I brought together Western astronomical archives, and I have to keep trying to find existing accounts of non-Western or pre-Western interpretations and theories around cometary phenomena. And so in particular, this comet is interesting to me as it relates to some family history involved here, but its appearance for the community that I'm from signaled sort of like the death of a king. And I was creating a comparative, I guess, kind of study with recorded interpretations of Maori communities around its appearance there, and the correlation with an attack that the community experienced around the time of this comet's appearance. But again, yeah, so the technique in the geosocial physics comes in when it comes to how I'm interpreting these archives. And I think, yeah, here I say the monument represents a thought recognizing temporal boundaries that might be associated with C 1882. So what I mean by that is the idea is that, if you take non-Western, at least recorded interpretations of cometary phenomena as having horological significance, as being associated with timekeeping, then at the beginning or an end of a kind of cycle, then the implication for its appearance at a time of the cementing of colonial expansion in the global South is very interesting to think about. And I mean, it's a somber thought, but yeah, it makes me think about what its return cycle might imply for human social histories and context. And so I made a kind of monument as drawing, in a sense. This line or sort of bend represents the angle of the orbital path of this particular comment. A welcome mat in a sense for its its return in the 20th in about 600 years. And yeah, so I think that's all I'm going to say about that. You guys have the link.
You're perfect with timing. I was going to give you a minute, but you're good. So Ellise Antoinette Smith is an artist from Detroit, Michigan, and a doctoral student in the Urban Education Studies program at IUPUI. Smith dedicates her scholarship to creating celebratory spaces for the marginalized identities that she holds, using frameworks such as Black feminist thought, sense of belonging, intersectionality, and critical race theory. She aims to ensure the work and narratives around bigger bodies are included in academia while challenging the dominant ideologies around body image acceptance. Smith's research focuses on the experiences of bodies that identify as fat, with an interdisciplinary focus utilizing mediums such as photography, podcasting, spoken word poetry, social media, and visual activism as a catalyst to center these narratives. Pulling from her role as the Director of Diversity, Equity, and Inclusion at Indiana University, Indianapolis, she centers her work within the DEI sector, working with first-generation low-income students, racial equity, and eradicating injustices for underrepresented populations. Smith is the creator of the Fatness Fiction brand and Plus Size Magic Radio, which has currently over 90 episodes. We'll link to that when she gets started. Just this year, Smith received the 2024 Elevate Diversity, Equity, and Inclusion Advocate of the Year Award that was presented by Eli Lilly from the United Way of Central Indiana. So a massive award. And she is currently a running alumni candidate for the 2024 Indiana University Board of Trustees. So keep a lookout for her. So Ellise, go ahead and take over.
All right, can you hear me through my phone?
Yes.
All right, perfect. Hello, friends. I'm excited to be here today. One, I want to say shout out to Aly and Clarence for providing this opportunity. I also hope that you all still can love me, even though I'm a Hoosier and not a Boilermaker. We recently had our divorce party last semester where IUPUI and I have now split. I went to the divorce party. There were cookies, so it was a good time. And nevertheless, I appreciate being here. And then on top of that, shout out to Bogosi for sharing their work. You know, I think it's amazing. I think it's critical. And I appreciate sharing space with you as a fellow artist. But nevertheless, I would like to get into my conversation today, which is called Lies, Eyes, Truth, and Thighs, the evolution of accepting one's body in an unaccepting world. Lies are told when the wrong people tell narratives they do not own. Eyes are unable to see the souls of individuals who have been silenced. Truths challenge experiences and provides opportunities to be heard. And thighs move the world beyond limited imagination. I share this with you as I try to share my screen. Let's see if technology is going to be my best friend today. Hold on. Is it being my friend?
Yes.
Okay, cool. It's being my friend. This morning, it was really being very evil during meetings. But nevertheless, when I was asked to be a part of this process, I wanted to create a space where I can intersect multiple mediums as a spoken word artist, a photographer, a researcher, a scholar, and everybody's DEI homegirl. I wanted to create a space where we can have a conversation about what does it mean to exist in your body. So we're going to take a walk through this website, which you'll have an opportunity to look at. So at the top, it says evolve with me, learn about me, and then talk to me, which are really cute ways of saying evolve with me by going through this process located on this website, learn about me, which is just the about page, and talk to me. If you ever want to ask me a question, just go ahead and hit me up. But nevertheless, you see this little girl in the background. That happens to be me. And it's funny because my brother and his wife just had a baby not too long ago. And when they had this baby, I found out me and her look very similar, which is very cute to me. So when I looked at this, the reason why I share my baby picture is because at that time, my mother frequently reminded me of my own smile, right? And then what does it look like when you go through life and that smile decides to fade? So as you go through here, the first thing you'll hear is grandma's lessons. Grandma always told me, stand up straight and hold your head high. Wear stockings with every dress. Put on a girdle, remain a lady, always be presentable. Never let the world see you outside of your best. Remember, the world will tear you down. And never let them control your crown. I share this piece, and as you go through this website and you take some time to actually immerse in this work, you'll see spaces where I share spoken word, but I also share photos and artifacts about my life and how it led me to this work. So, strangely enough, when I was talking to Aly about this project, I was trying to get my grandmother to actually take the time and record a video, and she said, absolutely not, right? She said in her own way. And then strangely enough, 2 or 3 days later, a cousin of mine who lives in Weir Shoals, South Carolina. So let me give you a depiction of Weir Shoals. This is South Carolina. That's Weir Shoals. It was always 2 snakes, a raccoon, and my grandparents whenever I visited. So that was about it, right? They lived in a very rural area. But when I was younger, my grandmother had told me she had won a basketball championship for our high school. And it made so much sense why she was an avid basketball friend. And so last night she was on fire when the draft took place. But nevertheless, strangely enough, my cousin tagged me in a photo and said, oh, this is Aunt Shirley. And I looked, and this is an image of my grandmother being crowned in 1956 as the homecoming queen at our high school. And I never knew about that. So I immediately went to her and said, why didn't you tell me this? She was like, I forgot. I was like, okay, that's fair. So under this, you'll also see me provide explanations. And here it says, at the time, I did not know these lessons were coming from royalty, living in an era that dismissed the beauty I was born with. My grandmother was preparing me to exist in a world that will remind me I was not the standard of beauty. But little did they know, I was being prepared by a woman who defied their definitions of acceptance. I was being prepared by a queen. And the reason why I share this is because during this time, we know that sexism, racism, colorism ran rampant, especially in the South and being in a state like South Carolina. And my grandmother talked many times, including my grandfather, about the experiences they had just because of the way that they existed. Not because of the things that came out of their mouth, not because of the things that they did, but simply because of the way they look, the color of their skin, the texture of their hair. And I frequently remember my grandmother telling me these things about putting on a girdle, putting on stockings, and really trying to pretty much put me in this space to protect me from the way the world would actually engage with me. And I didn't understand it at the time. And honestly, I feel like she could have did it a little bit better, but it led me to a space of being reflective and saying my grandmother was trying to prepare me for a world she had already been exposed to. And there was nothing she can do to change the color of my skin. There was nothing she could do to change the way that I looked. But what she could do was say, if you wrap it up pretty in a bow, at least the world will leave you alone for a little bit of time. And I think that was a protective defense mechanism that my grandparents shared with me because of the experiences they had before me. So then it leads me to Sugehood. My nickname is Suge. It's short for Sugar Bear, but I've never been called Sugar Bear. So I don't know if my mother is telling me the whole truth. But nevertheless, I want to talk about my childhood that came from this. So this picture in particular was taken, my mother said, at Sears. If you do not know what Sears is, please don't tell me because you're going to make me feel older. And if you don't know Sears, you probably have never heard of Montgomery Ward. So it's very crazy. My nickname is Spicy Granny. The reason why my nickname is Spicy Granny is because my grandparents raised me. My grandmother would love this shirt, but this right here, a little too much for her. She would say, pin it up. But nevertheless, my mother took me with my grandmother to take photos, and you'll see the comment left under there. Helene Smith is my mother, and she said, your hair is fuzzy because you took off running under the clothes rack, rough and tough, strong woman. So these were characteristics that were placed on me as a child, and I didn't know how that was going to lead to me being resilient. But then, as it states, growing up, I was always ready to smile and remind the world that I was preparing to make it a better place. My mother would often tell me stories of my desire to sing, dance, especially in 2 different shoes. I've seen the VHS multiple times. One was black, one was white, and I thought I had tap dancing skills. I don't. And then twirl around and give everyone a hug. So if you've ever met me, I'll always ask you, you want a hug? I'll wait for your permission and I'll give you a hug. But I remember at one point in time, I used to not even be able to hug my own mother and grandmother. And I couldn't understand what that dissonance was, right? What was disconnecting me from that? And what I started to learn as I became reflective of this work was all of the eyes and the lies that were told about me and my body at a very young age caused me to fold in. So, but at some point in life, that smile began fading, that spirit dimmed, and I retreated to the places that will lead me to find comfort in being alone. I am a big loner, right? But I have learned that most of that is not loneliness. It's just where trauma has become a defense mechanism, right? And through that, it led me to write the following two pieces. Pick last. No one picks the fat kid in gym class. They assume you won't win the race. No one picks the Black girl. They question your intellectual pace. Palms begin to sweat as the captains begin to select. You and you, they say, pondering who is next. Now we're down to the final three. And finally, I guess I'll take you, Ellise. I experienced that a lot growing up in middle through high school. I was low income, first generation. A lot of these spaces, I received a lot of backlash. When I was in middle school, elementary and middle school, I lived in Southfield, Michigan at the time, and my grandparents were in the suburbs, and they were predominantly white areas. So in a lot of cases, I was one of few. And when you don't know how to navigate those spaces, you don't find community in the same ways. So I recognized that. And then when I came to Bloomington, Indiana in 2016, I hoped that I would pass this pick last syndrome, right? I'm like, okay, we're all at a research one institution. We all got accepted. We all here to make change, until it came to the first group project. And it was me and a few others who were not picked. And it brought up all the trauma that I remember. But because I had built that resilience, I looked around at my classmates. I said, hey, pick up your faces, all the unincludeds, let's come together. I can't promise you that they'll be okay with who you are, but I guarantee you we'll have the best project and people will want to work with us. And I proved my point, because the next time we had group assignments, I had a few people like, hey, you want to work with us? You want to work with us? And I turned and I said, you know, I appreciate that, but no, I'm going to stick with the people who I've been working with all semester, because it's not about me leaving and jumping out of a situation just because you want me now. Because if you didn't see my value when I saw yours, I'm going to continue to move with the people who do see it. This is a photo of me in 2008. I went to my senior prom alone, but I embraced the experience. It's funny to me because the car you see behind me is my brother's Caprice. And I did not have a car at the time. I'm from Detroit, Michigan. We're the Motor City. So they said, hey, you need to have a fly car, while everybody else was getting a Mercedes-Benz or Cadillac or this and that. I didn't have access to that. But I asked my oldest brother, I said, I won't crash it. I promise. I'm a good driver. You know that. I said, can I please borrow your car? And if you know anything about old schools, they usually put speakers in the back. So that means the whole car is loud and rattling. And I played every song that I could find that would shake that vehicle crazy. And I did that knowing that, you know, at the time, my middle school crush had promised me we would go to prom together. And we had classes and everything together. And I never heard anything from him. It's very funny now, because when I check my DMs every once in a while, he's like, how are you? And I read it and I don't respond, because you should have responded when I wanted to respond. But nevertheless, we're here. The next poem, They Won't Want You. Ellise, remember they won't want you if you're fat. Try walking so you'll be small enough to be heard. Don't wear bright colors so you aren't seen. Remember, pretty girls are never sloppy. Your body missed the mark of acceptance. Marriage isn't in your future if you don't change. Your voice is too deep. Your heart is too big. You could be more, even less, but you're not enough. And the reason why I share this is because I frequently experience these conversations, unfortunately, even from my family, right? This was the way they navigated the world. And I started to believe in it when I saw like, oh, you want to prom by yourself? And then when I graduated from grad school, most of my colleagues were getting engaged and married. And I was like, did I miss the boyfriend party? Like, oh my goodness, where was that at? I didn't get no invitation. My boyfriend was Wells Library. I frequently visited that place just so I could survive. So I thought about what those different types of thoughts were, right? And I started to begin having internalized oppression and thinking about, you know, imposter syndrome. Was I actually aligning with these things the world said? I learned early that the world didn't like fat bodies. The world told me to change and then I would be accepted. Family told me no man would marry me. School told me no friends would stick around. Life told me that it was easier to be silent, not to fight. I said a change would come. So New tomorrows, I decided to get into research and photography. So my grad school letter, I remember being in my master's program, and shout out to Dr. Lucy Lepold, that second semester, she said, what would you all research if you had a chance, right? So they went around the room, and most, like 97% of my ideas hit me in the moment, and then they grow very quickly. And at first I was like, no, you have to be a better person, a better planner. It just doesn't work for me that way, right? Often people will ask me, oh, you do keynote speeches. How do you write those things down? I said, I don't. I'm also a spoken word artist. All the poetry that you see here came off the top of my mind, and I had to write it down. That's my biggest problem. Like, I can spit a poem, but if I don't record it or write it down, you'll never hear it again. So I'm trying to learn how to capture some of that information. But nevertheless, in September of 2017, I sat at Indiana University in the School of Education Library, and I created the brand Fatness Fiction and the podcast titled Plus Size Magic Radio. These projects were created to tell the counter narratives related to fat bodies. This work has allowed me to research and unpack the experiences of those who lived at the intersections of different body types and understand their experiences while sharing my own. So here you have the opportunity to look at Fatness Fiction's website and also Plus Size Magic Radio. So Aly, I saved you a step. They can go ahead and click that. So this led me into my research. And what happened was, in the summer of 2017, I had a few colleagues who are smaller body than mine and more body acceptable. And they said, but that wasn't the focus, right? When you live in this body, you start to see things a little bit more differently than the rest of the world. So they didn't select me to go with them because of my body. It was just things that I was processing in my mind. So they said, hey, you want to go to Essence Fest? I said, sure, where's that? They was like, New Orleans. I was like, I've never been, let's go. I am a person that has way too much black in my closet and long sleeves, right? Because I think about the trauma that I had. I remember as a 7th grader, taking diet medication, right? Because I just wanted to stop being picked with, and literally causing myself a little bit more harm because of those different things. I would wear long sleeve shirts. You would have never caught me in a shirt like this ever in my life, about maybe 10 years ago. So we went to New Orleans. We were on a street cart, and all my clothes were dark and long sleeve, and I almost burnt up down there because nobody told me don't go to New Orleans in July with all your winter clothes, right? So that was a lesson learned. So I went to the store and I found a shirt that felt a little bit accepting. It exposed my shoulders, and at some point I didn't like the stretch marks on my arms, and the sleeves would blow up whenever we was on a cart, and it was beginning to frustrate me. And I started, like, tears started to fall. And I said in that moment, I said, you have to accept you for you, or life is going to continue to be hard. And in that moment, I accepted it. And this is when I got back to campus a week later. I created this. And then I launched it finally in September. And the reason why you'll see the colors yellow is because the shirt that changed my life was the color yellow. And I promised myself I would never stray away from that color, because that was the moment where I had to make a choice for me. Now, you can't tell me nothing. I mean, you can, but you can't. So that led me to become this researcher in this work, where when my professor said, what would you research? I said, the experiences of fat bodies. And automatically everybody was like, oh, you're not fat. I said, until I piss you off. And then I instantly become a fat bitch, right? I've seen it too many times in my life. So I sat and I pondered, and I wanted to ask the question, how do you define your body and why? So as you navigate this website, you can click this community discussion. It will lead you to this space. And I will ask that you read. This is not a space for harm. I will be keeping a close eye on it with Aly as well. So those comments are being used also to push further my research. But I would love for you all to take an opportunity to click that link and define your body, right? Whether it's fluffy, thin, athletic, tall, whatever you may say. The reason why I want to do this is because a lot of times when people go back and look at this information, they recognize it's not them who told that story, but somebody else. So would love to see over the next month, share this with people, put this information, because it will help me tell a bigger narrative. Nevertheless,
just about 1 minute, Ellise. I'm sorry.
Oh, no, you're fine. Okay. Gonna speed this up, friends. So with that, it led me to become the nickname Dr. Plus Size Magic. So if you go through there, you will see different workshops that I've done related to this work from plethora of different spaces and universities. And in grad school, I use body diversity, or BODEI, which I've coined that hashtag to talk about the experiences of what it looks like to show up in those spaces from different areas, which also led me to do photography and ask you the question, do you love you? Right? What does it look like? For example, some of these photos, individuals had muscles that were cut, tissue that was removed, and just one accepting what does it look like to be in those spaces. And then finally, I want to thank my community, because through this work, I would not have been able to do this. So this is a piece where I talk about people being seen. What does it look like when I have done interviews, gotten support, advice, even these opportunities? Shout out to Aly, you're on there. Because I really want to show that community, and we're more than just what meets the eye. So these are some of the individuals who have supported me in this work. It's a lot more, so I'll probably update this over time to show that work. So the last thing that I will say to you all is your voice is valuable, it's important, and your experiences are critical. So thank you so much for listening. My name is Ellise Smith. I'm your DEI homegirl, and remember, stay magical.
Excellent. Thank you, Ellise. And I see some reactions already happening. So soak those all in. You deserve it. So I'll go ahead to, I know we had a couple questions come in. One was directed to Bogosi earlier. But go ahead, and if anybody has questions coming on for either Bogosi or Ellise, pop them in there and we'll arrange them as such. So I'll go back to Bogosi here with this question from Clarence. Do you have a specific audience for your work? How do you approach communicating complex ideas and concepts to audiences through your work, particularly those related to science and epistemology?
Yeah, Clarence, it's such a good question because I'm literally trying to answer that and have been for the past, couple of years. And in many ways, like my whole studio practice is a wrestle with this question. I really want to be like, how much time do we have? I don't think we have enough time to talk about audience when it comes to like, especially for like, artists talking about audiences. But I think it's what I've been trying to figure out is like a kind of tiered system of output. And it's going to sound very like, I don't know, corporate or maybe, not what you might expect from like an artist to have an approach, but it is kind of, there's this, and then I also must be very transparent. So, because for me, this is very much an industrial like effort, like, and so particularly when it comes to theory, my transparency is around the fact that I am interested in contributing to knowledge economy, and also just being self-aware about the economics of producing knowledge and things like citational ethics, and how that relates to economy. So there's a tier of theoretical thinking for me that I want to contribute towards influencing. And then there's also these other tiers, and I think my website is kind of like a space where you can see me try to answer this question. I've started a program making merchandise based off of more studio type projects, which brings me into a little bit into like product design or just like general design thinking. But yeah, that's so for example, last year I had an exhibition which was, in a nutshell, just sort of like thinking about habitability on an increasingly hostile planet. And I was working with some bacteria species that are extremophiles, basically. And and made sculpture about that, but I've also I'm like in the middle of a campaign introducing a jewelry, sorry, excuse me, a jewelry product, a necklace piece that's inspired by one of the sculptural moments from the exhibition. And then there's like a bunch of lore attached to the concept behind this necklace, which is called a familiar, and it's like positioned as a, you know, jewelry slash companion. So yeah, I think it's an ongoing process of figuring out how exactly to do this.
Yeah, I think for a lot of artists, it's difficult to identify audiences, especially when it's encompasses a lot, right? In the practice and the different kind of fields we're crossing over.
Yeah.
Yeah.
Yeah. And you know, I have like a interesting history with the market, and yeah, which is itself like a pretty convoluted space. So yeah, that's.
Okay. Thank you, Bogosi. I see we have a question for Ellise from B. I know there has been so much body shaming experience online over the years, certainly, yet there's still so much pushback and resistance to bringing light to this important concept when it is raised. When you encounter challenges in presenting your work as a form of activism, how do you respond or encourage deeper thought?
Can you hear me? Okay, making sure. Thank you for that question, B. For me, I will honestly say I have been fortunate that I have not gotten a lot of pushback on social media like I expected, right? I did have one situation. It was another fat body, and they said to me, you know, this is stupid, just go lose the weight. And I said, okay, you first. And I never heard from that person again. And although that may not have been the most tasteful response, I also had to stand in a space where if I did not respond, other people were like, finally, somebody's rooting for me, chose silence. And for me, silence is not it. I think you should be intentional about your response and think you should be critical. But I have been fortunate in that space. Do I say that these things will never happen to me? No. But I am prepared, especially because I have situated my work in diversity, equity, inclusion, to remind people that you only get one body. Right? If we get two, I'll let you know. But as of right now, you only get one. And the misconceptions that come from me, oh, what about your health? And what about this? And what about that? I ask you, is that because of my body, or is that a question you ask anybody no matter what? And usually what comes out of that is bias and discrimination. You have literally thought in your mind these tropes about me being lazy or, you know, unhealthy, or the list goes on. Where I've even had health physicians tell, you know, practitioners tell me like, oh, how are you managing your diabetes? And I'm like, what diabetes? And then when they run my blood work, they find out I don't have those things, right? I just happen to be in a bigger body. I will say during the pandemic, I did lose around 20, 25 pounds. And the reason why I lost that is, one, I had my first heartbreak in my 30s. I really strongly suggest, if you've never gotten your feelings hurt, go get it done this weekend. It's not worth it. And just try life again. So that was the first thing, right? And for 4 months, I'm like, why can't I stop crying? And I've never been like that expressive emotional person, but when my grandmother literally put a sympathy card on top of my computer and said, feel better, I was like, oh, I got to get this together. And then fast forward a year later, he wasn't worth any of that, right? And it's funny because my whole life improved. I got a better job, got a degree, all of these things, and he's sitting over there. And I'm not going to be mean, but so glad that didn't happen. But nevertheless, then the second thing was during the pandemic, I was financially unstable because I was a graduate student. So I had to be very particular about my money. So I was eating once a day, right? And that's not a healthy option, but also when you don't know where the world is shifting, those things have changed for me. But I didn't lose that much weight. I'm still a bigger body, right? So for me, when it comes to those social media spaces, I choose to be resilient and very vocal because I'm not just doing this for me. Sometimes in this work, you have to plant seeds that you may not see grow in your lifetime. It's unfortunate we have to say that, right? I've interviewed people who are educators, models, caregivers. They're people who have changed the world, and they literally are ridiculed because of the way that they look, right? The assumptions that come with the things that they do. People have a lot of experience and identities, and sometimes people be fat. Yes, people be fat, and I'm a fat body. But I still do the things that I need to do in order to make change. So when there's so much other things in the world that we could actually investigate, like our policies around mental health, you know, those who are going unhoused, food insecurity, gun reform, things that are happening, wars, all those different types of things. The fact that somebody may come and say, I don't like you because you're fat, that's the least of my concerns. But what I will do is push past that to create platforms to remind people you're valuable exactly how you are. And if somebody don't like it, scoot your ass to the right. So that is the way that I impact that B. Hopefully that answers your question.
That was awesome. Thank you.
Well, we do have another one in the chat for Ellise as well. Can you discuss any specific techniques or methodologies you employ to research and understand the cultural context of the subjects you photograph or that you incorporate within your media?
Sure. So as you probably all know, I'm interdisciplinary. That was intentional. Like I said, when I wrote my grad school letter, my first 3 words, I am fat, period. That was it. And I know they probably was like, what? Like, what does this have to do with anything? And then I included pieces of spoken word in there as well. So for me, the first thing is I started this work by doing a content analysis on social media. By looking through different hashtags that related to fat bodies, if there were certain memes and images that poke fun at them, going through those comments, reading how people were perceiving things from a non-invasive space, right? Just being very observant. And I saw a lot of bias, discrimination, and hate, and permissible hate, especially if it was okay to be a fat body. One thing that I have noticed in my work, and this is just because of my work, I'm not saying this doesn't happen in other areas, I want to be very intentional in saying that, is if you're fat, no matter your gender, your race, your belief, your political decision, it's okay for people to tell you how you're wrong. And I've noticed that. And I've been doing this content analysis since 2016, and those things have not shifted. For example, if Lizzo wears a see-through dress, it's a problem, right? But if Rihanna does that, there is fashion, right? And these are not things that these individuals are saying. These are the responses from the world who can't even afford to go to the event no way, right? That's really funny to me when people who can't even get into the space got a lot to say. So that's the first thing. The other thing, that content analysis there led me to do one of the engaging work with autoethnographies, right? To be able to hear those stories, to observe. I do a lot of interviews, right? My podcast is a part of that. Even before I started graduate school, I asked them, can I use pre-existing data? Because I was asking these questions of how do you define your body? How does that impact your work? How have you even looked at yourself? And that was some of the information that came from there. So I will be taking qualifying exams this summer. So if anybody wants to do any homework, just let me know. I know y'all want to write a paper for me or something. So I lean towards that as well. And as a qualitative scholar, the one thing that I have identified for my dissertation, so I could finally get up out of here, is creating a body diversity audit, especially for higher education. So different divisions, whether it's housing, admissions, for example, admissions, you have families that come whose bodies are different, right? And I've expanded the conversation to add size into that. I'm even working with our bias incident team because the information around appearance shows up, but it's not a protected class. So it doesn't show up in that way. So I'm using this information to form that. So like the body diversity audit that I want to do for my dissertation, especially for higher ed, is saying, what if you have a family that comes? Because this stemmed from, I saw a young woman and her grandmother come to visit campus, but the grandmother couldn't navigate campus just because she was an older woman. What does admissions do to make sure that families can get the full, full experience and see that with their kids? Because I saw this student get frustrated with their grandparents when it was like you were trying to keep up with the university versus the university thinking of ways to incorporate you, right? I think about those who have disabilities, physical and invisible, right? So my conversation around fat bodies stemmed me to actually look at how other people navigate the world and what can we do, especially from the lens of diversity, equity, inclusion. So right now I'm settling on an autoethnography, but knowing me and my creative mindset, something else will spark up. And the one thing I will say I have been fortunate about, I have not gotten pushback from the academy from different lenses, from different fields. Well, I've talked to public health. I've even talked to education. I've talked to liberal arts. I've talked to a plethora of different spaces, even the Heron School of Art and Design, about how do I create this multi-interdisciplinary space and put it together. And so far, they're like, keep doing the work. So hopefully they don't wait until the end of qualifying exams to say, psych, we was playing. But those are some of the ways that I approach this work from a research lens. But thank you again for asking that.
Excellent. Thank you, Ellise, for answering that. So we have just about, oh, I see one more from Mark. I think this would be, in my work as a librarian, I find myself inclined to solve problems rather than sit with them for a while. Art helps me change gears so I can learn more thoroughly. Thanks so much to Bogosi and Ellise for your thought-provoking work. Oh, it's just a comment, it's not a question, but I would love to see more art like this at our professional gatherings. So thank you very much, Ellise and Bogosi, and thank you, Mark, for sharing those sentiments. It sounds like others agree.
Thank
I have,
you.
oh, sorry, I have one more question rather than type it. I'm just curious of what kind of dream collaborations either of you might have for future artwork, or just things that you see that have inspired you that you would love to work with, particular style of art or artists that we could look up.
Yeah, sure. I'll go. One dream collab is I would love to work on policy with the UN outer space office.
Wow, yeah. I definitely see that
To
connection too. Yeah.
to think about there's so many holes in international law when it comes to low Earth orbit and you know and space rights. And yeah, it's a space that I think just really deserves more attention before, as far as like a potential, economic frontier for everything up everywhere else. So yeah, I would love to be connected with that.
Ellise, did you have a response? We have just a couple minutes, but.
Sure. So on a professional side, I would love to create the Institute for Body Diversity on a college campus. And I would like this to be a collection of research and art. And by that, how do people, history shows that bodies have always shown up in art, right? But also history shows that only certain bodies sometimes show up, especially in a positive light. So I would love to cross-collaborate with different art programs of all mediums to just have that conversation on what that looks like. So I see coming out of that institute, monthly fireside chats, about these topics in different spaces, being able to have artist exhibition shows that are bringing in local talent, but also, national and international talent to share these stories through these mediums, and creating a research journal that pushes back against what we think should be showing up in these spaces. Because like I mentioned earlier, you only get one body, right? So the way that you have to navigate it based on world's perceptions versus people really knowing you, I have seen that literally stifle people from showcasing the talents and the change that they can in the world, because it's like, I'm afraid to be there. In all honesty, if I wasn't doing research, I would definitely be a rapper. But Jay-Z never answered any of my emails. So if y'all figure out how to get Jay-Z to hear my mixtape, I would really have done that. But what stopped me was I was like, you've never seen a fat girl do it, right? You've never seen it in a lot of capacities. But then I had the opportunity in my master's program to look at Black music, and I did a symposium on fat Black women in hip hop. And I found these bigger bodies who had been disrupting and using their music. Like, for example, Queen Latifah, one of her songs that she's well known for is Unity, right? But if you listen to the lyrics, it was about that activism and making change. And that's where I am as also a hip hop scholar. If I could do more of the creative side, I want to do a few things. So MoMA, the Museum of Modern Art in New York, I would love to do an exhibition where I've done it here at IUPUI called WON, What's Our Narrative, where I take photos of these different individuals and then I retell their stories through spoken word pieces that I create, right? So people could see that. I would love to create a coffee book with high fashion houses, specifically Louis Vuitton, because I feel like I've given them enough of my money that I shouldn't have gave them because I didn't have it, but I really wanted that purse. And I had more, the purse cost more than what was in the bag, but that's okay. We all make mistakes. But I would love to work with them in Fendi, right? Because my brand is Fatness Fiction, so it's double F's. But I would love to work with them and create a bigger body collection that doesn't fall into the tropes of what high fashion could look like for certain individuals. And then one of the last things I would love to do is create a coffee style book that incorporates my photography and also spoken word. And then also just continuing to write, you know, non-academic books that talks about these experiences, right? But then also intertwining the opportunity to be very, very creative and continue spoken word, continue speaking engagement, continue training and facilitation, because I also do that within DEI. So if any of those things interest you all and you know how to connect me, please feel free to email me, because I don't know how to do it by myself, because I told you I emailed Jay-Z and he won't answer. So those are some of my dreams to continue this work. So thank you for asking.
Yeah.
Thank you.
Thank you too so much for we're finishing up here. Thank you again, Ellise and Bogosi. And I'm dropping another link to our virtual art show website for y'all to come check out. Remember that it's up for another month. And I'll also have links to their websites on there too, so you can stay in touch with them. But now I think it's time we're turning over to our award ceremony with, I think it's Clarence and Secret. So I'll turn it over.
Okay, welcome back, everyone. Our next session is we're going to celebrate our publication award winner, and Secret is going to introduce the award winner in a minute. But before she does, I wanted to say a few words about the Institute's publication award. So as I talked about earlier, you know, in the symposium, you know, the Institute supports research that explores, you know, the role of information literacy in addressing information challenges. And a lot of the things that we've done really are focused on sort of generating new research along those lines. Our seed grants to researchers and research teams that I'm gonna let someone in. You know, or our undergraduate research program that we heard about just a little bit ago. You know, really it's sort of kind of like, as I say, planting seeds, right? It's sort of like trying to grow those new research. But we also recognize that there's a lot of fantastic research, you know, already going on in the world that kind of does the thing that we're very interested in, right? It sort of talks about new models, literacy models, and things like that, strategies for addressing information challenges. And that led to the idea of you know, having a publication award in which we celebrated and recognized, you know, research that someone's already done. That's sort of, I think, you know, an excellent example of that type of research. So with that, I mean, I want to thank this year's award team. And then I'll turn it over to Secret to tell you a little bit about this year's winner. The team was Samantha LeGrand. She was the chair of the team, and Secret Permenter from Purdue. As I said earlier, Samantha is away. So Secret and I are holding the line and you know, presenting this session today in her stead. And Anthony Tardif from Gonzaga, and Jason Alston from the University of Missouri, Columbia. So I'm very appreciative to them, the committee, that read a lot of articles, you know, reviewed the literature, looking for articles that, you know, an article that was really, as I said, sort of an excellent example of research that explores, new ways, new strategies and new ways of addressing information challenges. And with that, I'm going to turn it over to Secret to introduce this year's award winner.
Hi, everybody. So like Clarence has said, I had the immense pleasure of being on the committee this year. And being on this committee, we saw a lot of wonderful work being done by information literacy scholars to combat contemporary information issues. And while these were excellent papers, one stood out from the rest as its unique use of chatbots to inoculate users against misinformation. It's my honor to present this year's Best Publication Award to Elena Musi for her co-authored work, Developing Misinformation Immunity, How to Reason Check Fallacious News in a Human-Computer Interaction Environment, which introduces two innovative open access chatbots, the Fake News Immunity Chatbot and the Vaccinating News Chatbot that leverage fallacy theory and human-computer interaction to inoculate citizens and communication gatekeepers against misinformation. Dr. Musi is an associate professor and senior lecturer in communication and media at the University of Liverpool, where she is the program lead of the MSc in data science and communication. Her research interests rest at the interface between artificial intelligence and communication, including theoretical and applied argumentation, misinformation, and the development of human-computer interaction technologies to advance critical thinking skills. Dr. Musi is here to tell us more about these chatbots and the work her team has done.
Hi, everyone. And so if that's okay, I can share my screen and sort of like tell you a little bit more about the research, really. And thanks for the lovely introduction. And I'm really thrilled to be here, as you can imagine. Yeah, so I guess I'll get started. So as I was saying, it goes without saying that I'm flattered to have received the publication award together with my co-authors, of course, and I'm thrilled to present an outline of the underpinning research to such an audience. So the paper is actually the output of a research project that was funded by UK Research and Innovation, entitled Being Alone Together, Developing Fake News Immunity. So to know more about the research projects and also the research that my co-authors are developing, please have a look at the website through the QR code, and later on also I'll show you a link as well. So as you can guess from the title of the paper, actually the focus of the research is on misinformation rather than disinformation, and that's for two main reasons. First, as outlined by Brennan et al. In their fact-check sheet about the types, sources, and claims about COVID-19 misinformation, 59% of fake news actually do not contain fabricated or imposter content, but reconfigured misinformation. Second, misinformation constitutes a crucial challenge for fact-checking due to the proliferation of news within and across digital media from journalists, citizens, and bots as well, and the ability of automatic fact-checkers to capture disinformation rather than misinformation. The lack of consistency in truth barometers that are used by fact-checking organizations to label different types of misinfo, and also audiences' cognitive biases that are fueled by filter bubbles. And we all know about those, and probably we're also a victim of those as well. So among interventions, debunking, so the attempts to retroactively correct false beliefs, so for example, fact-checking, traditional fact-checking, have proven to be less effective than pre-bunking, which consists of preemptively show tactics or sources before they strike. There are three main ways of doing pre-bunking, and we have focused on the logic-based one, explaining tactics that are used to manipulate. So to summarize, we focus mostly on misinformation rather than disinformation, and on identifying triggers which can make a news misleading, even when the author didn't mean to spread false content at all. So our main goal is that of reverse engineering the manipulation of information, providing citizens with the means to act as fact-checkers, and also communication gatekeepers with the means to avoid creating in the first place, but also spreading misleading news. To do so, we have combined fallacy theory and human-computer interaction. So I'll explain what fallacies are just in a moment. So our theoretical approach tackles the infodemic through two main fields: computational rhetoric and argumentation mining, and information literacies, and which both require the exercise of critical thinking, right? So I guess we all agree that the proliferation of information across the web calls for computational approaches to understand the roots of virality, winning arguments that shape public opinion, and lines of diffusion of information in crisis scenarios. The kernel of our framework are fallacies. Fallacies are arguments that seem to be valid, but they're not. And we hypothesize that they work as indicators of fake news, and it happened to be so. Our research pipeline consisted of 6 main stages. So we collect data, we web scraped 1,700 fact-checked articles from 5 different UK-based and US-based fact checkers. Then we carried out a multi-layered annotation, and we evaluated the results of the intern annotator agreement as well. And then we analyzed the results statistically in order to surface the most popular cases. And drawing from those, we developed 2 chatbots, and then we also evaluated the chatbots to actually make sure that the chatbots had an impact. So just to give you a few key insights upon the data analysis, the statistical analysis of the annotated data shows that while social media are privileged sources for disinformation, misinformation is spread across the board. Misinformation bears, in fact, positive residuals in correspondence with both broadcast media and government official sources as well. And the fact that misleading information can be spread by authoritative sources, which are relegated to gatekeeping processes, reveals a gap between intentions and outcomes in radically uncertain situations, such as the pandemic. So, we mostly focus on data related to the pandemic. And looking at the distribution of fallacies, it turned out that fallacies were indeed always present in news labeled as misinformation. And so we got our hypothesis confirmed. Moreover, we also identified a decalogue of frequent fallacies, ranging from evading the burden of proof to false analogy to acid generalizations. So I'm not going to explain what these fallacies mean. I mean, each of them, since we built a chatbot for that. And so I'd love you to play with the chatbots if you want to know more about fallacies, or we can discuss about them later on as well. So the system architecture behind the 2 chatbots is pretty straightforward. So the 2 chatbots platforms are basically computational executions of dialogues in a gamification format. So the structure of the dialogue game is written in a tailored dialogue game programming language, the GDL, that was actually developed for that purpose, and is detached from the knowledge over which the game is to be played. Drawing from this infrastructure, then we developed 2 chatbots. So the fake news immunity chatbot, designed to teach the general public how to spot fallacies in news, and the vaccinating news chatbot aimed at teaching journalists and gatekeepers how to write fallacy-free news in the first place. So the design of the front end of both chatbots follows 4 gamification principles that have been proven to be advantageous for teaching purposes: freedom to fail, rapid feedback, sense of progression, as well as storytelling. So if we start from the latter, we have chosen as a setting ancient Greece, as you can guess, through the aid of multimodal features in the graphic design. And as avatars, we have chosen Aristotle, Gorgias, and Socrates because they are the fathers of critical thinking, and also a member of the research project, also because we didn't really want to have just a white male there. To allow for a sense of progression, we have created a reward system where players receive a gadfly in their jars whenever they accomplish 8 correct answers. Furthermore, the fake news immunity chatbot contains 3 levels of increasing complexity. So you start being a credulous, but then you can become a skeptic or an agnostic as well. While the vaccinating news chatbot allows for a user to progressively select different types of tasks, such as fallacy-free headlines or select fallacy-free sources, but also different topics from vaccine manufacturers to politicizing the vaccine. So there are no penalties of wrong choices, and also each conversational turn is followed by a prompt feedback by the avatar. And the locution types expressed by the avatars leverage strategic communication techniques in line with the avatar's personalities. Socrates, for example, asks maieutic questions, while Gorgias advances mostly like rhetorical type of questions. So since their launch in November 2020, the two chatbots have been used by more than 1,700 like users. Well, these data are sort of like old, so probably right now it's a bit more, across like 10 countries. And the two chatbots have also been adopted by the WHO, who uses them as like training materials for infodemic management programs. And okay, let me jump to the last bit of the presentation, because then I'd rather open up discussion about the paper. And so the last bit is about evaluation. Evaluation is a very complex task when it comes to critical thinking, as you can imagine. And so we decided to scaffold evaluation into like 3 different aspects. So first, we carried out a user experience a questionnaire. Then a crowdsourced experiment, and finally a pilot qualitative experiment as well. So the user experience design questionnaire consisted of a voluntary anonymous questionnaire composed of 18 multiple choice and open-ended questions that were targeting chatbot conversational intelligence, chatbot personality, chatbot interface, and chatbot functionality. So these are, standard like parameters that are considered for in human-computer interaction. So more or less 8% of the users gave us feedback, and among those, 94% told us that they were able to explain the fallacies they encountered, and they would think they would be able to recognize them in the future. Users found the fact that sometimes AI participants talked amongst themselves, which is, awkward. It's not generally how it works in chatbots, but they found it interesting, informative, and a minority confusing or boring. So we are exploring right now, also in future projects like multi-agent systems, even further. Aristotle turned out to be the favorite software agent, and the agent considered the most trustworthy since knowledgeable and like intelligent. So those were the main adjectives chosen to describe that character. So to verify whether the chatbots actually exercise user critical thinking for media literacy, then we also conducted a crowdsourced experiment. Well, to be honest, to check whether the self-perception of critical skills improved in the audience. And so the crowdsourced experiment involved 150 Amazon Mechanical Turkers who had to play with the chatbots for 15 minutes and then fill in a questionnaire on Qualtrics that was made up of 8 questions. And so assuming that critical thinking in the media ecosystem implies a process of sense-making the information that is accessed through the news, we have taken as a starting point the sense-making scales developed by Delito and Aly, and then we adapted them to our context, right? So we had like prompts such as like, I found that the chatbot made me reflect more deeply upon the news I read in order to see whether the participants thought their reflection skills like improved. So overall, it turns out that users agreed that the use of the chatbots increased their skills across the 8 factors, but the highest effects, not surprisingly, were found to correspond with factors such as distinguishing or argumentation, not surprisingly, because the goal was that of instilling critical thinking skills in the first place. So finally, we also carried out a qualitative pilot experiment to see whether the use of the chatbots enhanced critical thinking skills in practice empirically. So the study setup was pretty simple. 20 participants were recruited through an agency, ensuring balance across demographic features. And so there were like 2 workshop sessions held on Zoom, each lasting 30 minutes and accommodating 10 participants per sessions, and they were structured as follows. A pre-interaction phase, where the participants were asked to complete a Qualtrics questionnaire, assessing their belief in 5 different types of like news claims through a scale, Likert scale. Subsequently, they were required to provide explanations for their answers like as well. The pre-interaction phase was followed by an interaction phase where they had to engage with the fake news immunity chatbot or read a booklet containing the different fallacies. And finally, during the post-interaction phase, they had to complete again the questionnaire. And then we had a look at the results and we analyzed the results. And after the intervention, participants in both the chatbot and the booklet group exhibited increased skepticism, as indicated by a decrease in the mean values of the credibility score. So we used like a test group and a control group because we wanted to test whether learning fallacies affected news interpretation patterns in both cases, but also whether human-computer interaction environment has more or less influence compared to a static intervention, such as like reading a booklet. Post-intervention explanations by participants who played with the chatbot pointed to fallacious arguments, which were not clearly enucleated by the other group. And also participants who played with the chatbot increased the number of criteria considered when making a reliability judgment. So to conclude, from the development of these two chatbots and their evaluation, it turns out that teaching critical thinking through human-computer interaction enhances the ability to reason check news. And I hope you like this neologism. Thanks. And again, if you have a minute, just like browse through the website. And if you want to play with the chatbot, but you also want to know a little bit more about the design, we built 2 Vimeo videos, a longer one and a shorter version as well, to guide you through the process. And yeah, that's, I think, enough about me. And thanks for having me in the first place.
Thank you. Let's give a warm round of applause for our award winner. It's awesome. And thank you for sharing your work with us. Please put questions in the chat and I can relay them, or just jump on. Just raise your hand and then ask your question. That would be fine as well. I guess one question I had is, it seems like obviously this is, your group has come together to do this kind of work, and it feels like it's probably continues on. And I wondered what is next for you or for the group doing this work.
Yeah, thanks for the question. So we are working on a project right now that has a slightly different goal. So the idea is that of understanding what are the cognitive biases that the network society induces in different types of audiences. And we are building a tool to help. Well, first of all, we have just finished the analysis of cognitive biases that seem to be related to news verification in a digital environment. And confidentially, I can tell you that it turns out there's like availability bias that is very prominent, selection bias, and then of course confirmation bias. The issue with biases is that they're very difficult, of course, to counter, especially those that are not related necessarily just to memory, but really to beliefs, such as confirmation bias. And we are working with the ACH framework, which is the analysis of competing hypotheses that is normally used by the intelligence, actually, to improve their decision-making processes. And we are trying to apply it instead in a fact-checking environment, of course, with some tweaks and changes. And then we are building a tool to sort of like help like fact-checking. But the tool is not just like targeting like journalists or fact-checkers, but also the general public, like potentially.
Okay, that sounds awesome. Let's see. So Rachel asked a question in the chat. She says that this is a great talk. And she's curious, in terms of the users of the two chatbots, right, which you've already spoken a little bit about, but, are you hearing anything from the educators or students, who may be using them? Like, so I guess the question's really about sort of now that you're sort of implementing them, what is the response from your communities?
Yeah. I'm happy to tell a little bit more about the communities that we reached out to. So it's open access, but we don't collect any data, any demographic data, of course, for privacy issues. So I don't have the full picture of like who is using the chatbot on a daily basis. But apart from the location, that's the only thing that we track. But we actually present and use the chatbots for training purposes around the UK quite a bit, and also like in Europe. So yeah, right now we have infodemic managers from the WHO that are like sparse across the globe, actually, that are using it in the training sessions quite a bit. And then students that in communication and media are using it quite a bit, at University of Liverpool, but also beyond, and various charities as well. For example, like Camber Lodge, and so charities that that target and work with the younger population, and have as a goal that of guaranteeing democratic discussions. The last one I've been presenting and using the chatbot for training purposes. It was like training educators, and it was at Cumberland Lodge here in the UK. But then we also worked during the pandemic with the council to sort of like help communication gatekeepers also understanding like misinformation like more. So it's quite varied. I think what I'm sort of like proud when it comes to, especially when it comes to the fake news immunity chatbot, is that anyone can use it, and I think it can be useful across different ages as well. So it's not just like a Gen Z type of chatbot or like a millennial type of chatbot, but it's just like it's understandable across the board.
Well, that sort of leans right into our next question from Mark. Could you say a little bit more about the differences in content between the two different chatbots?
Yeah, totally. So the first prototype has been the fake news immunity chatbot, and the idea was simply, okay, we want to learn how to identify like fallacies and also how to remember how do they look like in order to become epistemic vigilant. And so in that case, what you go through is like you're asked to read some news, and then you're asked, you need to answer some questions, and these questions are in argumentation theory or critical thinking theory, they're called the critical questions, and basically then you get like feedback from the different like philosophers that are supposed to help you somehow reflect upon your decision-making choices as well. So it's mostly a decision-making type of design. So there's no content production, basically. While the second chatbot is meant to help content creators, that communication gatekeepers at large, not just journalists, to pay attention when it comes to the way they craft the news in the first place. And one of the major issues, in fact, that I realize I realize that there's a major issue right now in various journalistic agencies and outlets, especially when they're not necessarily the national ones like the BBC, is that they have to repackage content from an editorial in order to fit social media affordances, right? And so then a lot of misinformation happens in that transfer. So, for example, there's like a whole section around how to write content for social media, starting from a whole article in a fallacy-free way, or how to write headlines that are not clickbaiting. But sometimes it's not just about headlines that are clickbaiting, but it can be confusing because they use very vague terms that can be, polysemous or they make use of like fear-mongering strategies and so on and so forth. So I guess the difference is that one is mostly upon how you consume the news, and the other one is how you actually craft your news in the first place.
Okay, thank you. So if we're close to the top of the hour, so unless someone pops up another question in there, I think maybe we could end here. And I would just like to thank Dr. Musi for for doing this work and sharing it with us today. And then I also want to congratulate you on receiving the award. It's kind of, we're very appreciative of all of the work going on to, basically help our society sort of navigate these information challenges. And so it's fantastic work. And thank you very much for, doing it and producing this article and giving us the opportunity to celebrate you. So let's give a big hand to Dr. Musi, which I guess I saw people already doing. And
thank you so much for the questions as well. And I must say that it's rare to have such an interdisciplinary audience when it comes to communication and media, and all the work that you do at the Institute is very inspiring. So thanks for having me, and have a great last session, I guess.
Okay, thank you very much.
All right, everyone. I'm going to get started because we have 1 hour and an hour goes by very quickly, as we've realized over the course of today. My name is Rachel Fundator, and I'm just really excited to be introducing our speaker, our invited speaker for this hour, this last hour of the Ideal Symposium. Dr. DeVito, Dr. Michael Ann DeVito is an assistant professor of computer science and communication studies at Northeastern University. She is the director of the Socio-Technical Equity and Agency Lab, which engages in qualitative computer science research focused on responsible AI and machine learning in the context of social computing systems. Dr. DeVito's research and her training of student researchers in her lab is rooted in transfeminist, community-focused, and critical approaches to studying the ways people interact with these AI-driven computational systems. And her research really aims to close gaps in understanding between the people who use these systems and those AI-driven social systems in order to enable sustainable, intentional, and mutually beneficial human-AI collaboration. In this presentation, Combating Epistemic Injustice and Securing Socio-Technical Visibility via Algorithmic and Allied Literacies, Dr. DeVito will provide an overview of her research and share findings and implications for literacies that can empower society with knowledge of how to make online spaces more equitable for everyone. So what we're going to do is I'm going to pass things off to Dr. DeVito. Please feel free to, as questions come into your minds, you can put them in the chat. We will be monitoring the chat, and we will make sure that those are brought back up at the end when there's question and answer. If you want to save those also to the end, you prefer to say them out loud, that's also a possibility. So with this, let's turn it over to Dr. DeVito.
Excellent. Thank you so much, Rachel. It was a lovely intro. I really appreciate it. So hello, everyone. I'm very, very glad to be speaking to you all today, because lately I've been dwelling on a set of related problems that I, as a computer scientist, can't solve with my own toolkit exclusively. Now, I keep dwelling upon them because that is how my mind works. I have a hard time letting an interesting thought go once it's in there, but also because I live these problems day to day, and so do a lot of people like me. Let me explain what I mean, or rather, let's have one of my study participants help me start to explain. I didn't think that being trans and being happy could go hand in hand before coming out and before starting this transition journey, because I had never seen a happy trans woman. I had seen TV where trans women are miserable or murdered usually, and that sucks. I was just so miserable living as a boy that I was like, fuck it, I'll take all the negative to not have to do this anymore. And the fact that there were positives kind of blew me away. I wanted other people to be able to see that. Now, that's a quote from a content creator on TikTok that I interviewed, a 27-year-old transgender woman who decided to get on TikTok, throw on some cat ears, and start providing hope, health information, and a living example of how trans women can be happy and goofy and loved and all the other stuff that we all want to be. A trans woman who decided to risk the hate, harassment, and abuse that comes with visibility in order to show other trans women that our lives are worth living and that they can be joyous and, dare I say, even successful sometimes. Now, some of you might think that this type of content creation work is vanity, that it's just chasing fame, that it's performance for the sake of performance. But listen to what this woman is telling you. She had never seen a positive example of what it was to be a trans woman before she transitioned herself. Imagine that. Imagine living in a way where the only message the world has delivered to you about your core identity is, it's hopeless. Give up. Don't bother. This is what trans women in most cultures across the world grow up into. A world where the only tool we have to make sense of our own experiences is despair, essentially. So a highly visible counterpoint, even if she's goofy, even if she does it with cat ears on, even if she's a little cringe about it, isn't vanity. It isn't performance for the sake of performance. It's service. Sometimes it's even life-saving service. Importantly, it's service done while tacking against the wind. It wasn't easy for this creator to get this kind of visibility. As far as she can tell, things like trans hashtags get suppressed, and I've seen enough evidence of the same that I believe her.
Essentially, the underlying algorithmic curation systems assert authority over what kind of content is worth showing to what kind of people, regardless of the fact that a trans woman probably knows a lot more about what other trans women want to see than a decontextualized algorithm trained on all different sorts of people and very few trans women actually knows. Moreover, when this creator chose to become visible to help other trans women see a better future, to see possibility instead of despair, her reward was slurs, attacks, death threats, doxing. That was joined by her content constantly getting removed due to automatic content moderation systems, firing with zero context on her situation, and falling victim to coordinated campaigns of false reports. And despite all of this, not a single bit of help from the platform. No matter how often she reported the hate and violent messages, or how perfectly she followed the platform's policies and procedures. Now, I'm not talking from a detached point of view here. This quote comes from a participant, but it's heartbreakingly familiar to me because it's largely my own experience too. I'm a transgender woman, and it wasn't until my late 20s that I was regularly exposed to media that actually suggests that a trans woman can be happy at all. I'd seen a number of trans women as corpses on Law & Order. That was the most frequent place I spotted us. But that doesn't exactly inspire hope, now does it? Visibility is important. It adds up to far more than fame, especially for marginalized folks, including transgender women. One of the things it provides, as in this case, is information about identity and the hope, confidence, and motivation that can come with that. But it's not just those things that visibility provides. Let me tell you a story about a version of me that existed a while back, a version that knew she was trans and went through all the proper procedures to get hormones. I was really unsure why it wasn't working at first, because she hadn't seen the very clear explanation of what was going on that one only has access to if you wind up in the right parts of the internet, something that's much harder because of the current state of algorithmically driven content distribution and moderation. Now, I was on hormones, yes, but the doses the doctor had begrudgingly prescribed resulted in estrogen levels so low they would even be considered problematic for a postmenopausal cis woman. Any reasonably proficient doctor looking at a cis woman with those levels would have thrown her on more estrogen as a preventative measure against heart disease and more. But not me, not us. We get a tiny dose of the least efficient, most dangerous form of estrogen, pills, and are left to wonder what could be wrong. Now, if I'd had access to good, reliable sources of trans feminine health and cultural knowledge, I would have immediately spotted what's called hundosing, loosely defined as the underdosing of estrogen for trans women stemming from malice, medical incompetence, or most often both, resulting in estrogen levels that are ineffective, scientifically unsupportable, and sometimes outright dangerous to the woman in question. But I didn't have access to that information. I just had the doctor in front of me, supposedly someone well qualified to treat transgender patients, and a lingering feeling in the back of my mind that something was off, not quite right. Now, knowing what hundosing is cultural knowledge specific to the emergent culture of trans femininity. It's also practical medical knowledge that only really exists in this specific cultural context. And this specific cultural context tends to be mediated by various forms of online communication technology, especially social platforms. If I'd had that cultural knowledge, that cultural medical knowledge, I would have known I was being treated unjustly, but at first I didn't. For a minute there, I thought it was just me, that there was something wrong with my body specifically, or that maybe the hormones didn't work so well, as so many disingenuous narratives about trans people claim all the time. Now, as I'll explain momentarily, that state of being only lasted a little while for me. But now that I do academic work in this area, I've consistently found that many trans women get stuck hundosed for months, years, stuck in a state that's unnecessarily physically and psychologically stressful, and which creates an overall outward appearance that makes them very easily targetable for real-life violence. I'm talking about 20-year-olds who spent the last 2 years of their lives experiencing menopause symptoms. That's not right. That's not good medical care. But how are you supposed to know that if the spaces that have the right information in them aren't visible due to censorship from platforms? Now, back to my story. I was being hundosed, and though I didn't have the word for it at the time, I knew something wasn't right. Now, when I think something is off, I do something that's pretty unreasonable to expect of most people. I just read journal articles from the relevant area until I can figure things out for myself. So I, instead of working on my dissertation, like I really should have been at the time, taught myself endocrinology from scratch, journal article by journal article. This is obviously not something everyone, or really anyone that's not in med school and training to be an endocrinologist, should have to do. There should be high quality information available in the spaces people already frequent, all nicely summarized and ready to go if we really want to help people take charge of their own medical care. But there wasn't, and often still isn't, partially because even well-validated transgender health information with scientific sourcing and everything often gets content moderated away by online platforms. After all, it does appear to be coming from random trans women without medical degrees. Couldn't that just be medical misinformation? Now, me being me, I went back to that doctor. I went back to that doctor with articles and citations and charts and graphs, every piece of information I could get my hands on. I went back and I calmly explained, and I do mean calmly, that I thought I was being underdosed. Backed up every point. I was polite. I was diplomatic. And do you know what this man said to me? You know, it's not very ladylike to be so argumentative. This man had no idea the danger in that room that day, but I remained polite. Now, in that moment, all that mattered was my identity, a trans woman with no real power. My own knowledge, my own work, completely discounted just because of who I am and what my body is like. It is hard to fight back against that kind of injustice when you're dealing with someone who supposedly is more knowledgeable than you and who supposedly is supposed to be trained to leave their own biases out of it. Which is why we need to make sure folks have the hermeneutical resources to realize that they're being treated poorly, to realize that what's happening to them is actually medical transphobia. And it's not just medical transphobia. This is true of medical fat phobia, medical sexism, medical racism, or just plain old cruelty. Both of the stories I just told you point to two deeply interrelated issues: the need to protect, secure, and ensure socio-technical visibility, and the need to combat epistemic injustice. Now, in this context, I would define secured socio-technical visibility as the ability to gain and control visibility via socio-technical systems such as social platforms and communication tools. Socio-technical visibility is the engine which enables trans women to find relevant cultural, health, and well-being information. We're not out here pursuing views and the accompanying torrent of hate that comes alongside them to get famous. We're doing it because we want people to know that actually, if you transition, you'll be fine. You'll be better than fine. You might even be happy for the first time in your entire life. To the extent that some of the most common stories I hear are that transitioning was the only thing that stopped a young trans girl's suicidal ideation, or was the first step into finally kicking a serious long-term drug habit. Socio-technical visibility is crucial, and we need to protect it. As for epistemic injustice, Miranda Fricker, kind of the reigning queen of epistemic injustice, has a whole book that defines it, and it's a great book. But I love how one of my junior colleagues, Leah Ajamani of the University of Minnesota, paraphrases her core definition. The stripping of one's rights to be a knower, such as the right to be an authority on one's personal experience. Epistemic injustice essentially says your knowledge doesn't matter if you're a certain type of person. It's horrifying, but to many of us, it's familiar because it's something that happens to us every day. And when we look at epistemic injustice in the context of socio-technical visibility, we can see that our content moderation systems, the algorithms that determine what content will get distributed to whom, and the policies and reporting mechanisms that socio-technical systems employ can all easily become tools of epistemic injustice by denying us safe, consistent socio-technical visibility, which in turn cuts us off from creating, sharing, receiving, and building a stock of crucial cultural, health, and well-being knowledge native to our own communities and based in our own experience. In practice, building a socio-technical system that fails to provide safe, consistent visibility for marginalized people and the knowledge we hold is epistemic injustice, and it needs to stop. It has to stop now, before more people get hurt, before more people slide into despair. To further dig into this pair of problems, I want to talk specifically about two relevant forms of epistemic injustice, which tend to happen simultaneously when enacted via socio-technical systems: testimonial injustice and hermeneutical injustice. Now, according to Fricker, testimonial injustice occurs when prejudice causes a hearer to give a deflated level of credibility to a speaker's word, whereas hermeneutical injustice occurs when a gap in collective interpretive resources puts someone at an unfair disadvantage when it comes to making sense of their own experiences. When it comes to safe sociotechnical visibility, these two key forms of epistemic injustice are often very deeply intertwined, with one causing or exacerbating the other due to the downstream effects of a lack of safe sociotechnical visibility. The examples we started with all fit into one or both of these categories, mostly both, of epistemic injustice very, very nicely. If you think about the story I started with, about the trans woman making content to show that being a trans woman can be a good and successful and joyful thing, we can see plainly that testimonial injustice is in play in two forms. First, the creator has to fight for any kind of real content distribution. She has to fight for even basic visibility because trans content gets suppressed. She has to fight content moderation systems that consistently remove her content for no discernible reason at all, just like they do trans content broadly and content from other marginalized groups, as work from my colleagues Oliver Hamison, Samuel Mayworm, and Hippie Thatch at the University of Michigan has repeatedly demonstrated. The system gives this content creator and trans content creators broadly a deflated level of credibility just because of who we are, just because of the experiences we're talking about. Now, that's the more obvious way testimonial injustice is in play here. But maybe more importantly, there's the fact that despite promises of safety, both literal and implied through the presence of terms of use, content guidelines, and a platform reporting infrastructure, this creator is constantly subject to harassment, abuse, and even threats on her life that could motivate anyone to silence themselves. And turning to the platform's reporting systems with the expectation that reporting such things will result in the enforcement of those platform policies has proved useless. In fact, many creators I interviewed say filing reports just results in less content distribution. No protection, no help is coming, essentially. It's just you marking yourself as a target for further discrimination. I would argue that not extending the equal protection of a platform's policies and safety and security tools to a marginalized person attempting to share cultural knowledge is in fact an insidious embedded form of testimonial injustice, where a platform's negligence in good enforcement denies a creator safe sociotechnical visibility, and therefore practically usable sociotechnical visibility on the basis of who they are and the culture they represent. Now, what of hermeneutical injustice? Well, think about the downstream effects of reduced distribution, unfair and uneven content moderation, and creators dropping out because they have no protection from harassment, abuse, and violence. When it comes to cultural information and sociotechnical visibility, testimonial injustice for the creator becomes hermeneutical injustice for the audience, because without safe sociotechnical visibility for the creators, young trans women don't get to be that audience in the first place, won't get to see that trans women can be happy and loved and successful, won't get to see that transition itself works and is healthy as an option that is very much within reach. The cultural information that trans feminine creators provide is cultural information young and newly realized trans women use to make sense of their social and societal experiences, to sense make around what is essentially a whole new way of being. Without that connection to our larger culture of trans women, there's no knowledge, no tools, no collective interpretive resources to use in navigating a brand new, complex, intense experience. There's no help in trying to come to know the self, just confusion and despair. Now, what about that second case I talked about around knowledge of hormone replacement therapy, or as it's increasingly called, gender-affirming hormone treatment? Well, again, the fact that culturally relevant medical information about trans feminine HRT both struggles to get visibility and is frequently moderated away is a form of testimonial injustice. Despite the fact that the official medical sources have a long history of ignoring trans issues, despite the fact that the vast majority of doctors have little to no knowledge of trans health, despite the fact that the medical policy consensus is demonstrably and egregiously disconnected from the scientific evidentiary consensus on our medical issues, despite all of that, the fact that this information is coming from us, from locally in the community of trans women, makes it a target for removal and suppression without any attention to any of that important context. The vast majority of trans women trying to provide medical information to our sisters come with more evidence, experience, and proven results than most formally educated doctors do in most areas of their practice, especially pediatricians. And yet, because of who we are ignored, discounted, and denied sociotechnical visibility. Our testimony ignored, our experience and knowledge simply deleted. Plus, since a lot of this information gets shared in standing community online spaces, this uneven and unfair enforcement of rules around medical information sometimes expands out to the restriction or destruction of important cultural spaces, silencing us further. And for the people that needed this information, but either struggle to find it due to suppressed content distribution and things like word filters, restricting searches on key terms, or those that simply have no chance of finding it in the first place because it's been restricted, reported, removed. Well, for them, that's all more hermeneutical epistemic injustice. Because without that cultural information, you don't know if you're being hundosed. You don't know if an ignorant or malicious practitioner is forcing you into menopause at 18 or 19 years old. You don't know that if you keep going underdosed for too long, your heart health will suffer, and you'll be at a higher risk for strokes and heart attacks. You don't know any of that because of uneven enforcement of platform policies that were written in a way that's ignorant of our realities in the first place, that denied you the interpretive resources you needed to make sense of your medical experiences. The simple fact here is that when socio-technical systems fail to provide us with safe socio-technical visibility, they are directly enacting epistemic injustice, both testimonial and hermeneutical, that actively damage people's lives, and sometimes leave people in such despair or such medical distress that they feel that they have no choice to give up or to choose a path that none of us want to see people have to choose. Now, if you're mad on our behalf at this point, if you're feeling like you're hearing about a near unforgivable injustice, well, I'm right there with you. But we're actually not done cataloging all the problems yet, because all of this plays out on the backdrop of what I consider one of the most distributed and pervasive hermeneutical injustices of the modern age. Think back to our first example, a transgender woman trying to create and distribute transfeminine cultural and health information via TikTok. As I told you, she struggled to get her content visibility, and when visibility did come, it often brought danger with it, harassment, abuse, and more. All of that alone would be enough to constitute a problem, certainly. But there's a deeper hermeneutical injustice embedded in the why behind her struggle. On TikTok specifically, this injustice takes the form of what I call the trap of algorithmic visibility, and it works like this. Transfeminine creators are offered a door to visibility. Make content that folks engage with those folks in turn, and will make you visible to wider and wider audiences, allowing you to do more and more good for your community. But behind every single one of those doors to visibility is a trap. The visibility just keeps happening without any regard to context. Things go well for you, the system keeps distributing your video to more and more people like the people that are engaging, and that's great. But if things turn around on you, and suddenly most of the engagement is harmful and abusive, well, the system keeps on distributing your video to more and more people like the people that are engaging. And now that's horrifying and traumatizing and materially damaging. You've given up ultimate control of your visibility to a system that does not share your values, your sense of scale, or your particular safety concerns as queer or trans person. And all of that is in the context of content moderation and conduct policies that don't count transphobia, transmisogyny, and ableism as hate speech, and leave queer and trans people without a useful way to report harassment and abuse. All of that on its own does add up to testimonial injustice. But it is the fact that transfeminine creators are essentially required to figure all of this out, to sense make around these massive issues around distribution, safety, policy, the whole lot, without help, without transparency, without visibility into the mechanism, without any useful explanation. It is the fact that this dynamic, this trap of visibility, plays out in a platform landscape where our socio-technical systems are allowed to be deeply opaque, almost inscrutable, and are allowed to rapidly change without consent, without notification, and without an opportunity for retraining, either formally or through one's own sense-making process, before one is thrown to the algorithmic wolves, so to speak. That opacity, that dense secrecy, that is the insidious, pervasive hermeneutic injustice that undergirds all of the rest of what I have talked about. We have built testimonial injustice machines and unleashed them on our world, and we have made them near impenetrable to the average user. We have purposely induced a gap in the collective interpretive resources of users when it comes to knowledge of how platforms work. And without those interpretive resources, users are left entirely on their own, with no guide as to how to make sense of their on-platform experiences, with no guide as to what algorithmic doors are loaded with severe algorithmic traps, And now, this now common design decision, and I will remind you, it's a decision. Our systems did not have to be like this. We chose, platform companies chose to make them like this. This common design decision directly threatens a hermeneutical resource that actually we've drawn on for centuries to manage visibility. See, classic visibility is pretty simple, actually. It's something most people can just figure out on their own. Outside of the world of socio-technical systems, the pursuit of visibility simply boils down to an interaction between the projection of a desired identity by the self and the responses of others or the audience to that projection, right? This is very classic Goffman. The whole thing relies on you knowing who your audience is, because with that awareness of who your audience is, you can decide how to act. The awareness of audience is your chief hermeneutical resource when it comes to managing visibility everywhere but socio-technical systems. But TikTok's a different sort of environment. TikTok is a place and a platform where content is delivered via an algorithmic curation system, the For You page algorithm. Algorithms radically change the game here. They're designed to be opaque. You're really not meant to know how they work or why, and they change constantly. Figuring them out one day doesn't mean they're going to work the same the next day or the next hour or in 10 minutes or even if you refresh the page. That's a big issue because that means users struggle to understand the very mechanisms that directly control content distribution and audience composition, the mechanisms that determine how safe things are going to stay for you if you're part of a group that's likely to be targeted. Socio-technical platforms take away this key hermeneutical resource and by the very nature of their operation become engines of hermeneutical injustice. They take away the knowledge that lets us keep ourselves safe while still pursuing useful visibility, and they do so with not so much as a sorry for screwing up your whole way of doing things, sorry for ruining your livelihood, sorry for breaking up your community, sorry for putting you at risk. No, nothing like that. Just advertisements and more opaque, disruptive change down the road. Algorithmically mediated visibility systems, in the absence of clear, transparent, explained, and explainable systems, are inherently engines of hermeneutical injustice because they deny us a way to make sense of a key part of our world by denying us the key interpretive resource that is the truth about how they work. Now, hopefully I've gotten you good and angry here because you should be angry. I'm not just saying epistemic injustice because it's the right academic terminology. I'm saying it because it is an injustice that plagues people like me, our communities, and that gets people hurt, that denies them community, denies them aid, denies them hope. You should be angry. I certainly am. Livid might be a more accurate word for my state. But times like these, I take a deep breath. Because pure anger, no matter how incredibly well justified, tends not to actually change the world for the better. And as technologists, designers, critics, literacy experts, we have the tools to do something about this. And we have a built-in model of adaptation against this kind of epistemic injustice that we can start from and build on. Let's look at another trans woman trying to create cultural content while facing the twin testimonial injustices of unpredictable distribution and lack of equal protection against hate and harassment to see how she's handling it to start with. This particular trans woman creates science-based educational content and transgender, sapphic, and Jewish cultural content. She told me about a time where one of her explainer videos attracted the wrong kind of person to her comment section, saying, "It definitely started with a few comments from more conservative people. That got responses from my more left-leaning audience, and then it really blew up over the course of 2 days. And then there was a 24-hour period in which it was being shown to neo-Nazis. Fights started happening in the comments, people would say some shit. That kind of engagement really seemed to spur the algorithm on." This is a classic case of those twin testimonial injustices I mentioned rearing their ugly heads, exacerbated by the hermeneutical injustice that is the deliberately opaque socio-technical visibility system of TikTok. Now, a common objection I hear when I tell this story is, how can this really be an injustice when the creator has the option of simply turning off the comments? Another creator I interviewed explained why not very well, saying, "If one of my followers goes like, 'Help me, the super straights found me,' or something like that, then I won't see it. And that scares me more than the idea that I have to go and delete a comment. The system has just as much of a chance to filter the abused as it does the abuser. I just don't want to silence people that do need to have their voices heard." This participant is very typical of those I've worked with. The whole point of her being on TikTok is to provide a safe community space for other, mostly younger trans people. That's the whole reason she stepped through that door to visibility, the whole reason that she took the risks of being visible. Cutting off the comments would negate that entire mission. She's not there to get internet famous, she's there to help, and she's not going to cut off the people she's helping. To put it in terms of epistemic injustice, most of the trans feminine creators I worked with, and as I expand my work out, most of the marginalized creators more generally I've been working with, do not see cutting off a key avenue for sharing collective interpretive resources on trans health, trans culture, trans identity as a viable solution to their testimonial injustice problems. Because all that does is shift the burden to young community members trying to sense make about their world. In other words, they are wholly uninterested in solving their testimonial injustice problem by transmuting it into a hermeneutical injustice problem for others who may in fact need their help. And to be perfectly transparent about it, I believe they're 100% right in their refusal to do so. Just shift the hurt to someone else isn't a solution. It's a dodge. It's a nasty little dodge at that. Instead of taking the cheap way out, trans women doing this kind of work try something else, and we can learn a lot from it. Look at this quote again. Notice that this creator isn't just baffled as to what happened here. She's not just telling us about the incident. She is presenting a theory of what might have happened on the technical side of TikTok to drive and exacerbate the social disaster that is a comment section full of people who count as deeply rude and hateful even among neo-Nazis, which is really something. Trans feminine creators and queer and trans people seeking online visibility more broadly tend to employ a natural process that all of us engage in to try and navigate these kinds of situations called folk theorization. Now, a folk theory is an intuitive, informal theory that an individual develops to explain the outcomes, effects, or consequences of some aspect of the world, usually a process of some sort. They're how we think through complex systems in the world when we don't have the kind of detailed, direct knowledge that comes from training and expertise. We turn to folk theorization because we need to make decisions anyway, whether we have the truth about a process or a platform or not. In the context of HCI and social platforms, folk theories are how we figure out how to navigate algorithmic environments, even though platforms refuse to tell us how they actually work, even when we ask nicely. They are how we construct useful guesses. Folk theorization is our built-in natural cognitive bulwark against platform-mediated socio-technical epistemic injustice, a hermeneutic tool that lets us look at our situations and without much outside aid at all, wrest interpretive resources out of the technology itself and out of our collective attempts to sense-make around these injustices. In the specific context I've been discussing, transfem creators start by building an overall folk theory of how TikTok forms audiences and distributes content. Here, that overall theory mostly takes the form of what I call the expanding stages folk theories. Most of the creators who participated in the study were working from some version of the expanding stages theory, and I asked all of them to draw their folk theory out for me. That's what you're seeing here. This is one creator's version of the expanding stages theory. This creator believes that TikTok works like a system of ordered pathways. First, a post goes out to your followers, especially those followers who watch and engage with content that has the same hashtags as the video you're just posting. If the video is a dud with that first group of viewers, it gets very little engagement, pretty much only gets distributed to your following page. Its time on the For You page is over. If the video does well, though, well, it winds up on the For You page of folks who don't follow you, but TikTok has reason to think would follow you if shown the right one of your videos. Then, if you do well there, you go to the general For You page. You're at the beginning of some level of what we would call virality. Now, that's what happens when TikTok is making good guesses about who the audience for your video should be. But this theory also strongly asserts that TikTok makes mistakes during this process and makes them a lot. When TikTok gets it right, it sends you to an audience that is genuinely receptive to your content, that wants to watch, enjoy, engage, and learn from it in a positive, constructive way. It sends you to what most creators I know call your side of TikTok, where folks like you, content like yours, are going to be welcome. But when TikTok gets it wrong, it sends you to the wrong side of TikTok, where there is plenty of engagement to be had, but it is not constructive engagement. It's weaponized engagement, it's harassment, it's hate speech, it's threats, it's coordinated campaigns of abuse and false reporting. It's doxing and consequences that can spill into the offline world. Because hate, sadly, is a spectacular engagement from a purely computational point of view. Let's take a look at how this works in practice by returning to our creator trying to create and share crucial scientific and cultural content specific to the lives of trans women, sapphics, and Jewish people. This participant stepped back and used her ability to folk theorize as a hermeneutic resource to sense make about her situation. Working within her own personal version of the expanding stages folk theory, this participant thought through the situation and realized that conversations drive visibility, yes, but specific kinds of conversations with specific kinds of people drive visibility with specific groups. That theorization then informed new versions of her strategies and policies for moderating and responding to comments for both herself and the moderators on her lives and the people that frequent her comment sections. No more engaging with the trolls for her followers under any circumstances, because according to her read of the platform, her read through this folk theory she has, correcting anti-Semitic, transphobic hate pretty much looks the same as agreeing with it to the platform. So they've got to just cut that off right away. This creator's folk theory of TikTok allowed her to figure out what to do to protect herself without sacrificing her goals and creating hermeneutic injustice for the young, science-minded Jewish trans women that look up to her as a role model and rely on her for guidance as they find their own way in the world. She didn't have to cut off the core thing she was trying to build. Hermeneutic resources via building community, right? Because she had a folk theory that let her formulate alternatives and get around the lack of knowledge. Now, folk theorization is a key step towards helping people fight against epistemic injustice, but it's not just going to solve everything automatically. The folk theory we're talking about here, the expanding stages folk theory, and the way it plays out across features like comments, it clearly reflects what I call a structural folk theory, or a folk theory that takes the structure of the algorithm, the component pieces and criteria on which the algorithm bases decisions into account, therefore giving the theorizer a why and a how to think through instead of just a what. It's actually a relatively uncommon type and level of folk theorization that requires the user to be good at gathering this kind of knowledge, determined to persevere, and willing to take a lot of nasty hits as they try things out on their way to the knowledge they need. That's not really a reasonable expectation of most people, and far more common is something called functional folk theorization, where the person theorizing can only figure out the what behind a socio-technical system. You know, they know what the end result is, but none of the mechanistic pieces that are so crucial to forming a useful folk theory. So it's a far less useful tool for combating epistemic injustice. Now, as you'll notice, there's also another axis here. Structural theories have to be actionable to actually enable and motivate adaptive use of platform tools. The expanding stages folk theory is an excellent example of an actionable folk theory because you can actually do something with it. And it's not particularly flattering to the platform, but it also doesn't have embedded components that say this platform hates you and is against you. Of course, the existence of that implies an opposite, and that opposite is the demotivational folk theory. Demotivational folk theories are folk theories that do not help guide the user in evaluating options and strategies, but instead only help the user explain what they see as unacceptable and intractable behavior on the part of the platform. Now, the cultural context folk theory is a great example of platform-based testimonial injustice in the form of a demotivational folk theory. It serves as a demotivational explanation for many ills perceived by creators and holds that the root cause behind many issues on the platform is a basic lack of understanding of, or even desire to understand, trans culture, experiences, and language. This theory is a major reason people avoid using the reporting systems, even when something is blatantly transphobic. As one participant explained, I can report it, but on what basis? On what basis is it transphobic? The algorithm doesn't even have tranny in there as a slur. There's these little nuances that the algorithm should learn, and this doesn't just apply to transphobia. It applies to racism, it applies to homophobia, it applies to sexism, it applies to a lot of things. This algorithm needs to be tweaked to understand the nuances of oppression, which, listen, when I heard that during the interview, my brain book title right there. But it's very true. I think this participant really captured something here, because this is obvious rank testimonial injustice, a complete disregarding of the testimony of trans women about what's actually offensive and harmful to us, even something as basic as what we consider to be slurs against us, encoded into the platform's key safety mechanisms. It's really no wonder that trans women don't want to use the reporting systems, if you consider that the first thing we tend to learn about them is that they don't know us and they don't care to, and are wired to disregard our testimony about our own lives and our own struggles. So folk theorization is a useful tool for fighting epistemic injustice, but it is not a panacea. And it's only a very certain subset of folk theories that actually help people find ways around platform-mediated epistemic injustice. with plenty of other folk theories out there that mostly just motivate people to give up, to accept the testimonial injustice from the platform, and deepen the hermeneutic injustice that stems from crucial trans feminine voices being silenced before they have the chance to reach and help others. How do we improve on that? Well, I've got some ideas. This is where we need to move up a level, from folk theorization to what it can eventually lead us to, algorithmic literacy. There's been a lot of talk about algorithmic literacy lately, and rightly so. It's a crucial literacy that I would argue we are far behind on studying, understanding, and boosting. And there's still plenty of debate over what our approach to algorithmic literacy should be, and perhaps unsurprisingly, I have a rather strongly held position in that debate. I've proposed that our standard for algorithmic literacy should not be a static set of skills, performance on tests, or batteries of questions, or even the much vaunted ability to code. And I know as a computer scientist, that's a surprising thing to be hearing, but I really don't think that'll do it. Our standard for algorithmic literacy should be structural folk theorization, because it gives the individual the tools they need to think strategically, to theorize about and react to causes, and to adapt their behavior directly to the algorithmic system itself. Structural theorization essentially gives the user agency, the agency to pursue their goals, which is the very heart of a modern literacy, and also our strongest tool for helping people fight the epistemic injustice they are faced with every day. It's not perfect. It won't solve all of our problems, but it is a start. And we know it can work because I've consistently shown through my own work that some folks are already out there doing it, already out there every day using their structural folk theorization ability to break through the hermeneutical injustice of opaque, unexplained socio-technical visibility systems. Of course, as I mentioned earlier, structural folk theorization is actually relatively rare. I'm unsurprised that trans feminine creators have unusually high levels of structural theorization because our lives are very much defined by our daily fight against epistemic injustice, down to the level of people claiming that we don't understand our own gender, our own sex, our most visceral lived experiences. But most people can at least theorize at a functional level. That is very common and kind of just part of the background noise of being a human being. And it turns out that the best way we know of to build up structural knowledge is to work from functional knowledge, because functional knowledge effectively preps the brain to retain and comprehend that structural knowledge if it is delivered well and at the right relevant time. By carefully exposing users who understand function to immediately relevant structural information. So that's what we're doing. And to my great and pleasant surprise, my group and I actually aren't doing this alone. To help build functional folk theorization into structural folk theorization and help reduce the ridiculously undue burden of work that structural theorizers now face as they use their folk theorization abilities to combat epistemic injustice, we need a clear picture of what's reasonable to expect out of the users of systems and support from platforms themselves as we figure out the right way to make systems more transparent, to embed the right structural information in the right time, at the right time, in the right way, so even average users of systems can pick up on it, which in turn will help platforms themselves perpetrate less hermeneutic injustice via increased transparency. My group's doing that right now alongside colleagues from Google Trust and Safety that have realized that algorithmic literacy would actually benefit all of us because an informed user base makes much smarter choices. It's exciting work. But remember, back at the beginning of the talk, I told you that this isn't a cluster of problems I can solve alone as a computer scientist, or even with the absolutely brilliant students in my lab and Google's help. That won't be enough. Because while algorithmic literacy is the centerpiece of what I think we need in order to help users combat epistemic injustice by providing hermeneutical resources, it's just one piece of a much larger puzzle. Think back to the experiences I recounted around trans health and medical information. Hermeneutical injustice due to lack of information, testimonial injustice because our own expertise is discounted by both doctors that refuse to listen and learn, no matter how much proof we provide, and content moderation systems that see our homegrown cultural health knowledge as medical misinformation. Algorithmic literacy can help us sidestep some of that epistemic injustice, especially when it comes to the latter problem, but it's not an ideal solution. And it really doesn't address the former problem at all. And the former problem is extremely serious because when doctors ignore patient testimony, sometimes people die. That's where health and data literacy come into the picture. Health literacy, which the CDC is currently defining as the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others, is already all tied up in epistemic injustice. And I urge health literacy experts to think deeply about how the types of epistemic injustice I have discussed here deny trans people, and trans women in particular, proper health literacy. Trans women are mired in hermeneutical injustice around our own health, and the testimonial injustice perpetrated by platforms deepens that hermeneutical injustice by cutting off the primary avenue of trans health information in the name of misinformation-focused content moderation. For trans women to have proper health literacy, this has to stop. And I genuinely think the only way to stop it is to band together. We are going to need health experts, health literacy experts, algorithmic literacy experts, system designers, all together to propose better evidence-based policies and better evidence-based ways forward for content moderation, because we can't drop content moderation entirely. There's legal reasons we could never do that. But we can, if we band together, change it for the better. As part of those efforts, we can also start addressing the testimonial injustice that is the fact that most empirical trans medical work is currently done by uninformed and often ideologically motivated cisgender people, without our input, without our permission, and without a single drop of respect for our lived experiences. One of my newest projects, alongside my lab and my colleague Ada Lerner's Privacy and Security Group, is the construction of a transgender citizen science pipeline that will directly combat testimonial epistemic injustice by giving trans people themselves the tools to participate in, scope, influence, and even directly lead our own efforts to replace a trans health canon that is almost entirely constructed of testimonial injustice with a just, accurate, high-quality empirical medical canon that is not just for us, but by us, with our testimony front and center. To make that work, we're going to need help. We're going to need help from health literacy experts to help us understand the right way to help this build health literacy as we go. Because as valuable as it is for us to be able to have high quality data to publish on, a key goal here is helping people immediately understand their health better and know what to do with their health data. Because they need help now, not later once we publish. They need it now. They deserve that help. And we're going to need data literacy experts too, because we're working with a ton of personal medical data here. And if we're lucky, we can serve the dual purposes of creating a pipeline that not only respects data ethics and secures data, but also helps the users understand the data they're contributing, how to use it, and why it's important, while drawing their own interim conclusions and communicating them to others. It's part of an enhanced version of the community sense-making that already happens in trans feminine spaces and is a direct bulwark against hermeneutical injustice. Now, finally, in a socio-technical environment that perpetrates epistemic injustice and with a medical system where medical transphobia is run-of-the-mill and hardly improving, we also need to invest in solutions that let trans people and trans women specifically take back direct control over our visibility, our information, our communities, and through that our health, our hermeneutical resources, and our ultimate destinies. Two of the most promising directions forward involve community-based content moderation and the curation of semi-private, locally controlled networks through tools such as Fediverse platforms. Community-based content moderation can directly combat testimonial injustice by putting local expertise, local testimony in the driver's seat. Building semi-private, trans-focused spaces via specialized Fediverse instances can serve a similar function by taking the entire mechanism of socio-technical visibility and putting it directly in the hands of community members at a core administrator level. However, both these approaches have to take into account that marginalized groups are not monoliths, and local knowledge from one member of a group might contradict local knowledge from another. This is something we're already seeing in a recent study by my graduate student, Erica Melder, where Fediverse instances that are specifically for queer and trans mutual aid sever relationships over cultural and values disagreement, which is an act that is protective, but which also runs the risk of creating more hermeneutical injustice by cutting people off from the information and resources they need to make sense of their own lives for an entirely new set of reasons. We know how to make these systems better at a technical level. I'm working on that part right now. But the only way to make sure that these new approaches to socio-technical visibility don't become their own engines of epistemic injustice is to reinvest in cultural and media literacy training. So people don't see an offhand comment, don't see a reference that they don't understand and assume it is an attack, because this is an environment where you have a reason to assume attacks are coming. We essentially need to reduce the perception of friendly fire to make these things work. Overall, I believe that by taking a multi-literacies approach, we can do a hell of a lot to directly address the epistemic injustice perpetrated by our current socio-technical landscape. Computer science can't do it alone, nor can any other one field. This will have to happen with genuine partnerships and genuine interdisciplinarity. If we can manage that, we can secure socio-technical visibility. And in doing that, we can actually help a lot of folks who are just trying to figure things out and be heard in the context of their own experiences.
Thank you so much, Dr. DeVito. That was amazing. I think I had goosebumps in the first 2 minutes of your talk. So we're going to have some time now for Q&A. So if you, as it kind of all dissolves into your brain and you process it, please throw those questions into the chat. And I am going to get us started because I have quite a few questions for you. So my first question, as a staff member who isn't focused on this particular field, or as library staff members, what are your recommendations for individuals like us who want to support marginalized communities like the trans community, and also to develop the tools for them to learn this algorithmic literacy? Where do we get started?
It's a really good question. So one thing we're doing is we're trying to develop deployable toolkits. We're being very careful about it because we don't want what happened with media literacy to happen. You know, I was in high school when the first big media literacy push happened, and it was not fair how we just kind of dropped resources on, you know, the media center person at every high school in America and just said, make media literacy happen, please. Obviously, that didn't work, right? We're still kind of trying to work through that. What you can do in the moment, a couple different things. I think the first thing to do is, if you hear students puzzling over, you know, how these systems work, or if you get questions about how these things work, encourage people to do as much sense making, like in groups and as themselves, as they possibly can. You're going to want to find those places where they kind of see there's a problem, right? Because that's functional knowledge. You want to find the problems they're seeing and encourage them to ask the questions that are why and how questions whenever possible, right? Because people are actually very clever. You know, I've seen high school students do this very easily. If you just push them a little bit towards, okay, but think about why that is happening, which, I mean, you're already hearing this is like a classic critical thinking approach. That will help them start building towards an actual algorithmic literacy. The other thing to do is to kind of keep the misinformation out of there, have them question their sources. One thing I do a lot with participants is I really dig into why do you think that? Where did you get that information? Having them question their sources on what they think is going on with the system is extremely helpful, because it will help them become more critical about the information they're getting. I mean, part of this is the classic critical thinking problem. The other thing that can be done that will specifically help, you know, trans students is to make sure that you are helping them fight that testimonial injustice that they are just surrounded by constantly. You know, I do a decent amount of mentoring in this area, and the younger people I encounter when I'm mentoring mostly just would like one adult to not contradict them about their own experience, because most of them have never encountered that, like never in their lives have ever encountered that. Hearing them out, relating to them without contradicting them, that can actually be incredibly, incredibly helpful. And it's also a good way to kind of model culture, you know, how a good approach to cultural literacy. You know, if you're not part of the culture, the first thing you should do is listen instead of form an opinion, which is, you know, the internet as a whole kind of delivers this message of just get a hot take, get your hot take ready, and don't bother listening. We need to counter that. We need as much messaging as possible to counter that. But I do think what we long-term need to do is have comprehensive toolkits that probably can be used in the classroom, can be used by, you know, advisors and that kind of thing, but that at least partially, if not primarily, live embedded within the systems themselves. I mean, that is the biggest thing we need to do here. We need to get platforms on board, because they are in the position to actually put the information where it needs to be. And, you know, it's also their fault. So they should probably help us a little bit. Still convincing them of that. That's a little bit of a hard sell, but, you know, I'm working on it.
Well, and we appreciate you for your work as well. So the questions are starting to come in. So next question, the problems and themes that you discussed parallel and overlap with issues that fat women, disabled people face on a regular basis. Have you encountered any of these parallels or interactions within your research? And are there plans to expand into these parallels, overlaps, or interactions?
I have encountered them so much that I had to cut 5 minutes about medical fat phobia out of this talk to make it fit. So that's a big, big yes. So as you know, as someone, this is something that I have actually been talking about a lot lately in the trans feminist community spaces that I frequent. One of my friends recently put out there the notion that fat women are the trans women of cis women, is how she put it out there, which I kind of love. The parallels between the experiences of trans women and the experiences of fat women in particular are the Venn diagram's a circle, essentially, right? Like the exact same forces act on us. And when it comes to epistemic injustice in particular, we are ignored the exact same ways. Our thinking is discounted, our evidence is discounted in the exact same ways. So, I mean, the overall answer to that is yes. As I expand out, this is the beautiful thing about now being a professor. I get to hire all these great students, each of whom expands out into their own, expands my kind of interest into their own areas. We are absolutely, like, one of our first focus points is on fat people, especially fat women, because the overlap is insane and the solidarity should match it. We are also looking into this in the disability space a little bit. That is a thing we have a lot of competency around here at Northeastern. So I'm making some partnerships with professors here in Corey who do that. And I also am working with some students to look at this in the case of Black women, because if you look at certain areas of medicine, medical racism it's an insanely damaging thing, especially when you think about like the differences in maternal mortality rates between Black and white women, right? That is, again, an epistemic injustice problem. Their testimony is being ignored and the information really isn't out there unless you can get it from cultural spaces, right? I think trans women, fat women, Black women, we all have these experiences of the only reason I'm alive is because I learned something from a cultural space and insisted the doctor check it. That is a very common story for all of us. I do work as a member researcher primarily, so I do it with my own communities. But that doesn't mean I want to limit things. It just means I'm the expert there. So I think the way forward on a lot of this stuff is recognizing the deep similarities between marginalized groups and practicing solidarity in that sense, not just as we're going to support each other in the abstract, but as the form of we have the same experiences. Let's fight this fight together in a material way.
Excellent. Thank you. So we have time for maybe 1 or 2 more questions. We have one here in the chat. So you spoke more on moving on from the functional folk theorization towards more actionable structural folk theorization. It made me wonder about that category of demotivating folk theorization and how that works. Do people move between demotivating folk theorization and functional folk theorization, with the demotivating aspect showing up in just certain aspects of what they do online? Is there something that can or should happen to move people from demotivating folk theorization to the more active and structural forms?
Yeah, so the thing that annoyed me when I first did all this work is that at first I thought structural folk theory solved it, and then I realized, well, if they're demotivational, it doesn't actually matter that they're structural. The way I've been teaching this in computer science is demotivational folk theorization is a thing you should be looking out for, and it is your cue as a designer or developer that you have a misinformation problem within your system. Maybe it wasn't deliberate, but you essentially have some aspect of the system that is delivering the wrong message. So the first step in combating demotivational folk theories is embed the right information there, right? This is actually, I think, the single biggest wedge I'm working on with platform companies right now. Once I told them about the demotivational folk theories, then they started caring, because that was an immediate, oh, people don't use this system because we have made them think it's horrible, and all we have to do is change the messaging around that, right? Sometimes it is really as simple as change the messaging around it, explain what's actually going on. So it's actually a relatively simple thing to fix, and I'm teaching it in a computer science class now as a troubleshooting tool primarily. In terms of moving people to functional theorization, I think that is really about, we don't know the exact right places yet, but that is really about on platform embedding of information, because you have a choice right now as a platform, for someone who runs a platform right now, right? You can either embed stuff, or you can leave people to fend for themselves. And what they will do is they will go to Reddit, and Reddit will not direct them in the correct direction pretty much ever, unfortunately. So all you can really do is have more explainers in your actual system. The first time someone hits a feature, there should be some sort of explainer for them. Video games actually do this way, way better than social platforms. And we can actually learn a little bit from, how a video game teaches you through the tutorial. It's right there, and we're missing it for platforms. I think there's been some attempts to do this in the past. I'm thinking of the Facebook privacy dinosaur, right? They had a little dinosaur character that tried to educate you about privacy and security on the systems. The problem was it wasn't something people really took seriously, and it was sort of off to the side, right? If there's a little help character that pops up, people are going to click it off, and then it's gone forever because they're thinking Clippy. They're thinking this dinosaur. It needs to be embedded right where the problem is. It can't just be this separate thing that everyone can ignore. It's got to be right in front of you. And it's got to be almost obnoxiously in front of you sometimes. We will, of course, have to tweak it as we go, but I really do think that that's the key thing I'm trying to do in my own personal research right now. What are the exact right spots for intervention? And once we work together to figure those out, it's actually really standard HCI work to integrate them into the system, right? This is actually something that's not hard to solve on a technical level. Part of why I'm so excited about it, right? My colleagues work on problems sometimes that are, like how do we turn AI into an actual mind that, is a living thing? I don't have to worry about that kind of stuff. I just need to figure out the right places to embed information that gives us more agency. And I think that's what makes me very hopeful about it.
That's a great message. I never thought of it like that. Well, I would like to spend about another hour with you, but unfortunately we are out of time. So I am going to hand it back over to Dr. Maybee to close us out.
Okay, thanks, Bea. Well, what a fantastic way to end our symposium. Thank you, Dr. DeVito. That was quite amazing. Let's see. So, I feel like I just want to end by doing some thank yous. I think first off, I want to thank all of the incredible presenters that have shared their time and their knowledge with us today. It's really been an amazing day, I think. I'd also like to thank the Institute team, which is Bea and Rachel and Secret and Aly and Mike. And Bea has really, as I said earlier, organized us and taken the lead on helping us put together the symposium. But everyone has contributed in amazing ways to bring this off. So thank you. And of course, I think the last thing I want to say is thank you to all of you, right, who came and joined us today. So I'm very appreciative of what we've done together. So thank you. And I hope that all of our paths cross again very soon.